Okay. All right. So I'm glad that everyone's here today. This is a presentation by First Alternatives and by me to go over not only the Avazzia technology, but also the science behind it, the application, advanced techniques, and the utilization of it. So we want to make sure that we come out of this with a couple learning objectives that are key. So this is kind of the course overview, as you'd say, for the next 8 hours of what you're going to be into. We're going to go over the technology first. We're going to do kind of high level deep dive into the tech. So it's gonna be a little bit different than what we usually do in terms of the degree of foundational of science, what we actually cover, but it's gonna be good. Then we're going to go into understanding the equipment. So we're going to go over every aspect of the technology in the device and how to actually get your best, the best out of it. And maybe if people were missing it before, we'll actually cover and be able to go down into it. Then we're going to go into the practical applications and the usage and techniques. And then once we get into a basic understanding of how to use the technology every time for everything, then we'll go into advanced techniques for more complicated issues as we come across. So this is more specific to different issues. And then after that, we'll cover Q&A for professional practices and how to get the best out of the technology, how to make sure that you're mitigating all the different concerns, and then what you can pair the Avazzia technology with to get the most out of the technology and the practice and your therapy as well. So it's all in conjunction because no medical therapy lives in a vacuum. Now, I know I do speak fast, um, and that's why we have a recording. So everyone is going to get the recording, hopefully on a reasonable time. Um, but if at any point I say something too fast or I glass over something, feel free to unmute and say, "Hey, can you repeat that? I just want to double check on what you're talking about there." Okay, that's perfectly fine. If my mic ever cuts out, write in the chat because I might not be paying attention to the actual, noise monitor. And I just want to make sure that everyone, we're not wasting time and we're getting the most out of this experience and the next few hours. Okay, that. So I wanted to outline a couple of the objectives for today of what we're expecting to learn. So I want everyone to feel confident using technology. If you come out of this and you don't feel confident with either the technology or the protocols that we're talking about today, then we're going to spend extra time one-on-one to make sure that we get the most out of that experience and the foundational value of, hey, I know when to use this, how to use this, and why to use this, and I feel safe using this device because the Avazzia technology is so wonderful and so easy to use that if you don't feel confident with it, it's really holding you back and how you can actually get the value out of it. Additionally, I want to make sure people understand the value of painting. We'll go over the terminology of painting, but making sure that you do have self-care and you do have care of others in mind when you're painting. And just turning it on and putting it on is a huge, huge issue that people, have to overcome, which is the funniest thing is, oh, I have a device, but I never use it. It's like, well, what do you mean you never use it? It's like, you have a whole spectrum of time that you allot to your health. It's like this would be one of the primary things you allot. Um, yeah. So the next learning objective is to understanding what the device is and is not. So there's a pretty clear disconnect sometimes when people think about the Avazzia and they think about a TENS unit. And so I wanted to actually go in and cover the particular science behind, what the give me 1 second because I just realized that the volume is a little low. Okay, so is that better? You guys hear me a little bit better? Okay. All right. So uh, there's a big disconnect between what the technology is and isn't. It's not a miracle device. It works on physics. And whenever you have healing based through physics, you get this situation where, it does exactly what it says it does and nothing more. So we have to be very careful about the line of, hey, this is what it's doing and this is what it's not doing. and then connecting those dots across the board. We want to also understand how to use the device for pain care, pain mitigation. The device is very effective for pain mitigation. That should be the first issue that you cover in terms of getting confident with the device is saying, hey, I feel confident that I can help people with pain. So making sure that we improve our overall efficiency and efficacy of using the technology. We want to make sure that we learn all the key protocols for the level 1 class. Yep. And then some advanced protocols as we go across. And then I hope that we're probably going to spend an hour in one slide, but I hope that as we go across in the frequencies and the modes slide, that we cover every mode specifically and in depth, so where everyone feels comfortable with the understanding what to use and when to use it. And then, of course, just understanding how to use the device, from basic operation to complex, turn it over. So what makes me qualified to talk about this? So I have a background in computer science and operations research, degrees in that said field, and a technical background in robotics, engineering, and AI. So I did not invent the device, but I've worked closely to write protocols for the device for the last 10 years, to work closely with the creating team, Tim Smith, as well as the First Alternatives team to actually get a lot of the known protocols out into the field. I've, probably anyone who's called into the office has probably heard my voice before, answering various questions across the board or trying to get emails back to people in terms of, best known answers. But my focus is less on the intuitive side of healing and more on the foundational, less inductive, more deductive, less guesswork, more this is what it is, right? And I really do feel that if we can really make a difference in healthcare, it's going to be on a physics-based level where we know it works every time. We don't have to guess. And that's kind of the technical background. On a personal note, my experience with Avazzia occurred more than a decade ago when I was essentially partially paralyzed from an adverse drug reaction I had junior arthritis from taking a drug called Singular, and it's a anti-asthma drug that lowers the amount of mucus in your body. And essentially, it makes it less viscous, and it helps you breathe better. But unfortunately, it also diminishes and causes inflammation in the joints, which then triggers, whole problems across the board when it comes to, oh, let's see. Sorry. Let's see. Back to there, which causes whole problems across the board when it comes to actually walking and moving because everything hurts, right? And my mother, who was experienced with pain medicine and the practice of therapy, she spent about 25 years as a massage therapist for a hospital system, as a medical massage therapist. She came across this technology and used it to straighten my spine because I had essentially scoliosis that formed over time because of the hacking and the coughing and just the compounding issues. And once my scoliosis was gone, I didn't have to take Singler anymore, and then my joint pain went away. So I went from being partially paralyzed in just complete pain in every motion, not being able to walk, consistently all the time, to, running marathons in a matter of 2 years. And it was such a frustrating experience on a personal note to know that this technology exists out there functionally and can be used very easily. It wasn't, and my mom picked it up within, 2 months. She was off and working on more than 100 patients, and that type of experience of saying, well, wait a second, we can completely change someone's life in, it was like, I think it was like 3 hours of therapy. And it's just absurd. It really boggles the mind to think that there's, the, uh, that this technology is out there and that we're not using it. every day on our patients and on our friends and our family, because it's really important that we actually do go ahead and seek that. Oh, give me 1 second. I want to make sure that this. So my background has been as a patient and as a a protocol writer and as an engineer. As my life has been very impacted by the Avazzia technology, and I'm very happy to be here and sharing this technology and sharing this information with you, because I know that um, they say it's like the degrees of Kevin Bacon, that everyone knows someone who knows someone, and eventually someone with you're always within 6 degrees of Kevin Bacon is the common joke. But the concept here is that, look, you may not know someone who's directly in pain or has problems uh, with their fascia, with their spine, with scoliosis, with arthritis, with all these different issues, but you might have a friend who does. And the more confident you are about talking about these issues and talking about the technology that exists, the more that you share with that layered network of people, and eventually you find the people that have problems. And we know that we connect and touch so many people's lives all the time, every day, casually, because of how many degrees of people we talk to. And it's absurd to think that we don't share this technology because it has such a great benefit. So I really want to make sure that you're confident in saying, hey, I know I can help people. And if you're confident with it, then you'll actually feel confident sharing with others. And that's where we really feel empowered in making a change in healthcare. Um, and then
Hey,
additionally,
Brendan,
yep, yeah,
I, I just wanted to say to the others, please don't ever underestimate what this can do. I'm not a medical doctor. I'm not making any claims. I have had people that have had their cataracts and their eyesight get better from routinely using this in my practice, and their thyroid. And I've seen eyebrows grow, hair grow on men, from doing the facials, so just all of it. Don't underestimate this power.
yeah. And that's it's one of the craziest thing that harkens to. And this tangents are completely acceptable during the presentation. That harkens to the idea too that one of the main problems with degradation in the eyes is essentially your the tear ducts get blocked or impeded, and there's scar tissue that forms over or impedes the ability to hydrate the eyes. So the Avazzia can help decrease scar tissue, can decrease fascial restriction, and help the flow of that mucus hydrating like teardrops and tears. So it can help reduce degradation and even reverse it in some cases because of how those antioxidant agents interact and help recover the lensing effect. But that's thank you for sharing, Lori. There's definitely This is definitely some powerful stuff, and you know and we'll cover into it further. We have a whole 8 hours to share about a lot of different things for certain. So just to cover, so my background in robotics, I literally would build complex machines and scanning devices uh, to figure out what's going on underneath the hood and to basically find all the information data that we can. And I have a thesis in, my main thesis I wrote up one was how can you deliver 1 million chocolate bars in under 10 minutes, right? Well, in the same caveat, I wouldn't really understand, but years later, a decade later, when I'm actually in industry, thinking about, well, I guess on the small scale, our body is delivering trillions of packages of resources across the board to the cellular structures, and the nervous system is acclimating that as well. And so a lot of my computational background has been readdressed and reoriented for the medical industry, which is always an interesting fascination to say, well, I know exactly how the body's functionally aggregating these resources and pulling these structures because it makes sense to me mathematically. And I could show you, and we'll get into it, but I can show you some very interesting traveling salesman problems about how the body really goes hard on or really dives deep into the mathematics of how to optimize delivery and the systems of delivery, because the body does a really great job of uh, mitigating that. But that's my background. This is the schedule we're going to try and follow, but it's we're going to see it out. I'm gonna ask periodically, when is it acceptable to take a break? If people need a break, just feel free to raise your hand and say, hey, can we take a break? That's more than fine. I'm going to speak pretty fast during this presentation, so we're probably going to be ahead of time. Usually Brenda's slower. So if anything, we could take extra breaks along the way. It just depends on what you guys are feeling. Okay, so the legal preamble. So this is just point zero. We have to preference this. We're not. I'm not your primary care provider, so I can't make medical claims, and I can't make medical claims in general, specifically to say, hey, this is a cure-all for XYZ, right? So this is my experience, either through demonstration, practice, or protocols. And like I said, the right tool for the right job is usually the best uh, message for what this technology does. So the Avazzia really helps with pain mitigation and management through the treatment and therapy of the nervous system, right? And we're working through the body with the body, not against it. And so when we talk about what's on scope and what's on label, that's what's on the scope and label for the device and technology. Uh, when we dive off label, that's information that's not necessarily reviewed or approved by the FDA. So when we talk about, cataracts, improving cataracts or improving scar tissue in specific ways, that's not necessarily that the FDA has approved or cleared that. We're getting secondary effects from the primary instigating change, which is essentially to say, hey, this happened because the nervous system's improved. And if the nervous system's improved, then we're going to get improved change over here. That's not a medical claim. That's and this is another regard is that, you know, when we talk about diagnosing things, unless you have a medical degree, if you're an MD, DC, DO, you shouldn't be diagnosing diseases. You can use a lot of the technology to indicate that certain things and certain issues are there, and but you're not diagnosing them. You're not going to say like, and I can example this or preface this by saying when I demo on people during trade shows, I would I would it's surprising almost to see the amount of people that have undiagnosed neuropathy, and I can't diagnose them because I am not their primary care provider. But you know, you can tell uh, when someone uh, essentially has what you would call lack of sensation, numbness, the inability to have connectivity in certain nerve centers of their body, and the restriction across the fascia. Well, that's most of the time it's going to be neuropathy, right? Now, it could be sciatic style nerve impingement. It could be a couple different variations, but you're not diagnosing them because you're not the practitioner. If you're the practitioner, well, then absolutely, you can know that, hey, you can diagnose that, and then you can say, oh, there's protocols for that, and we do have protocols written up for those diagnosed diseases, and that's the preference in this. Um, uh, you know, Avazzia is a manufacturer. So the goal of Avazzia is to be a manufacturer. They're not in the practice of medicine. In fact, they say that specifically as a company, their goal is to create great devices and technology. The goal of the practitioners who use their technology is to come up with the protocols and the utilization. They want to stay as far away from the practice of medicine as possible. Less because that way they essentially they have to less responsibility on the burden of the FDA to review and to check all the claims that they make, which is fair. But it also means that they don't want to get involved with the individual utilization of their technology. And this comes all the way up from the top of the company, the inventor Tim Smith, who I'll cover in a later slide. He's an engineer. He's not a doctor, right? When he created the device, he said, "I don't know how to use it. I know how to use it just enough to make sure I'm out of pain, and I know I can trust the technology works in the way that it does because of physics. And I will share that he says, but to a dying breath, I'll share that it'll work, right? But he says, I still discover every day utilizations and usages that I just could not possibly believe can be used for that. And if we had $100 million to go invest in clearances, it would be a different story. but we have only so much money, and so we got the main primary thing was mitigation and management through the treatment of the nervous system, right? And that we'll cover that in the later slide as well. This is also a preference because it is being recorded. If you do find that anything is said in the recording that you want to have taken out later, we can do that. In preference as well, you can share stories. It's all anecdotal claims. There's no medical claims. So just like Lori was saying before, it's like, hey, this is not meant to be a claimant, a medical claim to say that we're X does Y, right? Okay, then next. Yeah, so and this is more of like the ethical nature of this. So when we talk about treating a patient versus demonstrating on a patient, there's different responsibility tiers, right? So as a practitioner, you can treat a patient with the technology perfectly fine. As a representative of First Alternatives, you can demonstrate on a patient. There's a difference in how you would charge, right? If you're demonstrating, you're not charging. If you're working on a patient, and demonstrating and not charging for the time, if you're working on your family member or friend, that's for personal use. It's not as relative. But there's a degree of responsibility. As a practitioner, you should know that the responsibility is to say, at least explain, hey, this technology is X, and that I am treating you with this technology for the labeled use of Y, right? Whether that's, and usually what you're going to say, and we'll have a one-liner, is like the Avazzia is a next generation TENS device that uses advanced medical technology to establish a connection with your nervous system that improves and optimizes how it functions, right? That's an easy one-liner, but it's pretty long. But I have a better one that's well thought out and written here. But you have to explain to the people you work on what you're doing. It's best not to leave them in the dark. And then right, and as far as different things to do with medical claims and observations and billing issues, there are certain CPT codes for insurances now that cover a lot of the technology. There's also VA coverage with the technology as well, but it does require specific licensures and practitioners licensing to get those covered appropriately. And diagnosing is not a part of the Avazzia technology. We're not, you're going to get readings back, you're going to get scores back. Those are not meant to diagnose specifically from the device. As a practitioner, you can use that information as you need. And if you do have the credentials to diagnose, then yes, great tool to actually use in validation and verification. In fact, one of the biggest things that I find a lot of the time when I explain this to like a chiropractic, someone with a chiro background, right, is, we'll go ahead and during the reactions testing, we'll test one side and then the other, and then you'll see that one side is significantly higher in impedance and resistance across the board. Well, guess what? That means that they have an asymmetrical load system that's somewhere in the spine is off. Well, that can indicate that they need an adjustment there, right? It's like, okay, well, it can also indicate that they have spinal stenosis in some cases, or indicate that they have scoliosis in other cases where they have improper fulcrums on the basis of that, right? And so not used. We're not, the device itself isn't diagnosing. The practitioner is going to take that information that they know in their personal practice and then use that to diagnose. Oh yeah, we have a waiver. It's on our website. Go to First Alternative Therapies/forms. We have a waiver that you can use. It has all the things that are contraindications and cautions. It has it broken down very easily for patients and for your personal use. We share it with you because, one, we like to make sure that everyone doesn't have to stress and worry. Avazzia, we've never had a claim. So as of yet, and this is a cross your fingers, and I really hope that there's no instance of this ever happening yet. But as of yet, there's not been an adverse reaction reported for the Avazzia, and with over 30,000 units sold. So that's a pretty good metric for standard deviations of disaster, right? If 0 people have reported that, and in effect, a functional more than 100,000 people are being treated a year with the technology. If 0 people are reporting an adverse reaction to the FDA to any legal institution, you have to know the technology is doing something very effective and not doing something non-effective, right? So it's not causing any disasters that we can find. And the science supports that. It does exactly what it says it does in terms of really improving and optimizing the nervous system. If the nervous system's working, it is a pure benefit. It is in most cases, to all cases, as long as you follow a couple of the contraindications, which we'll get into. Um, like I said, but it's always good to have a waiver, no matter what. That's not something that you uh, are gonna stress about at all. And then, oh yeah, and less is more. Like when you're actually working on someone, you may think that you could do more work that would benefit them, and you would be right in most of the time. But there is a diminishing law of return when it comes to the Avazzia. So most of the work is done in the first 5 to 10 minutes. If you're spending 2 hours with a patient, you need to be trying new protocols out. Don't just keep repeating the process because that's not going to really change the significant outcome. Um, okay, information provided is not substitute for medical. Yeah, so this was in the original slides. Um, there's a fundamental belief that a good lab workup and a good primary care practitioner they can't be replaced. And I do believe that there is a place for uh, uh, allopathic medicine in the healthcare field. And I do believe that getting tested and having a very firm understanding of what your metrics are also important. Um, but in some degrees, the Avazzia, it does replace and substitute in terms of nerve damage and scar tissue and fascial layers. So that, it's always a degree of proper medical device, proper field, right? And then of course, try not. Uh, you're gonna have the slides. I think I sent to everyone the slides. You can download. You can follow along. I don't know if they're gonna be as updated as these ones, because I was literally working on these last minute as of even today. So I'll reattach them in the recording email so everyone has access to them as well, just to make sure that we are all on the same page. But please don't publish these online, because we really prefer not to have this out into the ether without proper opinion and control and review. Okay, so what's on the waivers and why are there contraindications or precautions? So this is a list of all the cautions and precautions. I sorted them by color coding them from red means, hey, it's a hard stop, where we want to figure out if we can get a primary care physician to sign off on it, if we can get approval from a co-device manufacturer. It's something that you stall with because you want to figure out, is there a better way, and am I doing the right way? It's always best to ask. Um, Orange is, it's not a hard stop. You can work with it, though there is a consideration that you should be cautious of. And then green is, hey, it's perfectly fine. It might alter how you go about working on someone. So let's first tackle the reds. So cardiac pacemakers, this is a caveat from one of the original TENS units having a high induction feature, which we'll cover in the science of it. But what that means is it will interact with the pacemaker, the electronics behind the pacemaker, and interact with the scar tissue that's plugged in and the cavity that's formed for the pacemaker. The microcurrent devices that we have nowadays with the Avazzia don't interact necessarily with the pacemaker, but the problem is the FDA has required that any interaction has to be stalled and get both the primary care practitioner who's responsible for the patient, as well as the manufacturer of the pacemakers approval before you work on that patient. Now, in every case where we have submitted to the manufacturer of the pacemaker, we've been approved. Um, there are several cases where primary care practitioners just don't know what the technology is, where they have stalled and said, well, I don't know what this is, I don't trust it. And then we go ahead and explain it, and they said, oh, okay, it's fine. It's not a hard red line where it's impossible. It's a precaution, it's a contraindication and a caution from the FDA side, where this is what you want to do if you want to be 100% safe and 100% in control of the situation. Yeah, the same thing with pretty sure active cancers is on here as well. Yeah, cancerous lesions. That's also one of the cases where you want to get the oncologist or the primary care physician involved. But okay. Next one. So pregnancy. So there is a 1990s study that was released on inducing labor with microcurrent. And because of that, every microcurrent intense device on the market had been stalled because they don't want to cause complications with pregnancy. It's also the case that it is a general requirement for the FDA that anything that is put on a pregnant woman's body has to be tested on a pre-tested study with pregnant women. So we haven't done that yet. But I would say, that one is a caution where you want to get a lot of approval and you want to stay away from the ankles. Is the secondary mindset, because in acupuncture there's actually several points in the ankles that will trigger labor, and we don't want to trigger an early labor for pregnancy, nor do we want to harm the baby or the child in any way, shape, or form, or add complications to it. In experience, treating away from the womb is fine, and getting approval from your primary to do so, and but we've had patients who've given birth and have uh, worked with us, as well as we've had practitioners who just refused not to use the Avazzia. They were, I have like two cases of people who were pregnant and they had bad back pain, and they're like, could not, they couldn't fathom not using their Avazzia unit to really to address the back pain on what they were dealing with, and even though and so they took the risk themselves, and there's zero complications to that. But of course, it's just one of those things that's not FDA cleared to do. So that's why we want to preference that. Cardiac fibrillation. So any problems with the heart and regulation with the parasympathetic is always going to be a caution. So when and that that goes for roller coasters as well. Like don't get on it if you have heart problems, right? The caveat of that is that's a FDA requirement, but the secondary notion is we are going to interact with the parasympathetic. In some cases, we will help regulate the heart. In other cases, it's going to be if you're doing like the vagus nerve protocol, it's going to be quite stressful on the body. So you want to have on the lower end of everything when you're actually working with someone who has, significant heart problems. Okay. Organ transplants. So if you have an organ transplant, you're taking immunosuppressants. And you're taking immunosuppressants because you have the chance to reject the organ. The body does not understand. It takes about 4 to 6 months for the body to accept an organ. That's in the perfect case. It could take up to 3 years. But in when you go into the organ acceptance process, scar tissue forms around it, different genetic materials get slotted out, different agents get sealed. That's when people have organ transplants, that's what they're really trying to work on, is the scars around it. And what we caution in extreme cases not to use the Avazzia until they've confirmed that the organ is accepted, and because the Avazzia will ramp up the immune system, and I'll go into that science further, but it really does increase the efficacy of the immune system significantly. And if you're taking immunosuppressants to try and lower the efficacy of your immune system, it's very contraindicative, and you're getting the opposite of what you should be doing at that point for that case. And I feel free to answer any questions on that. But the goal there is, look, we don't want to have instances where the organ gets rejected, because that's disastrous, right? And we want to make sure that any therapy and treatment is for the benefit of the patient always, not just for the cosmetic idea. Oh, I'm getting rid of the scar, or the inflammation, because scars create inflammation as well. That that's also a health benefit, but organ failure is worse than passive inflammation from a scar. Recent surgery. So this is an opinion and also a caution from Avazzia. if you've had a recent surgery and there's still stitches in, it is better to wait for the stitches to be out and it to seal naturally and then work on it. Because one, lower chance for infection. Two, um, when you essentially when you have the Y bar and you're painting around it, or if you have pads, you increase the chance for infection. You don't want infection, right? That's a disaster. That it hurts the body, decreases recovery time, you know, or decreases recovery efficacy. So it hurts the body overall. So um, you really want the body to, you really want the body to be in a state where it's triaged as much as it can do now, and then it's waiting for the next line of nerves to be reconnected. In that case, it's usually 1 to 2 months after significant surgery that you can work on a scar. Though the earliest caveat to that is stitches are out, everything is sealed, there's nothing that can leak. Is the interesting term to that. Like the leakage is the feature that you really don't want, because the Avazzia really ramps up a capacity to flow into the region, and if there's the possibility for it to leak and gunk up, it will. And when we cover open wounds, which should be in orange there, but when we cover open wounds, um, it's gonna pus. It's gonna pus up, and you need to be focusing on having a good drainage care specialist there, because of the fact that the Avazzia is really just drawing so much resources to that area. And then when it actually pusses up and cures over and works from the inside out, you see a significant difference in the actual ability. And I'll show you images of that as well. So that's something to be cautious about. That's just the red line of saying, hey, this is a contraindication. Don't do it right before surgery. All right. So further oranges, alcohol and the Avazzia do not mix. It's not terrible, right? You'll get nauseous. That's the side effect, because the alcohol is a dehydrate. It dehydrates you. The Avazzia runs on water. Your nervous system runs on water, right? So if you are dehydrated and the Avazzia is further going to dehydrate you because it is going to activate your nervous system, and your nervous system uses that water, well, then you're just going to make yourself very dehydrated, which causes you to have nausea, right? So now it's not going to be terrible, and you would have to use it for at least an hour or two, but it's something to be cautious about, right? And it actually lowers the efficacy of the therapy uh, with when a patient's drinking. It really does, and in fact it lowers the efficacy of the Avazzia when a patient drinks the night after the therapy, which is hilarious because you don't want to recommend, hey, don't have a drink, right? One drink's fine. But the Avazzia continues to work over the course of 2 to 3 days after the intervention or the therapy session. And when you dehydrate your body and impede the nervous system from functioning, it's going to impede the efficacy of the technology, right? So it's going to slow the recovery time. That's interesting not to think about, right? You don't want alcohol to impede your recovery. So and the secondary caveat there is if you drink enough water to counteract the alcohol, yeah, it's fine. No caution. But something to understand that is an interplay. Anything that dehydrates you is going to interfere with the efficacy of the Avazzia. Okay. So the high and low blood pressure. So I highlighted the high versus the low. Um, Sometimes the Avazzia, depending on arterial areas where you will work around, will regulate the blood pressure. And if you go from a high to a medium position, it could cause you to get woozy, and faint, in the worst case. But most of the time, you get, the essentially it's like the God, it's the you get the shudders effect, right? And it just when you're working on someone with high blood pressure and you're working in the neck area, just make sure you stand in front of them in case they do lean forward. And just that's a recommendation. It's happened twice in 10 years, but in both those cases, thankfully, the therapist was like during the trade shows, therapist was standing in front of the patient. So when they toppled over, they caught him. And they're like, what happened? It's just the person had a very high blood pressure, and then it actually regulated and brought it back to equilibrium about the pressure. And that I'll get into the science of how that actually works, so that when they were regulating, they essentially de-stressed, and then all of a sudden they just collapsed, right? Um, and then low blood sugar, uh, your body might uh, your body might want a snack, so it might distribute as you get into vasodilation in certain sectors. You're going to drain resources, so it might lower the blood sugar a little bit. So you just want to have snacks around. Um, Also, as a caveat, it might also make you go to the bathroom. So whenever you have blockages in the stomach or in the lower back area, sometimes that'll increase the proclivity for you to want to go to the bathroom, which means if you are a therapist and you're treating someone, I would not recommend treating someone in a place that doesn't have a bathroom. That's a clear thing. You should probably have a bathroom to relieve yourself somewhere. Is the quick recommendation and tip there. Um, severe mental disorder. Okay. This is an orange. It didn't used to be an orange, but we've had several experiences while actually running a clinic that made us very aware of the need to make this an orange and the caution. Because some people, uh, the Avazzia is very effective at what it does. And some people like their pain and they don't feel comfortable when there's not pain. And that is something that was hard for me to understand personally, because as soon as I got out of pain, I was like, this is amazing. Like life is great. But other people tie their identity to that pain and they enjoy suffering, which is absurd, but it happens. And when people have severe enough mental disorders where they crave that pain and it's gone, it causes them to have panic attacks. So you want to make sure that if a patient does fill out on a waiver that they have severe mental disorders, they don't have severe mental disorders tied to the characterization of personality attached to the pain or the strain. Um, and this is prevalent because the Vasi will also get rid of the strain, right? And if in their head, hey, I was very sensitive and I was very easy to react and I felt everything really acutely, and that's the sensation that made me feel comfortable. I thought I was a superhero. It's like, no, you're just in tension all the time and everything hurts all the time. So your body is acutely aware of it. It's like, that's terribly unhealthy. That's not a superpower. That's you triaging a disaster, right? And that's a mental disorder, right? And you need to have a practitioner who's specialized in addressing patients with mental disorders. I think and you can refer out and work with someone in your area who helps with people who have like a therapist who has experience helping patients who have mental disorders work through their pain, and you can and work together, co-brand this practice. That's a highly good recommendation I make. In fact, in that one of our cases, we had to actually reach out to a therapist who we knew worked with mental patients, and they helped develop a plan and a protocol for that patient to successfully rehabilitate the pain cravings, which was a weird thing to talk about, but it happens. Um, and if anyone has any questions, you can always just unmute and ask them. But okay, so epileptic tendencies. So when it comes to seizures or epileptic tendencies, you just want to be aware of it because in some cases, it's depending on what type of seizure disease they have. So it might be an upper motor neuron mechanism or a low catalyst mechanism or hormonal misbalance mechanism. There's a couple different chains of pathways of triggering a seizure. Will the Avazzia trigger a seizure? No. Can it? Yes. Um, and it does that by essentially balancing those equilibriums across the board in terms of the nerve tissue pathways. And sometimes the body gets really excited when it reorients and reconnects a pathway that's much better, and then it triggers a release. Uh, the experience that we've had is in some cases, and this I have to preface this, um, the patients who've had seizures while working with the Avazzia did not have a recurrent seizure afterwards, which is crazy result that we need more verification and testing and studied on. So, and that's my preference. Now, does that mean that it's worth the risk to trigger a seizure? No. It's something you should only do when you have if someone indicates that they have a history of strokes or of seizures, an epileptic shock. Um, that's something that you should only do with the primary care or nurse practitioner, someone who has experience in triaging that instance on staff or on the area or on the premises or around, right? But it's something to be aware of that you can do. Menstruating uterus, if they have a really heavy flow, let me take out this thing. If they have a really heavy flow, there might be a caution. You're going to increase circulation. It may increase the amount of bleeding that occurs. Um, the caveat to that is within reason. So it's, the pain will decrease when you're using that in the area. It's just if you find that you're bleeding a little too much, then you should stop using the Avazzia and contact your primary care physician. We haven't had a significant caution or report, but it's just theorized that if you're going to increase the circulation and the vasodilation, that it could cause a significant minor interaction. So we want to make sure that we mitigate all those that we can. Fainting and strokes. So fainting, again, if anyone ever reports they have fainting issues, just be in front of them for most of them or have them on the table. History of strokes. It depends on what type of practitioner or therapist you are, but usually strokes indicate that they have some type of plaque buildup or they have some type of reason how they got the stroke in the first place. And that's something to be aware of so that when you're working on soft tissue and painting, that you're not inadvertently, releasing blood clots into the body or inadvertently triggering negative scenarios, right? So, if you ever feel like there's a really big fascial blockage and you don't really understand why there's this lump, yet don't try to release the lump, just work around it. And there's a certain way you should work with it. That's a therapist review, right? So, uh, uh, but patients, we actually worked with the Stroke Victory Foundation specifically with our technology to help patients who have strokes recover and recover their upper and lower motor neuron balancing features and reduce the numbness and stricture related to that stroke significantly across the board by more than 80% in many cases. So, does it help people who've had strokes? Yes, it absolutely does. It helps significantly. Is it going to be something that you treat on an everyday basis? No. You should have a caution when you work with someone with a stroke, just because you want to make sure that you're not inadvertently improving or decreasing their ability to naturally heal themselves, right? And usually by the time if they have a stroke and recover, usually you don't want to you want to wait at least 2 weeks before you work on someone who's had a stroke, usually, because that can indicate that their body has essentially still plaque buildup that's non-habituated and non-cleared. So there's a problem with that. Botox treatments. Botox will literally drain out of the body when you work the Avazzia. It is fascinating. It is also very expensive to look at a patient's, they spend like at least $500. I mean, depends on the Botox, maybe 1,000, getting the Botox injections. And the body views it as a toxin. And when you improve the immune system and you improve circulation, you improve vasodilation, you improve capillary dilation, it literally drains it from the body and it puts it into the lymphatic system. The lymphatic system drains with the Avazzia, and then no more Botox. Well, uh, you know, if you want the patient to not hate you, wait at least 3 weeks after injections. That's just the calm statement there. Uh, I've had like one case where the Botox actually led to a side effect of partial paralysis of the face, and it was very interesting. Is the woman? It was within I think it was like the 2 week window. And the woman said, "I don't care about the Botox anymore. I want I want the usage of my face back." And we did end up working on it, and it did drain. It literally it was the upper cheeks, and she couldn't close her eye functionally, and it restored functionality of the eyelid and the lower and the cheeks, so she could close her, and she stopped drooling afterwards too, right? It's like, why would I still don't understand why you would do Botox. Not, I mean, cosmetically great, for women and men, terrible health adverse effects for the nervous system and all the collagen development and fascial and capillary development in the face. Would not recommend. But when you do it, you just know that you can triage it as a reverse with Avazzia. And additionally, you don't want to inadvertently help or hurt that. So those are all the cautions and contraindications that we know of that are reported. Um, there is a couple that are not listed that I want to indicate. The first one is the thyroid area. We will cover that you don't really want to activate the thyroid area. It's not a contraindication. It's just more of a caution. You can go on to the throat and around the area. It's just not, you're not parking it on the thyroid and just treating the thyroid. There is a protocol for TMJ, for example, that we go close to the thyroid. We go in the front of the SCM and you feel it coming through into the front of the face, and you might feel it coming around the thyroid area, but it's not triggering the thyroid area specifically. The reason why we do that is thyroid's very hyperreactive to hormonal change, and the Avazzia releases neuropeptides. In combination, those neuropeptides short term release hormones, and as such, the thyroid gets really reactive to the Avazzia. It's not going to uh, in a 10 to 15-minute therapy, it's not going to interact negatively at all if you have it parked on there. But if you hold it there for an hour, it's going to cause you to have temperature changes, and you might get chills, you might get overheated. So because hormones are going to release, and it's physics, it's going to change how you do it. So don't park on the thyroid for more than 20 minutes is my recommendation. Um, Additionally, don't use acute trauma in. So we'll go into different modes as we cover it, but uh, you know, usually you don't want to use acute trauma in the head area because you don't want to over vasodilate some certain areas, and that's just the most vasodilating mode. But yeah, okay, so those are the two I can think of. If anyone has any questions about the contraindications and precautions, you can feel free to unmute and I'll answer anything. I'll wait for a second.
Brenda, did you say don't don't use acute trauma on the head area?
Yeah, you can use acute trauma in the neck SEM. You're not going to want to use acute trauma in the superficial vascular arterial line right here. Just like right above the ear.
Mhm.
It does interact with the TMJ line, but it's just you could overdilate it, and getting it to release takes it takes craniosacral to diminish it back down. So, there's recovery processes for it in the protocol, but you want to keep that dilated as it is in compensation for what's going on in the head, and just overstimulating it's not the answer for that. That's more of it's not a contraindication, it's just more of a precaution that you should know about, and as a practitioner you should kind of try to avoid. You can use relax there, that's fine, just nothing that's overstimulating of the like right above the ear. um, if you use relax on the ears, for example, perfectly fine. If you use acute trauma on the ears, it will overstimulate the body. So you want to stay away from the hyperstimulating modes. And when I cover what acute trauma is, you'll understand why that's important to not do that in that area. Um,
Thanks, Brenda.
okay. Any other questions? Okay, we'll move on. So the intended use and clearance and regulatory status. So this kind of covers, what the Avazzia is. So the RSI ProSport Ultra, ProSport 3, which is kind of what everyone has here. Those are class 2 medical devices. It's cleared in the same clearance as like glasses are for functional understanding, like class 2. Nothing deadly, but something that does require a prescription or a credential or therapist license to use on a everyday basis or purchase. The intended use and what it's cleared as is a TENS unit, so transcutaneous electrical nerve stimulation. There are new categories out called MENS and PENS and all sorts of different acronyms. But this is the primary category the FDA has created for electrical nerve stim. Um, and the indicated use for that is the symptomatic relief of and management of chronic intractable pain and adjunctive treatment, and the management of post-surgical and post-traumatic pain. So that's what's on label. What's on label specifically. That is what the manufacturer has FDA cleared, approved, tested, studied, and produced studies for, more than 13 different studies for the treatment, management, and mitigation of pain. Additionally, those studies have also shown that we increase range of motion, decrease stricture, decrease all sorts of different negative side effects in terms of nerve numbness, nerve functionality, and things. But that's not what they went for the clearance for. That's off label and its effect. Well, FDA is there to regulate the scope of what you're addressing. As a practitioner, that's different from what the manufacturer's scope is restricted to, right? So you can say, oh, well, I'm only going to use the Avazzia on label, right? And that's fine. That's what the manufacturer has created a window for you to do, right? As a practitioner, you can use it off label and however you see fit within your scope or within your administration. So there's a difference between scopes and liabilities and different things that we want to be aware of what Avazzia is actually claiming that they do and what we say you can do with the device. So it's different. Um, so uh, this gets into the meat and potatoes of the actual presentation. Uh, you know, what is if I had to sum up the device to uh, uh, a practitioner, right? I would say the Avazzia Pro Sport is a microcurrent device cleared as a transcutaneous electrical stim device that uses damped biphasic sinusoidal waveforms in conjunction with high voltage pulsed current current to optimize your body's nervous system. Okay. Um, that's not what you're going to say to your patient. You're going to say to your patient, I always say that the 8th grade level, you're going to say to your patient or your friend or your family member that the Avazzia is an electrical device that works with the body to alleviate pain by using very small amounts of electricity in an effective manner, right? Now, we say high voltage, that's non-layman's terms, right? So when I explain the difference between high voltage, and we'll cover that in a little bit, and low voltage and what that signal really means, you'll actually get an understanding of what the Avazzia is and is not. So, but this is a great slide and thing to record, so that way you have something that says, "Hey, this is exactly what I should say to my patient when I'm working with it." It's like, "Hey, we're gonna put a small amount of current in the body. It's gonna help out, right?" Um, Getting into the science. So, the first thing you should understand is, uh, you know, the BEST acronym, so like the BEST RSI, it stands for Biofeedback Electrostimulation Technology. They've recently, in the last year, since VA clearance, have stopped saying feedback because biofeedback specifically has call and response narratives in the FDA clearance system, and they've gone with what's called React technology, um, or reaction-based technology, because the body is reacting faster than your parasympathetic, your sympathetic um, uh, is responding to. So it goes trans biofeedback. It's reaction-based technology. We use this technology as a therapeutic applicator for neurophysiology, um, and it does, because it's biphasic. It does uh, generate and leave energy in the body and increase the capacity for energy across the board. It's a neurostimulator, so it's going to stimulate different nerve fibers. The nerve fibers that are primarily stimulated are the C and A fibers, um, non-myelinated versus and myelinated. Just it's a terminology to say if they're functional or non-functional. Pathways are inert. And it does, those fibers, once stimulated, will secrete neuropeptides and neuroactive substances such as hormones, agents, different biodicylators, different agents that will then uh, initiate whole processes of regulatory operations in the body. So when just by going over for a second with even on the most basic mode like relax mode, you're doing quite a lot of triage work for any issue in the body. Because when different fibers are firing, different agents are reacting, and then you're getting response mechanisms that are more complicated than what you think are under the hood. And so it's kind of interesting to actually dive into the science and say, well, what's actually functionally happening here, right? So the primary mechanism, right, is that we're putting a current into the body. That current is reacting to the body at a very low threshold, which then induces neuropeptide secretion. This is mainly done through the C fibers. The A fibers get co-reacted to at a lower proportion. It's mostly C fibers. And what that means is like it's mostly it's like the acute sensation. It's not like the warming sensation or the chronic pain sensation that immediately gets interacted with, right? Which is why the Avazzia is fantastic. If you just stub your toe, you put the Avazzia on, the pain goes away right away, right? It's not as bad. Well, the B fibers, right, which are more regulated towards long-term chronic pain, chronic signaling mechanisms, they take a little bit longer to interact with, and you'll see that in one of the slides, you actually see that there's a pathway, biochemical pathway for how that actually does interact with, which is kind of cool. So the therapy releases neurotransmitters, histamines, and serotonin. So even on, I like to say, even on someone who is not in pain but not happy, working with the Avazzia actually does help you alleviate and helps you alleviate your mood slightly on a scientific foundational physics level, right? It's going to release serotonin. Serotonin's going to help uh, uh, mitigate functional activation and lower inflammation. So it's a positive. Um, the regulatory chains cascade. So you are triggering a whole bunch of different cascading activation points across the body. So when you work on one point of the body, like let's say you work on your cheek, right? It doesn't just stop at this area. It's going to run through millions of routes per second and find different optimization routes. And those are getting treated for maybe a millisecond, maybe 10 milliseconds. But those activation routes are all releasing different neuropeptides and activators that then release neuromediators, which then interact with the other areas around it. So you're helping assist the entire area of the body, right? And when we get into efferent versus afferent pathway systems, you'll realize how crazy it is. Like even putting the Avazzia on the bottom of the feet and just with pads is treating the entire body and working with the entire body. And there are billions of routes and trillions of routes, not a hyperbole, literally trillions of routes of mechanisms that will be created out of that therapy, which is almost absurd, but it's very cool. And what does this, really stress? So when you do have these neuropeptides release, a lot of them have very short half-lives. So they only last for like anywhere from 5 minutes to an hour, and they get utilized very quickly. But when I talk about those hormonal chains that they get activated in, well, those short half-life neuropeptides trigger cascading event horizon chains, right? So they lead up and then all of a sudden they trigger another set of reactant agents. And this leads to further development of different mediators that last for way longer than what the initial neuropeptides are, which is why people are like, oh, well, I can trigger a neuropeptide. I can just inject neuropeptides in your body. Well, they get processed pretty quickly, and that's not going to actually trigger the change. You want to create this cascading effect of different complex hormones that are released in order to triage those eventual inflammation areas or pain areas. And that's really how we get that huge cool thing to happen. And even further from there, when people talk about like, oh, we're altering DNA, it's like, no, we're not necessarily altering DNA. We're providing different environments for cells to be in, right? Because different hormonal balances mean different environmental stressors. Those peptides and neurohormonal environments create different gene stressors, right? The cell basically checks the environment, says, hey, this is the current environment that we have, and then looks in to say how it should respond. Well, that's gene expression, right? And so we get different cellular activity while the Avazzia is in play. And not only do we get small scale cellular activity where the cellular structures improve internally, we get large scale because the cells are absorbing the electrical voltage of the device's current and utilizing that as a catalyst for the production of energy as well as the production of neural signals in their own production of peptides. They release the peptides as well, right? So, everything's connected. These cells create other clusters of cellular activity. So it's basically like turning up the volume on when you hear your neighbor. You can hear all of a sudden you can hear your neighbor activate and signal. And usually if someone's mad, they're going to tell you why they're mad, right? And if I tell you if I'm in pain and you can help me with my pain, I'm going to tell you, hey, you can help me with my pain, please help, right? Well, that please help signal can now be communicated better. And when we communicate that please help signal, you know, hey, I have something that can help you inside me. I'm going to express a different gene. I'm going to express a different mutation to regulate the scenario. Because even though you might not have that gene regulation, or you might be missing that because you're overtaxed if you're chronic, right? In some situations, chronically stressed genes, their nerve endings have crystallized. Their cellular structures for certain activation sites are just gone. They're overused, right? Which means that they need neighbors or they need different cellular structures around the area to trigger those functional release valves so that you can actually get the help that it needs, right? If you are essentially immunodepressant or essentially you have immune system problems, right? Or as you develop certain types of cancerous lesions in areas, what they're finding is that it's mostly because cellular signaling mechanisms are breaking down in that local area. And because your body fights off cancer all the time. You have cancer right now. It's fighting it off. Very, very low amounts, but macrophages are going through the blood system right now and fighting it off. The problem is signaling to make sure that signaling gets done and that your body knows where to fight it off, where to send different agents to. And that only happens when cells are working functionally and doing the job that they are able to do. And that requires gene expression because gene expression is the utilization under stresses and environments to actually execute different processes, right? By the way, any questions you can always pause me and ask them. It's not absurd to stop this. I thought this is interesting. This is different functional ways. Okay, so this is afferent and efferent pathways. I might not be saying it right, but afferent essentially relays it to the central nervous system. So that's pathways that go to the brain all the way back down, and then efferent is kind of like the reflexes that relay back down to the systematic reactions, right? So you would say when you work with the Avazzia, you're feeling your patient feels a tingle or you feel a tingle. Well, guess what? That's a pathway that you're activating. That tingle is your nervous system, your internal brain's mechanism of identification. That's the afferent pathway that's relaying it. It's literally going from, if I'm treating my hand, that signal's going from my hand all the way to the brain, right? Which means the Avazzia is treating all the way to the brain, right? We're working all the way up, even though we were here, right? Because the afferent pathway is being triggered. Okay. Now, technically, is the electrical signal going to be in this specific area treating? Yes. Is there a degree to which you have interaction of the electrical signal all the way up? Yes. Primarily, 99.999% of the electrical discharge is going to be captured in the local environmental area, right? So it's not to be the case where if you have a pacemaker and you're treating in the hands, that electrical signal is never going to get over here, right? But the afferent central nervous system connection that comes in is being worked on, right? Which is why we get these interactions where you have pads on and all of a sudden back pain goes away, or you have pads on the hands and your abdominal cramps go away, right? Well, small intestine, that's meridian network, but I'll talk about it in a second. So, so when your brain gets the signal that there's something going on, it checks in and sends response signals back. And those response signals are usually all clear signals to say, hey, I can feel the tingle. I understand that it's fine. And those cortical, subcortical areas, they release endorphins, and they also release certain other pain mitigating agents and opioids, which reduces pain right away. So, like I said, stub your toe, put the Avazzia on. It's pretty quick. It's pretty helpful with it because it will literally release endorphins. Um, the caveat to that, though, is hey, if you're going to use the Avazzia, um, what do we know about opioids? It's not recommended that you go exercise while you're using them. Okay, well, if you're going to use the Avazzia, don't try to go do your max the day of or day during the next hour, because you're gonna have painkillers, technically natural painkillers that don't make you addictive. They're non-addictive because they're generated by your body, in your body. That's alleviating your pain and stressors, so you don't have as many restrictions and limitations on your body's mechanisms. But I digress. Okay, so that talks about how the nervous system gets interacted with the Avazzia. But how do we actually get blood perfusion or vasodilation, which is to say, how do we get circulation through and how do we get circulation dispersed from? So let me take a sip of water real quick. It's probably, my voice is getting a little dry. So tissue perfusion is one issue and vasoactivation is another. So just because you have circulation doesn't mean the tissue around the arterial vessels, the blood vessels, are getting circulated too. And this is something that people say, like, oh yeah, my heat and temperature regulation is fine. It's just I don't feel any sensation down there. It's, well, your tissue perfusion is gone, right? Your body doesn't feel safe to diffuse that blood and receive that blood from that area. So, um, why does this happen? Well, it happens for many reasons. You can actually kind of see like the Ooh, you can kind of see the lymphatic vessel, the blood vessel, and the big image there. But primarily, what we find is fascial interruption, usually, and I'll go into what the fascia is, but fascial interruption indicates for the lack of perfusion and the lack of response perfusion, which then leads to a lockdown of an area, isolation, right? When the body gets hurt or damaged in any system, it spreads out the damage as much as it can, and then it isolates the pocket to address later, right? And if that occurs in a large enough systematic area, well, then it cuts off tissue perfusion. Because if you have an open wound, you don't want to bleed out of it, you die instantly, right? So the body's goal is to isolate, right? And for isolation effects, it's not healthy. Well, with the Avazzia, we can release those neuropeptides, reintroduce those nerve sites, and re-signal of what the actuality of the situation is. So it releases that isolation. That when the isolation is released, guess what? You get the all clear signal. People start going in. If you unlock the door, people can use the door, right? If they need to, which is the whole signal point about calling for help. It's like if you have one person locked inside, one person outside, and one person's calling for help, but the door is not open, hey, it's not going to open, right? And this, when we get into scar tissue, is going to be really important because it is it is an effect where there is something just literally blocking the door for the nervous tissue to actually recall and recover. And the perfusion effect is one of those things. So the Avazzia increases blood perfusion in treated areas. It improves the capacity of flow for the areas because of how we release different agents into the body. So you're going to release, cannins, prostaglandins, cytokines, and nitric oxide is going to increase as well. This increases blood flow, but additionally, it increases capacity to flow. So your circulation is going to increase in the area, but also it's going to vasodilate, it's going to expand. Well, when we expand, we get more through it per second, right? And we can also see an expansion and or restructuring in the actually vasodilation of the absorption from the branching vessels as well. So it expands the total amount of outflow and inflow that your system can handle per second, which if we think about our body like a machine or like an efficiency metric, the more I can get things into, more resources I can get into an area, the more that area can do. And the more I can get resources out of an area or gunk out of the area, the more room there is for more stuff to go. So it's a double whammy in terms of effectiveness, right? Circulation is very important in any area. If you lose circulation, if you had zero circulation for an hour, your body turns black and blue, starts to decay, right? There's significant problems, right, that we can talk about. If you have a tourniquet, numbness occurs instantly, right? Well, that's just the important role of circulation to improving the nervous system or maintaining the nervous system, right? So you need circulation or else everything's going to die in the area, right? And this is understandable. The body's not in a vacuum. Any questions? Cool. All right. All right. So you say, okay, well, Brendan, how if it increases the nervous if we improve the nervous system and we improve the circulatory system, how do we get this anti-inflammatory response and the immune system response? Well, if you improve the way the nervous system works, the nervous system is able to call for resources properly and address those areas of concern. So it calls the right response team instead of the wrong response team, right? The right response team is a different resource load because of different neuroactive gene expression, as well as neuropeptide release expression that occurs. If my body understands that there's a scar where I'm working, it will release a different concoctive response agent team for what the job is than if I say I had a fever or I had a virus. Well, fever is a response, but if I had a bacterial or a parasitic infection, right? Different response team, right? So one, by improving the nervous system, we're getting an underlying improvement in the functional way that we can call for help in our bodies. And then secondly, by improving the capacity of flow of the in and outs, we're enabling the body to remove anti or inflammatory agents. So this is gunk that's just impeding the body, and bring in resources to improve cellular activation and expression, as well as macrophages, which is a white blood cell that's specifically designed for attacking aggressive negative biotics, right? And and there's not as many macrophages like you'd say it's like 1 in 1,000 white blood cells are macrophages, I think, is a breakdown. So they're rarer, and I think it's like 1 in 10,000 red blood cells is white. So it's like you think about it, it's like I think it's one in 100,000 or 1 in 1,000,000, but that's it's for your to look up. But they're rarer. Macrophages are rarer than red blood cells, significantly rare. And so there's only so many of them to go around. Macrophages are larger than red blood cells and white blood cells. They're designed to consume biotics. So your body's strongest form of immune cellular immunity. And they go around, and the more you can get vasodilation to deliver more of those bad boys, the better your body is overall in terms of handling and mitigating stressors. Even cancer is eaten up by macrophages, right? So that's the designed expression of that. Additionally, when we do get rid of gunk in the body, so it's the chemotaxis and clearance of extracellular debris, look, when cells die, it's just gunk. It's like, if you had a bunch of corpses laying around where you work, it'd be hard for you to work, right? So we got to get those out of there so that you can operate normally. And it's or as you say, you don't shit where you work, right? Sorry you don't poop where you work, right? But in clearance, it makes sense because you have to. Hopefully, without proper sewage systems, the cities would be terribly smelling, right? So I think it's the same thing with the cellular structures, right? Cells need outflow to functionally work. If you don't have outflow, you get lymphedema. You get lymphatic blockages, which is essentially the overflow or backage. The sewage system just gets destroyed, so the body can't clear itself, right? So what does the Avazzia do? Well, the Avazzia helps the nervous system create circulation. Guess what we also do? When we're painting, we help with lymphatic. So now Brenda is a lymphatic drainage specialist. She would be a better person to consult with for that information. But we've seen miracles for lymphedema, literal miracles. In terms of drainage, 60% drainage and under a day. Just maybe later if we're on break, I'll show you some. I'll send some pictures and I'll put them on the slides because I have some cases where it's almost absurd how the body was stuck in such a suboptimal way, such a significantly suboptimal way. And during we had one woman who we were at this trade show. She came in the morning, so 10 a.m. and she had had a demo, had this elephantitis, like almost elephantitis type scenario of lymphatic blockage buildup, where her one leg was something like 60% larger than the other. And we started working on her, and the sensation, she was getting like numbness in the area. The sensation came back, and then she had to run to the bathroom, and the swelling decreased by 20% in the first 10 minutes of therapy. And then she came back. She's like, I couldn't believe it decreased. I just saw it decrease. She's like, okay, well, that's great. Let's continue working. She stayed for 8 hours. Now, this is not a testimonial to say you could treat for 8 hours or you should treat for 8 hours. She was she was glued to us for 8 hours. She would refuse to leave because it got so much work done. She essentially got so much effectiveness done for the therapy. But by the end of it, her leg had decreased by almost it was only 10% larger than the other leg by the end. It was 60 to 70% reduction in size. She had gone to the bathroom 4 times. And each time she'd come back and there'd be a different sticky spot. And we talked about painting that had impeded the lymphatic flow. This is where Brenda is absolutely amazing with lymphatic drainage because she knows exactly what she's doing, right? And we probably will teach a lymphatic drainage class sometime this year, but we're figuring out where that slots in. But it's a thing. The Avazzia really helps with that. Now, on a secondary note, I had another. Lymphatic drainage is such a cool thing because you see the results so quickly with the Avazzia. But I digress. I had another example of that experience where I had a woman who was like a mother of four, and she was in line getting coffee, and she had one of her arms. She had pressure wrapped. Her arm was significantly larger, and it was one side asymmetrical, right? So this arm was way larger than the other, and this happens. When you do see these problems, you really should. I really recommend pulling them. Just saying, hey, like I have a solution for that, right? Maybe you can help change their life, and um, I mentioned to her that, oh, I can help train with that. She said, no, no way. That doctor, I've been seeing primary care physicians seen allopathic medicine for 10 years. It was longer than that. She said, I've been getting this work done and treated for something like 15 to 20 years. And uh, there was a lymphatic blockage in her armpit that was causing a literal scar that she had in her armpit that she had done during, I think it was a breast removal or reduction removal that had gone wrong and had gone through the pit and it had sliced the lymphatic flow from the arm. And there was no recovery mechanism for it, right? So the arm was just blocking up and then it would get into her bloodstream. And that's how the body thought it would outflow it instead of using the lymphatic properly. And it was under 2 days and then the swelling was gone for her completely. She's why is that the case? Well, get rid of the scar tissue and then reconnect the fascia, and then lymphatic will slowly reconnect. It takes time, but it'll slowly reconnect. It starts to drain again. It's an outflow problem, right? So this is what I talk about. It's like extracellular debris. It's an outflow problem. And that's why you need to work on scars. You really do. Scar tissue is impedance problem, right? It impedes fascial layers, impedes signaling, impedes all types of different issues, which is why it's important. All right. Any questions? Okay. All right. So this technology is great. Why is it different from other technology? Recently I really sat down with the inventor, had like a 4-hour conversation of technicals of why this technology is way different than other tens on the market. The first thing is, the closest comparison to this technology would be like the Russian scanner, which probably was around the 1970s, 1980s. And the problem with that degree of technology was while it was change of tissue based, so it was similar in terms of reaction based, um, the problem lied in how they created the packets to signal. Uh, and it would degrade the device exorbitantly fast. So most of the scanners were notorious for not being functional past a year. And then additionally, the wave mechanisms were very linear in dimension. And so what that means is that as you'd get stimulation in, it wasn't very responsive to the body. You could only project into the body. You couldn't really respond to the body properly. And that was where Tim, who essentially he's he was the chief engineer for Texas Instruments for 35 years. Developed a lot of the patents and circuitry for the modern world in terms of CMOSs and transistors. He said, "Oh, I could make a device that's significantly better than that." And not only I can make it better, I can make it last longer, uh, almost indefinitely. Which it's I laughed at it because he said, "Well, I'd rather." There's a lot of decisions that Tim made when he invented the device and technology that would have drastically changed how the company worked, right? How we distribute technology. Like one of them was, you know, we could have, we could have sold it as a $30,000 tens device, right? And made a gigantic box and had this nice fancy overlay. But inside is just a small chip that's, this big, right? And we could have done that, but one, it wouldn't be portable, wouldn't be usable, wouldn't be actionable, wouldn't be practitioner friendly, and it'd be needless, right? So instead of making this big fancy box, which you'll find a lot of the a lot of the massive like super expensive tens units on the market, most of it's dead space. They don't need that room. If you open it up, it's 90% air, and it's just a big box that they put the impressive lining or these heat coils in, but they don't need it. It doesn't use as much energy as it says it does, and it's almost laughable how uh, these solutions are. But in truth, they just you can fit it in a small package as long as the circuitry is done right. Now, there's a difference or degree from this size of a device to this size of device, right? Because you can have density of capacitors and transistors in it. And I would say the Avazzia by far has the densest degree of circuitry in it in terms of stability and production. And I'll get into that in a little bit as we get into response agents and circuitry into the science of that. But for this case, when talking about why the Avazzia is better than other technology in the market, we use a different type of waveform that's no one else in the market is using, and a response waveform. It's very different, distinct. We have better circuitry than anyone else, cleaner signaling, so we don't ruin the signal mechanism with a 10 signal, which is say a millicurrent signal. I'll get into that in a second, but a lot of people claim that they're microcurrent and that they're only microcurrent, and they are wrong because they send their frequencies in packets, which is cascaded or surrounded, encapsulated by millicurrent, right? It's like, oh, what do you mean? How is that possible? It's like, well, how do you send your packets? How do you restrict your signaling mechanisms? How are you actually hitting these hertz that you're saying you're hitting? Are you having a standing concurrent wave that comes through the body and slowly then sends packets? Because that's millicurrent. You're a tens unit masquerading as a microcurrent unit, right? And you're getting pain reduction through the closure of pain gates, right? The closure, the loss of functionality of the nervous system, which is why your technology only works for a month or two, right? So, and that's I make that statement all the time. When I look under the hood, I'm like, this is garbage, and people don't understand what I'm saying. This is why, right? So, signaling is very important, and making sure that you send the right packet system and that you're responsive to the body and that you're not overdoing the nerve interaction is very important. We'll dive further. If not on break, I can dive even further than this. But so yeah, so we're very focused on the idea of signaling to the body. And we intensely focus on the concept of not doing any harm and not debilitating or inhibiting the function of the body. If the body ever gets into a state where we're inhibiting the functionality of the body, it stops. That's cool. We can't hurt the body. Now you can, on a macro side, I mean, you could turn it up all the way, touch the body. It's not reactive. It's going to shock for a second. Your parasympathetic is going to pull away because it's a natural response. You can't truly hurt the body. You would really have to like have someone hold it on you and taser you for a long time before it goes numb, which is not ideal, not recommended. Which I don't know who would do that. Don't recommend that. That's a terrible idea as a practitioner. You should always, less is more, be turning it to the right tune. But we'll get into that in the tips. So yeah, so Avazzia is the first generation of reaction-based BEST, so reaction biofeedback electrical stimulation technology devices that that produces a clean and precise waveform that isn't a gigantic box that's overpriced and is versatile and movable and reliable and functional in a way that makes it so it is a system that could change healthcare and that could be in every hospital, every clinic, every practitioner's hand, in everyone's med kit, first aid kit. Different tiers, different devices, different goals. Right tool, right device, right job. All right, so something to think about. All right. So, and this is kind of like that whole, I like this chart. It was part of the old presentation. I think it's still nice. It shows you all the different mappings of the parasympathetic nervous system and how it, how you're getting these releases and these electrical signals going across, but on a cellular level, you're also getting these releases in the internal local level. So you really get this minor regional interaction as well as these major total system interactions, right? Which again, if areas that are not functional or isolated are calling for help and they get those resources, then you're improving the total macro system as well, right? The local areas are getting helped. The major areas are improving as well because you're not dragged down by the local areas. And local areas drag down the major areas, right? You're like, there's the old expression in basketball, it's like you're only as good as your worst person on the court, right? And the body really does identify with this. In fact, when we get into impedance testing, it is amazing to see how the body triages this instance because the body really does try to address the worst case scenario first and then triage as it goes. And it's actively triaging. You would be dead within 3 days if your body's nervous system didn't connect and activate in a way that triages these issues actively, right? So we talk about these signals, they're always going on. Any sensory feeling is afferent pathways being activated and efferent pathways being delivered to your cortical levels, right? So it's also a cool thing to think about. Okay, more talk. So how does it actually communicate with the body, right? So we talked that I was getting more into the neuropeptides. This is more into the fascial layer of, okay, we deal with the nervous system. How does it deal with the skin as well? How does it actually contact and make that signal through? Well, we get this neuroendocrine system contact by putting a circuit through. That circuit penetrates essentially goes through the path of least resistance, goes through the epidermis and dermis and the connective tissue, because the path of least resistance are these little nerve sites on the epidermis that or the dermis that signal all the way through into the macro central nervous system, right? And we hijack those paths of least resistance. Now, if your skin was wet while you're doing that therapy, right? Is that the path of least resistance? Depends. If it's salty, yeah, maybe. You might have more conductivity on the surface level of the epidermis, but there's a range of regions it's going to go, right? If it's distilled water, it's going to be non-reactive at all, right? So, in fact, we'll get into tips and tricks, but if you're having problems with connectivity issues in a patient, sometimes damping a towel and just wetting it and waiting for a period of time for the water to absorb into it, it's going to improve the functional because it's going to restore the epidermis layer. It's going to make it more moist so that the dermis is more connective, right? And the fascia is more reactive. So the fascia, which I think there's a cool picture right here I just want to show. Fascia is really like a web network, and fascia is naturally chaotic. the body's optimizing all the time, right? And when you exercise, the body cleans itself up, it organizes, right? So the fascia is naturally chaotic, which is why you get lumps of trigger tissue and impedances and all these different features, right? That web up, right? And so what you should be thinking is, okay, if it's naturally chaotic, when I paint with my device, I'm going to organize this fascial web. And as the signal goes through, right, these different nerve agents, nerve fibers that are in these comprised chains, which is what you'll see these liquid crystal continuum chains, which is what the fascia is. It's like collagen bounded with water in a helix form with different hormones and different agents activated in to create these chains and webs, right? These webs are extremely conductive, like very conductive, and they transmit energy through them faster than our nervous system could ever function. So one of the really easy expressions of that is, for example, like if you touch a stove with your hand, your parasympathetic activates before your nervous system can even handle it, but your fascia activates. Primarily, the fascia is the thing that pulls you away, right? And it activates before you even register there's pain. So how's that? Well, the signal from the fascia triggers before the signal uh, from the efferent pathway can come down to the brain to signal back to say, hey, what's up? All right. So we know that there's a function that communicates faster. And this gets into tomorrow's class when we talk about structural dynamics. Like the fascia is a huge indicator for across the board different mechanisms and different things to occur. And because of that, we oh, okay. And because of that, we get into trouble. Sorry, give me 1 second. Let me retrain my thought. We know that the fascia is a pathway for different force structures to prime the body. And because we know that that's the case, when we organize those pathways, we improve how we can functionally use our bodies in a way that doesn't take away and doesn't inhibit our actual action, which is why we get stricture improvement and range of motion improvement, because the fascia oftentimes restricts the functional flow of energy. And when we release the fascia and organize the fascia better, that structure, that motion, range of motion issue goes away. It also has to do with the isolation issue as well. So you have isolation in the tissue as well, which again, this harps on the idea that painting is a good idea, right? When you paint the body with the Y bar, you're going to be organizing the tissue in a way that improves that fascia. Improving the fascia improves the musculoskeletal interconnection to the nervous system. The musculoskeletal interconnection to the nervous system then is more functional and optimized for actual execution. So you get a better improvement there as well. Sorry, I went 3 or 4 chains down the line, but I hope everyone followed that train of thought. Any questions? Okay, so you can also see, by the way, the fascia is really dependent on the amount of water intake you have. So, speaking of which, I think we were supposed to take a break at 10:30. If we want to, how's everyone feeling? Do we want to continue through and get through the science, or do we want to take our 10-minute break right now? Any
I'd say to take a break.
Okay, all right, break. All right. All right, good. Okay. Yeah, we'll take a small bathroom break. I can drink some water. We'll come back at 11 Eastern. And we'll take that 10-minute break if everyone's down for it. And in the meantime, if anyone has any questions, they can feel free to ask or mute. And I'll stay on for a little bit. We'll resume recording. All right, so So yeah, so the fascia has a significant role to play in the body. And that role has to do with signaling for different dynamic forces, as well as signaling for different isolation features, for different protective features. It's also extremely electrically conductive. And because it's so conductive, a lot of times the first layer of interaction that the Avazzia comes into contact with to organize and help assist with is the fascia. And uh, there are stacking layers of fascia, as you would say, that create trigger points often, as well as meridian points, which um, it's not often explained to people, but a lot of meridian firing mechanisms have to do with cascading fascial planes. If you have multiple different fascial layers cascading into um, different pivotal falcon points, um, or pivot points, you get what's called like intersecting planes. And these planes then create uh, really like massive networks and linear networks, like this line down an area, this channel that is extremely conductive. And the Avazzia works in conjunction with those conductive channels extremely well. Because not only does it organize and mitigate for isolation issues, that essentially the fascia gets rebellious and tightens up or restricts and doesn't allow communication or flow or transfer of energy through, but it also just doesn't signal properly. And because we are painting those regions, those planes, it decompensates and de-isolates those issues. It literally it literally connects with the nerves in the area and says, hey, you need to start asking for help if you have problems. You can't isolate anymore. And because of that, those nerves communicate with the fascia, and the fascia literally decreases in its chaos. It organizes, and it increases in its density, right? So it gets thinner. And what a thinner fascia also means better capillary flow to the skin, to the tissue in the local region, right? And so you get this trifold effect of not only is it improving connectivity in the tissue, it's improving organization within the tissue and how it communicates, and it's improving um, the functional level of that. So it's like more functional. You can use it better. It's not going to be as stiff or restrictive. A lot of times people report that their arm is lighter when you work on a fascial restriction in the arm or a trigger point or a meridian line that's not functional. It's like, why is it lighter? Well, it's not lighter. You just aren't fighting the fascia passively like you were before because you're fighting all these isolations to reconnect and reorganize, right? It's like, well, okay, well, when you put it that way, it's like, how much work are you doing on an everyday basis fighting your own body? It's like a ton. A lot of people, it's most of their. That's why it's so hard to get up sometimes. It's like that's not you. It's like, oh, I feel older. It's like, no, it's your fascias restricting all across the board. Your body's restricting and integrating into a connective network that is inhibitory instead of enabling you into action, right? So we've established that the fascial layer is extremely electrically conductive. It's mostly made of water, and so the best conductor is like essentially it's like salt water, right? It's fantastic connector, and uh, the fascia is one layer up. It's organized salt water. You could say it that way. It's like very organized. Um, and that makes it an extremely good connector. And as it goes, as the current goes through, it finds different routes to optimize and organize. Different pain gate channels open up and close. Different neuroactive active areas open up to allow for the signal to occur, right? And so when we get into the physics behind this, it's even more fascinating. But this is kind of like the biology behind what's going on. Is that we're looking at the fascia as an indicator, because the fascia is your body is developed for. Let's say if you believe in evolution, if you believe in just selective natural selection, right, processes, or pre-selective selection, you know that some way, shape, or form the body is optimized for a living, and the fascia is attempted to survive. Okay, and in that concurrent thought process, the fascia has a way to indicate where there's problems. It's the stickiness, it's the restriction, it isolates, right? It spreads and isolates. And the body tries to communicate it as it can. I have my 5 list, right, where we talk about pain, tension, trauma, scars, and habits, right? But the body's communication mechanisms are a lot of it has to do with how the fascia is operating, and the fascia, when it is worked on, has an internal effect, right? Like the other day I was uh, demonstrating on a patient, and they're a client of ours, and we realized that he was having constipation issues, and we were asking, well, why are you having constipation issues? We're trying to figure it out, and it was one of the things where the way he was sitting on an everyday basis, and the way his fascia had restricted, he was concaved in, right? So his body, if you're looking at his body, his shoulders were rounded forward like this, and the rib is literally impeding the large intestine. It's not allowing that to function, right? So you say, okay, that's a musculoskeletal, that's a skeletal issue. It's like, it's a structure, but the fascia indicated restriction all in here, internal, and it indicated line towards the problem, right? Now, the meridian network that acupuncturists talk about, it's a system with fantastic data, right? I call it great data, right? And the data shows, hey, this line, if it's impeded, it's going to interact with the large intestine, right? Which is. So what did we end up doing? Well, we ended up painting the area, releasing this internal trauma area that he had, and then just doing light exercises like this, where you open up the rib, and then a psoas release. And then all of a sudden, he was going to the bathroom. The constipation went away. So, okay, why is that? Well, the large intestine's not impeded anymore, right? And you're opening it up. You're not restricting your body as much. So there's definitely reasons where the fascia indicate there's problems, and there's connection to the organs and how it functions off that. So it's very important to understand, like, hey, while we are working in something that you would assume is superficial, it does go all the way to the functional really quickly, and it gets in there. So yeah, it's a good picture, good sentence, but the fascia can relay information faster than the brain and the nerve impulses can. It's as they say, the caveat of it is the fascia is only restricted by the speed of light. All right, so it's very very fast. All right, so this is we've covered the biological notion. We're gonna get into the physics notion, and this is gonna be I'm gonna try and make this as painless as possible, right? So when we talk about a circuit or a current going to the body, we're talking about a type of current, not all current, different types of current going to the body, right? So we're talking about a type of current. What is current? So it's usually broken down into different values. We call it amps, volts, and amps are essentially it's like the wave, right? More you can think about it as the amount of work being done in a given time per wave, right? So and volts is the strength, the flow of that, right? So it's like how strongly is it being pushed? And then when we talk about frequency is the rate of those waves coming in per time. So when people are talking about we're microcurrent frequency, it's like, well, how are you getting your hertz in? This has to do with, okay, well, if you're creating a pocket where a lot of amps are going through at a frequency subset, it's like, okay, what do you put in the middle of that? Are you putting nothing in the middle, and you're regulating as a millicurrent? Or are you putting a subsequent middle balancer? And you'll see that in the chart in a second. But so how do we talk about real power, right? So we talk about amps times volts equals the watts, right? So when they talk about how are you using, how much power are you using, it has to do with that formula. And then when we talk about resistance, it's the difficulty of the traversal through the path. So if your fascia is really high, has a really high resistance, it means it's hard to get through it. There's more chaos, less organized, less pathways through it. And if there's less functional pathways through it, then you sure as bet that your nervous system has to work harder, significantly harder. Sometimes it's 100 to 1,000 times harder to connect, activate, and signal, right? Sometimes it could be even 10,000 times harder for a signal. It's not, you could have such a suboptimized network, so many scars that for example, people with like road rash, right? Where they have multiple cascading failures of fascial nerve tissue and nerve endings that have just been ripped apart, right? Like skin graft almost. Well, those are essentially every loop it has to make, it has to go through that pathway. It's not, there's no cheating around those paths. So it goes through that highly inefficient mechanism. And so when you come in with the Avazzia and you start rewiring and reorganizing those fascial pathways and the nerve pathways and the fiber pathways, guess what? You're significantly increasing their ability to drain inflammation, and you're significantly helping them in how their body is able to heal itself. And so all of a sudden, these suboptimal systems just thin out into a very optimal system. So yeah, so resistance is difficulty of traversal through path. Essentially, it's like you get caught. Good resistors have very hard paths for electrons to go through, right? Now, there is a difference. If you have like a resistor on a circuit, they heat up. Well, that's called inductance. So it's like resisting that change through the coil. So if it's resisting that change from like a low resistance to high resistance, the inductance matters in when thinking about like hardware in the body. A lot of people say, well, how do you know that the Avazzia is not going to harm my titanium bolt in my femur or my knee or my ankle? And I say, well, because inductance has to do with the resistance. And even on the inductance formula, it has to do with the amount of work being done for the amp, not the volts, right? So if I have a microamp, really low amp, I'm never going to heat up the inductance. I'm never going to have such a high resistance to the load that I need to worry ever about any interaction, right? You get more passive static discharge from walking or having a fuzzy blanket on you than you would the Avazzia, right? Interacting with that metal because it's so low, but it's targeted specifically with the rack technology, right? It's one of the amazing things when I explain how much actual energy it's using. You're like, oh wow, we're really using a very tiny amount of electrical energy, but it's doing a lot of work, right? So that's so essentially. So what does that get us? Well, this is some just practical information, right? To think about. It's like, well, when you talk about how long should your Avazzia unit be lasting, right? It's like, oh, well, turns out we can calculate that. It's actually really easy to calculate, right? If I know watts, right? So I know the Avazzia works on microamps, right? So it's a millionth of an amp, right? So it's 0.000001 amp, right? Times 500 volts, which is the highest intensity of the device can go at, which by the way is more than nearly every other technology that's a tens unit I've seen. I've never seen a higher voltage line for it, which we talk about high voltage means that if the body wants to take that energy, it can, right? Which is good. So what do we get? Well, we get 0.0005 watts. That's the amount of energy used on your body per second. Usually they do it per second per hour, or they do watts per hour, you know, and constant sustainment, you know, but this is, you know, per second. So, you know, how much do like the batteries usually have? Well, they have 47 watt hours, right? So that means that they can run, you know, if you times it out, 47 hours at that given watt bandage. So assuming constant drain at the highest setting possible for the Avazzia, you know, I'd say 250, you should get about 25 hours out of a set of batteries. Now, there's obviously loss systems, you know, there's inefficiencies towards things, so you could have a shorter time. But if you ever find that you go more than 25 patient visit or less than 10 patient visits, where you have to change out the batteries, so you have 10 patient visits and you have to change out the batteries, I would advise you to recalibrate your device. and maybe think about sending it in. It shouldn't be the case that you have battery drainage more than 12 to 15 patients worth, and that's an hour of therapy per patient too. I'm saying like 15 to 25 hours is what you should expect out of every battery set, which is quite a lot. But I mean, it's to think about. It's like, okay, well, it should be lasting you for 25 sessions at an hour each.
Can I ask a question? How do you recalibrate them if you're having battery drainage?
Yeah, I'll show you that in the later section in the tips.
Okay.
It has to do with pressing the it's like a certain combination. I think it's the plus and minus or the up and down while you turn on the device, and you just hold it and then you release. But I'll get into that in the actual function section. The reason being is you want to just make sure that there's no, a lot of times batteries, they have a cliff system and how they actually are outputting current. And so some batteries, when they get into lower outputs, can mess with circuitry on the internals. And we do have a like a capacitor and resistor that defends against that, but it can get out of whack, right? And what we find is it's something that you should do every, I think it's like every 150 200 hours of usage is you calibrate it. And it takes like a second. It's really quick.
Okay.
Some people want it to, some people don't. I'm just trying to make sure y'all.
Okay. Yeah, sorry, I just muted her. All right. Right. So when I talk, I don't mean to talk bad about different products, right? But when someone says that they're microcurrent, right, and then they make a claim that they're 1 to 4,000 microamp, well, 4,000 microamp is 4 milliamp, so you're not a microcurrent. You know, think about it that way. It's like, oh, you're saying you're a microcurrent. You can get to microcurrent ranges, sure, but how do you packet it? Are you constantly milliamp? So I have the paper, the actual research paper and study that they released. They actually go in and they explain that, yeah, we're milliamp sending packets of microamp. It's like, oh, well, this is not the same. This is not, as you'd say, this is not as advertised, right? And you can see it at the low end, if they're really triggering the lowest range that they say, right, which is a millionth of a watt, right? Yeah, I mean, technically we'd be significantly stronger, but at the high end of what they claim, we're 1,000 times weaker than the next, 1,000 times lower amounts of energy that's going through in total than the another microcurrent device that's claimed. It's like, well, no, the microcurrent is less effective at that watt range because that millicurrent is shutting down those pain gates. So the amount of energy actually delivered to the body is very little. Nothing's absorbed there, right? And that's how we get this the significant change in tissue, is that at that millionth of an amp, we have such a high volts down the line. We talk about millivolts is how much the actual cells need. So biphasically, it's more absorption, right? So we're actually getting more effective absorption without raising the amperature, right? And so when we look at, it's like, why is it, what's the real beauty of the technology? And by the way, this is a fun side note. It's like they talk about what the definition of Avazzia is. Like what I've never heard of Avazzia. Avazzia is a made-up term by Tim Smith, and the technical term, he said, it's the beauty of health, and the expression that the healthier you are, the more beautiful you are, right? And so by definition, that's what it's supposed to be. But what we have is, this is an output chart from an Avazzia to show you what the actual waveform looks like with the output. And you can see that we have this back and forth wave, this biphasic wave. It's not just one side. So it's AC, but it's in a way that makes it so that it's not a consistent wave. It's never stagnant. It's always adapting, right? And we also get this mechanism where it tunes in to the body. It doesn't tune out, it tunes in to the body. So it continues to work with how the body mechanizes, and you can see it as it sinks up to the body, right? And we're getting lower and lower and lower. We're in a position of communication, right? And that this doesn't close the pain gates, right? When we look at other technologies, right? Like what Avazzia is not, right? Avazzia is not direct current. It's not just a static line. It's not just a consistent line across of electrical energy in, right? Because that the body adjusts for it, adapts. It's not a square wave because the body also adjusts for that. Because it's something that signals. It's a pattern pathway, so the pattern pathways get rejected, right? Now, and it's not alternating current because like in the same whereas even if you have a sinusoidal waveform, or if you have and that's not a sinusoidal waveform, but that's a consistent waveform, those waveforms trigger different cascading biological effects at their ridges and at their peaks and their troughs. And then when you talk about static non-reactive, that's just electrical peaks being discharged and absorbed, right? So whenever you have static electricity just discharged and absorbed, you get this little frayed line system where it's like a peak of amplitude work, a peak of work is done and then it got absorbed, right? Now, why does this matter? Well, let's take the worst say scenario. And I'm not saying our competitors cause this. I'm not saying this. This is just like the worst case of what these forms do. Each of those trigger that. So when you have a significant amount of consistent current through the air, you get arc burns, right? When you have essentially a consistent output metric at an aperture at a step wave, you're going to get a burning mechanism that burns the nerves in controlled fashion because they control and regulate for it. So the AC wave burn, you're seeing that it goes through the nervous system and the nerves just fry and they mitigate. So they burn at the point of contact and then they continue to burn up the line. So it diminishes because everything's closing down. It's going to protect the core, right? It's very fascinating to look at these because this is the worst case scenario. It teaches you how the body actually defends itself, right? So when you put a TENS unit on, this is the degree of range that the TENS unit is going to activate, right? When you look at it, it's going to activate the local area, the regional area, and then it's going to be shut down. And each of those burn marks are the vectors of induction for how the electrical current failed, right? And it's something to recognize. It's like each of those connect to that, which is why this is so important. On a worst case scenario scale, you're getting this. On a minor scale, you're still getting that. It's just not as prevalent, right? Which is why triaging the pain gates is so important and working with the body is so important. Because if you're doing that on a minor scale, what are you doing to the body? You're impeding the functional processes. You're burning down your nervous system. Now, this is a side note, and this is one of those things where in theory and paper, we're finding more and more support for, but a lot of fibromyalgia, cystic fibrosis, a lot of these intense, just insane nerve diseases that are appearing out of nowhere the last 20 years. They are out of nowhere, statistically by proportion. A lot of it is from the body not being able to trust the nervous system anymore. So it attacks the nervous system. And much of it is from, constant nerve degradation and damage to it. So we're experiencing this subset of these micro traumas that are in the body that are being caused in the body and we don't even realize we're doing it. Which is why if you do use TENS units that are in the milliamp range, you should stop immediately. There's no justification for it. Microamp is medically better, statistically across the board. There's not an argument for it in terms of the health outcome that it's not. And I will stand by that until my dying grave. That's the line in the sand I repeat. And this is also why it's like when they talk about, people talk about like Rife technology and different mechanisms for it. It's like, well, it's fine to think that frequency medicine is the cure all be all, right? And it's a very healing mechanism, right? But you have to be careful in how the modality is that you reach that. Because if you're actually putting in significant amounts of plasma or current into the body is not a passive mechanism. It's an active participant in your healing. it will triage, it will change every little thing that you put, and it'll do it 10, 100 times, 1,000 times more than you recognize it will. It is very proactive in your, and not just, I think the sentence I came up with before is your body is aggressively reactive and depressingly proactive, right? And so you get these situations where you have concurrent defense mechanisms that you're fighting against that you really want to understand and adjust for, which is why I don't recommend that. But and how do we know? Like, so how do we know the Avazzia isn't that? Well, because we get this, where we have amputation level wounds and nerve decay and diabetic ulcers that we are closing, where we are the primary and only effective therapy utilized in this mechanism, the only one. And we're getting that, where we're getting complete tissue recovery. It's like, okay, well, we must be doing something right, right? So what are we doing? Well, we're releasing, and this is why the biology aspect is very important here, right? We're releasing neuropeptides that reorganize the nerves in the area. We're treating the fascia around the area to reconnect the nervous system to indicate that there's a problem, which open wounds, a lot of times it's an indication problem, right? And then further from there, we're getting systematic connections to the capillary and circulatory system that reinforce that resource delivery mechanism and the drainage mechanisms, which is so key to wound care, right? So we are doing this. And that's something that's different from doing that, right? That's degradation of tissue and loss of functionality. This is restoration. And there's a big difference. I wanted to put another picture here of like laser therapy, because that's healing through destruction, as I would identify it. And anytime you heal through destruction, you really have to make a very consistent, considerate thought process for it. Because are you really helping the body? Or are you just hurting the body in a way where it knows how to recover? And that's why there's not a when you talk about like high level laser therapy, there's not a above 70% or 80% success rate for it, because it's nerve based. A lot of times the body just doesn't know how to recover from it. So that's where you get that 30 to 40%. And that just wasn't a recover anyways, because there's no connective tissue there, right? So there's no development to actually retrain. You know, sorry, I digress. That's further into the weeds. So this is a more significant chart that shows you exactly what the Avazzia is doing, right? So this is 1.9 milliseconds. So just to tell you, like a thousandth of a second, right? Or this would be a yeah. So this would be 100th of a second. You see this peak waveform, and even trans this 100th of a second. This window that they said this would be a 1,000th of a second, and what you see is that this was, I think, probably on relax and probably on like intensity 200, so intensity 100, and you put it on, the aperture increases till the body responds. It increases resistance, change of tissue is measured, and then the next aperture wave modulates based on the body's response. And then the next wave modulates based on the body's next response. So it's adapting and creating, those peaks are created by your body, not the device. Well, I mean, the device is creating them, but the device is responding to the body's mechanisms of response. And so when each of these words are said, where it says, okay, well, we have a high voltage, which means the amount of energy delivered, that energy is delivered. That's not lost energy. You see that there's no stepped amplitude, which means that's lost, right? That means that the circuit is draining there. Okay, so energy delivered, damped, which means that it is consistently diminishing the amount of energy needed to maintain the signal. Sinusoidal waveform, which means it's not increasing or decreasing it too fast where the body can't adjust to it. Under contact, so it's in the circuit, right? So this is the initial state. That first window, it's say like a half a millisecond, you get this initial blip. And then as it goes out, we get really defined in there. And that packet system. So in the first second, we're already in extremely well optimized connective wave signals. And this is the crazier part about this too, is, a lot of times people, it'll take 5 minutes before all of a sudden a whole arm will start triggering or a whole neural layer will start triggering. It's like, well, why is that? Well, because it recreated the neural pathway to actually trigger that again, just by the subtle reinforcement, right, of these waveforms, right? So you can see that the electrical discharge being applied, that's the amount of energy given to the body, right? So the body took a lot of energy at first, and then it stopped. It said, oh, I only need this much. That's like a millisecond in. It's 2 milliseconds in. Isn't that it's crazy to think about. But that is when you understand the physics of what's going on here, that's, hey, for less than a second, I needed energy, and I don't need any more energy now. Now I'm just using the waves, right? I'm just getting the small reinforcement, right? So, so what do we know? Over time, whether the body needs energy taken away or the body needs energy provided, it's biphasic. We do both. So when we do, like, for example, people have like the Accuscope or the testing agents for the essentially how conductive the region is. Avazzia scores perfect in equilibrium balancing. If you were yin deficient or yang deficient, doesn't matter, balances it both. Why is that? Because we take energy from it, we give energy to, in balance and in accordance with how the body wants it. In response, at a microsecond level of instigation, you can see how that waveform actually adjusts for the body, which is, it's crazy to think about, right? That we can get that level or that degree of interaction with the body. So it's something to definitely recognize that it is not the case that we have this wave always going. The longer you have, if you keep the device on it for a minute, that wave is so locked in to the body. And when you paint, the reason why painting is still a viable method is that when you paint, what seems like just a second of painting is an eon for the device. It literally is doing a million calculations, million adjustments per second. So these new various functional nerve endings, nerve connections as it goes through, is constantly triaging, constantly a million. It's really connecting and going through, right? So painting is still a really viable method. It's almost an amazing thing to think about, but because of the latency of it, it happens so quickly. Attuning the body in this way is very effective. Is there any questions on this the particular subset of graphs and information? Any no questions? Okay, because from here on, I hope that I hope that you understand a thorough background in the biology of how the Avazzia works, and now you should understand a thorough background of the physics of how the Avazzia works, right? Because we're putting a circuit in, we're attuning the circuit to the body's nervous system, and we're responding. The device is auto-responding, not we. The device is auto-responding to the body's nervous system. That's what the reaction-based technology means, right? Is to respond natively extremely fast to the body, and fast enough to where the body cannot recognize it's an external force. Because the body can't recognize its external force, the body never acclimates to it. Because the body never acclimates to it, the body works with it. And if it works with it, we can use it for longer. There's no addictive properties for the device. I mean, you're going to want to use it if you're in pain, but that's not an addictive property. That's a tool and response. There's no diminishing rule of therapy. Just because you use it once doesn't mean it diminishes. If you get a cortisol injection you can only do 2 before it's ineffective, right? Proportionally ineffective, right? Because the body triages the mechanism to actually reroute the nerve in the pain in the area. And it's a new way of signaling that you're in pain. Which is why, this methodology is so important to realize and recognize that it's how effective it is. We're not working against the body in any way, shape, or form. And this is also a key indication point too. When we talk about neuropeptides being released and hormones being released, that's those released mechanisms and pathways are done in the first millisecond. And then we are also reinforcing the pathway from which they can approach. We're reinforcing the entire meridian pathway and the fascial pathway. There's a question that says, can the Avazzia be used in a different location but at the same time as other electrical stim machine? Absolutely. Yeah, you can use, the most Avazzia units I've had on me was 12. And you would say, for what God's reason do you have that many devices on you? And I said, well, it was an experiment to see how many you could do without it being overwhelming, right? And we identified like 4 different functional grouping systems, and we went from there. But you could have 12 Avazzias on you. It works all at the same time, right? And likewise, you can have other technologies, complementary technologies that are doing other things, and the Avazzia working because of the inductance feature, right? So low that, and not just so low, like you could see in this one, we only got to 19.8 volts. That's all the body needed. We don't need to consistently keep that in. When you're doing the step feature, when you're saying, hey, we're a square wave, we're putting how many volts through that amplitude at the top right here, that means that you're putting in 10 volts all the time. The body doesn't need it. Like it literally does. It overwhelms the body. Now there is certain responses, like I'm sure the other technology you're using is fine if it's under label and they're doing exactly what they say they do. But I mean that very seriously. You can drive a pathway out of whack by using a TENS unit. You get this all the time where you fatigue the pathway, right? So it's something to think about where you see in each of these interactions, the voltage, that are covered, it's like going down. It's like, okay, well, it's like we're really diminishing the amount of energy needed to get change. And it's like the most work for the least amount of value. And that is optimal healing. Very successful optimal healing, which I think is impressive, to say the least. The technology is impressive. The fact that and talked with Tim about this, the fact that he said that the closest variant to this technology was in the 1900s, and was specifically, it was killed off by the pharmaceutical companies specifically. It's like, okay, well, there's a reason for this. It's like, because it's very effective at doing this job. We're able to triage the body without hurting it at all. And we're able to mitigate the nervous system without diminishing the efficacy and efficiency of the nervous system. It's like we're able to help it. Okay, well, what is a allopathic solution for this? It's like, well, you can have stimulants that increase the efficacy of the nerves in the area, sure, but your body acclimates to it and it develops defense mechanisms, or it accustoms to it and stops producing the hormonal agents, the neuropeptides that are necessary for creating the signals. So that's not a solution long term. That's a dependency issue, right? You have depressants, inhibitors. Inhibitors just create the same problem in the reverse feature. Body overproduce the agents that are necessary to repeat it. And the body defends, and if at worst case scenario, like I was talking about fibromyalgia, the body attacks the mechanisms of delivery that you're actually assigning to it, right? Where it's attacking the nervous system, attacking A fibers and C fibers all across the body. You have fascial tingling and fire and heating up all across the body, right? Because the body doesn't trust you anymore. It's like, why does that happen? Well, turns out I was, messing with how the body should work instead of allowing the body to work. Okay, well, that's a clear problem, right? So I hope that rambling's not too much, and that you do find value out of the technical, because now we're going to dive into the more feature oriented and just the work. Any questions left over on that? Yeah, so when we talk about the benefits of doing the core whole body, which is covered in here, the core whole body is a shortcut of protocols to think about different key neuroactive highways. So the central nervous system goes across the spine. You'd think the core body we're working with the spine. I'll get into that and I'll preference that when we actually are in that. It's probably going to be around 3 o'clock that we get really dive into that one. The 6 points. I don't know if anyone's seen. It's called a neurohomunculi, but it's this conceptualization, and I almost want to pull it up. But I don't want to have it on screen. I might pause the recording and show it, or show it during break. But a neurohomunculi is this concept that your body physically is different than the nerve perspective, right? A lot of your sensory systems are much larger in our neurohomunculi. Our hands are huge, right? We use our hands for a lot of things. Our face is massive in the amount of communication and neural pathways through it, right? And the 6 points just so happen to correspond to 6 of the origin points in the fascioplantar regions that control like 70 different medical scenarios for the body in terms of triage scenarios, right? So, and I mean that very, very specifically. It controls like anything from how you're developed, how your face is enclosed, your sinuses, your lymphatic, your eyes, we're covering whole macro scenarios, and they get encapsulated. We get these encapsulated neuro inefficiencies because these are the origin points for a lot of the areas where we link them to, right? So like, for example, TMJ, like we're talking this trigeminal nerve line, right, comes in throughout here, right? And this often becomes a triage point because this is the force vector for a lot of our biting. When we bite, right, this is where we're triggering that pain. So it gets this neurally associated. The first thing that happens when the body finds it's hurt, it isolates the area. This is one of the areas that isolates right away, right? And you get this collagen, the jaw protects in compensation, right? And here with the sinuses, right? So each of the 6 points, right, correspond, if anyone's wondering, 6 points when we get in the future, right here, right here, right here, right here, right here. It's symmetrical, right? But these 6 points correspond to these fascial planes that are all captured. They're all captured in those areas, and I'll show that in a little while. I hope that understands a little bit of the questioning behind it, and that they are important, and when we go over them, they are important for specific reasons.
If I can ask really quick with the 6 point on the face.
Yep.
Just to clarify, you said it's good for control 70 different
It controls.
Good for
It controls. As the acupuncturist background of that, right? The thought process is, your bladder meridian comes through here, your stomach meridian comes through here. There's 3 meridians that come across here. That's one side. Each of those points, right, correspond to an entire network chain, the meridian line, if you think about channel theory. And of those, just those 3 points right here on each side, there's 70 different points of activation, right? So that's the first thing I know is that, okay, well, each of those, in honest, if any of those 3 points have active problems, you could be addressing more than 1,000 different scenarios. And this is when I talk about neural pathway speed. So significantly crazy to think about. It's like, you could have an inefficiency. You could have a locked jaw because of a hurt ankle, right? You don't even realize it. It's like, why is that the case? Well, if your ankle is constantly stiff and lack of mobility on one side means that you have to triage you have to essentially adjust for the lack of range of motion on the 4 structures. So you have an asymmetrical load. Means your right foot, so let's say your left foot's weak, your right foot has to compensate. Okay, great. Well, if you're never moving your left foot out, that means that your neck, when you're balancing yourself, because you balance yourself when you walk, is going to be asymmetrically tensing, which means your atlas is going to be asymmetrically tense, which means that the counter line to the jaw is going to be more stressed than one side. which is then going to trigger compensation in here, right? So it's all connected. It all comes together because the body has to respond. We're a moving, we're not a plant. We're a moving system. Everything is connected, and we have to triage everything actively. If any one spot was just terrible, we'd be dead. That's the rule of law, right? When we rule people dead in the hospital system, right? It's that, one thing causes complete and utter disaster. It's not that your heart gave out. It's that your heart gave out and that stopped everything else. There was a failure across the line. Doesn't matter if your lungs give out and your heart's still working, you're dead still, right? Because eventually your lung gives out, you can't get energy, the heart gives out, right? So we call this cascading lines of failure from the worst case scenario, right? The worst line of problems. 6 points is a similar concept. Is that all these areas triage to create bubbles of addressment scenarios, right? That you can be working on. So, like I said, you can do over 70 different points connect to the face of those 6 points, which is across the entire body. And then those points can govern more than 1,000 different problems, right? So it's if you go down the list, I mean, you could just map it out, right? Did I answer?
Yes.
Okay, perfect. All right. So now we're going to get into understanding the equipment. So now we have an understanding of the science. We're going to go into the actual utilization of the device. And I know it's been 3 hours or 2 hours, and we're just getting into actually using the device. But I really hope that the preference of, hey, this is what it does, helps guide you a little bit more. So this is the Avazzia ProSport 3. If people have the RSI, it's going to have the 4 modes to look a little bit different. I'll have a slide with that later. But yeah, this is the main professional unit for practitioners to use. This is how it looks. This is how you turn it on. It's very easy. You can tell that the person who invented this also invented the Texas Instrument calculators. Fun fact, right? Those calculators that are used, all those graphing calculators, that's him, right? Turns on the side, battery operated, easy peasy to use. Do the Texas 2-step, you can turn it on, put it on, which is what I actually recommend right now. If you have a device, you should just turn it on right now. It's not a problem. We're about to do a practical in a second. So you should have your device out in front of you. This is a good recommendation if you have it to get it out now. Okay, so what is your device? So the device has, so you see the front of it. You have the up and arrow selecting tool, and then you have the turn it down, turn it up. It has a back built-in electrode because in case you don't have attachments, you should still be able to use the device. I don't know why you wouldn't. And that was a pet peeve of the designer. So you should be able to use the device anytime. You shouldn't be attachment restricted. But I do not recommend using that onboard electrode. That's for testing a lot of times in recommendation. You can, it works. There's some things that does work well for. The reason being is when we get these machines back to service them, more often than not, that even though that looks very flush and sealed, and it's sealed, on an atomic scale, dust does get through, and it does slowly impede the functionality of the device. So if you haven't had your device serviced, would recommend if you've had your device for more than 5 years, paying $100 or I think it's like $300 for a professional unit to get serviced is worth it because they clean it out a lot of times. They open it up, it's dusty all over the place, and they clean it out, and that increased the length. That increases the lifetime of the device, and these devices last for the oldest. I mean, some people are starting to reorder, and from 15 years ago, right? Which is funny to think about because usually when you talk about a medical device, you don't think 15 to 20-year lifetime of technology, but that's really what the Y bars do not break. The only way you break a Y bar is you get a piece of metal in that, and I really shot myself. My partner Olivia shot me in the foot with that because we figured out a solution for breaking the tip in, and now we don't get Y bar reorders. So they never really break. You just bang the end. You hold down. If you ever get that Y, like the lead wire stuck in the Y bar. Essentially it's like it chips off. You're gonna need a new lead wire, yeah, but you basically hold the Y bar hole down and you just bang it on concrete and the little piece will come out. And it took a 300-pound chiropractor to figure that one out. And he's sitting there like, I bet I can get this out, and just hit it against the concrete. It was a pretty good solution, but gets it out. So everyone, if you can, take out your Avazzia Pro Sport, and I want to make sure that everyone, one of the key things that you need to understand is how to get to reactions mode. So, I'll just wait for. I'm gonna wait a minute, triage this, because I want to make sure you understand what that reactions mode is reading. When you first turn on your device, let me get my device out. You could measure that too. So let me see. Can you guys see me? You should be able to see me just fine. Dude, let's see if this screen comes up. So we turn on the device on the side, right there. You'll hear a beeping sound, and you'll see this, right? So this Relax Assess is the first mode that comes up. Very easy to use. Most of the time you'll be in there. But when we want to do reactions mode, which is to see all the nitty gritty, we arrow over. It's going to be to the left. And here it looks right, but it's going to be to the left. And you just press this button right here, right? And then you can test it with the back of the electrode. You put your finger on the back of the electrode. That's one way. And you'll see all these numbers. And this looks mystifying at first. But when you really start to look at it, it gets easier and easier to understand. Okay. Now, each of these numbers means something. So the first number that you look at here, this top, essentially this top left number, corresponds to the power level, the voltage, the intensity that you put down the line. The more I increase this, the more voltage goes through. Right. Okay. It's a multiplier effect in the voltage too, so it's not necessarily with it's like 500 correlated. It's whatever the device is signaling in the attunement, which is why that graph was so important to see, is that the asymmetrical load was getting more and more precise, right? It's like the amplitude's getting diminished, but the actual intensity of it. But we can increase that amplitude a little bit. Not to the degree that it's outside of the microcurrent, but to the degree that it is intense enough to where the body can absorb if it needs to. So the middle number is your initial reaction, the middle top number, initial reaction. The initial reaction shows you the impedance of the tissue in the local area. The impedance is the resistance, is the inverse resistance, which means how functional it is at going through, right? High reaction numbers means very poor functional nerve connectivity, right? So, are very unfunctional nerve. Essentially, the higher the number, the bad, right? Lower number, usually good. Too low of number, suspicious, right? You're looking for consistency. So usually what you do with a patient is, you're going to put the device on multiple areas and you're going to get an average, right? You're going to be like, okay, well, around 30 is what this person's at, because the body's adjusting every area accordingly. Well, if 30 is the average number and all of a sudden you pop in a 60 somewhere, well, the body's doing something there, right? The body's triaging or causing a problem there, because impedance isn't, as you would say, a problem is not random in the body. The body is working actively to triage all the things. So when you have a problem that is there, it is there for a reason, and it is working on that problem for a reason. It is creating that inefficiency for a reason, right? And most of the time it's, there is damage that was done and it hasn't figured out a solution to fix it. And so it's trying to figure out a better solution. So now here's the cool thing. That middle top number, that's the initial reaction. The bottom left number is the ongoing reaction, how you're changing that tissue. Okay, so And to cover it further, the bottom two numbers are those are the coefficients of the moduluses of what the body is responding to. So it's the ongoing reaction and the speed of reaction that you'd see, as well as the coefficient guidance. So if those numbers are ever equal, usually it means that there's no modulus, which means that they're dehydrated. So the tissue is not functional. So when we go to use reactions mode, our goal is to get a DZ0 because and that speed of reaction, so that also harkens to this line right here. When you see these waveforms, as that waveform is diminishing, at first, whenever you put it, it's always going to be a large speed of reaction, bottom right number, right? No matter where you go, it's going to be large. And then it's going to really drop. Well, that's the wave size that you should be looking at. That's how quickly. So when we're on DZ1, we're very close. We're only putting a little bit of wave modulation, right? But that takes the longest amount of time because the body hasn't locked in. And by the way, this is also the effect of why you can have it on DZ0 and it's still doing work, because it's still giving energy if it needs it, but it's found the optimal pathways, right? Anyway, so initial reaction, ongoing reaction. What you'll find is when you do DZ0, when you D, instead of the ongoing reaction decreasing, which is what you think it would be doing, because hey, I'm improving the process, it will increase instead. And the reason why it's increasing, well, because we're creating a scenario where the body has to address the afferent pathway has to address the issue. So that ongoing reaction, while you're parking on a spot and getting readings, is going to climb. And then what you'll see, and it always happens, it's actually kind of funny, is once you get the DZ0, it drops. The body recognizes a mechanism to treat the area and it self-diagnoses, self-doses, and then you're done. And that's fantastic. That's one of the things I want to make sure. Is there any questions on reading the screen? I hope this is the reactions mode. There are several different reactions. When you talk about the modes, I just want to make sure that you understand what's on the screen. Top right's always going to be the timer. Top left is always going to be the intensity. Every intensity is going to be different, right? Everyone's intensity and sensitivity to the device is going to be different. It's based on your nervous system and how reactive you are, right? So some people are very sensitive. Then you have to arrow over to the right. We'll change the sensitivity setting, but we'll get into that in a second. Just want to make sure we're good here. Thumbs up in the chat would be the right play. Okay. So before we break for lunch, which I think we will be doing soon, what I want you to do is I want everyone to get out the device, switch it on, and put it on their forearm, right? And I want everyone to turn it up until they feel a tense sensation. And it's not to the degree that we want it to be radiating in an area. You don't need an entire active neurological chain to be triggering. Maybe for neuropathy purposes, you could want it to be at that degree, but for everyday passive therapy, what you really want is just a tingle, because the tingle means that it's gone up the natural nerve pathway, central nervous system, and that your brain is sending a signal back, right? So it's been received. The tingle is all that's necessary. There's even a claim by Avazzia that you don't need it. It doesn't. Sub tingle is fine too. I think that the tingle helps psychologically, not as a placebo, but as a thought reinforcement process for healing, recognizing that place needs healing on a personal level. I think it helps significantly. Okay, so now additionally, I also think that in some cases, which you'll learn tomorrow, you want significant activation, right? Tomorrow you'll learn trigger points and trigger point therapy and modulus and modulating those areas, or those Loctite, lock long areas where you actually take over muscles and retrain them. Today you're going to learn, hey, I can put the device on my body, I can get a score, know that reading's a score, and I can understand that there's a tingle there, right? So everyone, I hope everyone, because there's not really any videos, so I can't really track it in, but I hope everyone is recognizing that they don't need to have it all the way up. Just a light tingle is all they need. And I oftentimes, I have a 10% rule. So I look at the number, I put it on the patient or client or practitioner, or whoever I'm working on, demonstrating on, and I turn it up until they feel a tingle, then I turn it down by 10%. It actually, and usually during that period of the next few seconds when I have the on, the patient, it usually acclimates to the patient, because the device gets stronger the more it sinks into the body, it tunes into the body, not weaker. So I triage the case of them of a person basically not telling me, oh yeah, or it's starting to tingle too much, uncomfortably, and I just do the 10% rule every time. Because instead of making an issue where I know that they feel the tingle, so I know it's working. One, I know the wire is on, I know that the Y bar works, I know that's there, and they recognize that it does. They, first of all, to get the tingle in the first place, they recognize it's not a fugazi, right? They recognize it's not a joke. It's an actual therapy, right? More often than not, a lot of neuropathy patients, for example, don't believe it'll ever work. In fact, they psych themselves out. And then, and yeah, you'll turn it up to 250. You'll turn it up all the way with neuropathy patients, right? And they won't feel it. And then all of a sudden you'll hear screaming from the other side of the room if you leave them pads for like 15 minutes, 10 minutes, because it's way too high for them. It opens up those pathways. They're firing again, they're activating again, right? Which is why whenever I, leave a neuropathy person to bake, as you'd say, I tell them, hey, this is how you turn it down. You're gonna feel it. It's like, oh no, I'm not. 10 minutes later, it's like, oh yeah, I turned it down. I turned it down by 90%. It's like, yeah, why? Because your pathways were just sub-optimized, and now you're actually signaling again. It's like, okay, cool. So something to be aware of. All right, so hope everyone understands the goal is tingle, not pricking. And this also harkens to another type of technology like the Dolphin Tech, right? Dolphin Tech is a microcurrent device that stabs you in because they can't handle the epidural air, right? So they stab it in on key meridian spots, right? And they channel it. It's like, okay, that's great. So painful. It's unbelievably painful. And the resonant wave interacts with the B fibers as well to cause chronic radiating pain, like just radiating down. It's a miserable experience. What can we avoid with that? Well, we can avoid the pain, make it more comfortable. Most of the time in my clinic, when I have a practitioner, I teach them how to do this properly. I laugh because all of my clients fall asleep on the table when they're doing this properly. A lot of them fall asleep. They say it's too relaxing. It's like, why is that? Because they're not causing pain. We're releasing opioids. We're relieving this. We're numbing this. If they've been in pain for so long, it inhibits sleep. It inhibits the ability to recover. And they go into a recovery process. It's like, that's perfect. It's what you want. You want them healing. You want them initiating that recovery phase. Now, of course, you want them to be able to drive home, and that's fine. They will. It's not audio or visually inhibitor, but what we find reports of is after the night after we do like the coral body or the therapy, the full body therapies, they have tremendous change in body. The body starts to go to work right away. It says, hey, I got all these improved pathways. I got all these improved nerve sites. Man, let's put it to work. Let's get some in and outs going, right? Which is why you don't drink alcohol or exercise overly right after you get the therapy done. Why? Because your body's still in recovery mode. You're still recovering. Not from the device, but actually from the traumas that you've experienced that are causing you these problems, right? Hope everyone understands that that's a significant thing. So, all right. So this, again, this is the device. This is my chart that we will be here for an hour after we break for lunch, literally. I'm gonna leave this right here for now. I think what we'll do, if everyone's amenable to it, if we want to break at 12:10 and come back at 1:10, we can do that. And then the rest of this day is going to be on practicals and having the devices on you. So I actually would prefer everyone get food in them and drink water, and then we come back and we start doing the actual therapies. Does that work for everyone? Need some replies in the chat here.
Yes.
Yes. Okay.
Yes,
Is-
sounds good to me.
Okay.
Thank you.
And if you have any questions, I can answer any questions. I'm gonna stop the recording now. I just realized I want to make sure people get this thing. So we're gonna go over the modes, and we're gonna start with the RSI. So the RSI has 4 modes. It's the relax, acute, RSI, and deep stim. RSI stands for residual strain injury. It is or repetitive strain injury or repetitive stimulation intensity is the other just 2 acronyms we call. It's whichever one you prefer. But the goal of the RSI device is to 1, mitigate strain and tension, 2, dump a lot of electrical energy into the body in a way that helps the recovery of the nervous system. So for people who have intense nerve damage, you can use the RSI to recover from the intense nerve damage, right? It does as much professional work as you could do in a easy to use package. That's 4 modes, and you can do a lot with those 4 modes. But going mode by mode, so the Relax Assess, which is on the RSI and the Ultra and the Pro Sport 3, is a like 59.6 hertz frequency. It is the primary mode. It's literally synced in with one of the love frequencies for the nervous system. It releases serotonin and calming hormones when on the body in that subset of frequency. So the reason why relax is relaxing, right, is 1, it's below 100 hertz, which is in itself sedative, right? That's a trick. If it's over 100 hertz, usually it's stimulative, right? But if it's under 100 hertz, especially in this microamp phase, it's going to be very relaxing for the body. It is synced to that love frequency that as the body tunes into, and the body is tuning in when we're putting that circuit into the body, it's tuning to that phase of whatever frequency it's going, which is the big difference from just putting an input signal in, right? Other like frequency specific devices, they put a signal in and they expect it out. No, the body triages everything, changes everything, right? So we get that the body actually resonate with that signal. It's a completely different endpoint. So relax, assess, we get that loving frequency in, and we can use this all across the body. The body could always use love, right? Love and attention. And it's a good reaction mode, right? But in the RSI, you're primarily using this for any point that's in pain, but not chronic pain, right? Because if it's just it's small fatigue, or if it's a minor injury, the proper goal is to give it some attention, but not too much to where it's exaggerated and fatigued, right? Just, as I would say, the body needs some love. You got to give your body some loving, right? As all things to considered, as you go across the body, the stickiness is that isolated area. Remember what I said about how the body is defending itself in those areas? Well, what happens when we put a love signal into the fascia? Well, instead of being scared that it's going to die if it releases that tension, it feels safe, right? And so we trick the fascia into this safe feeling. And it's not a trick. I mean, it generally feels safe. There's just no way to communicate that with the afferent pathways, right? The brain has no way to communicate that because we're always scared of our body, because the first thing our body says is pain. Hey, like we release and we start to move something. We tell it, hey, move. We're commanding the signal, and we get this pain signal back. Well, that's our brain generating the pain signal. And then the body feels the pain signal and freaks out and says, oh my gosh, what are we doing? Tense up. And you get this reinforcement of negative signaling. Okay, well, how do you address the negative signaling reinforcement? Well, if you're meditating and really focusing on the parasympathetic, which is almost impossible consciously to deal with, then you could do it. Or you can just use the Avazzia, right? And you'll hear that a lot when I say, or you could just do this, right? Because there is a way to do it. You can use call and release tactics. Physical therapists do call and response all the time, where they push on something and they let you release. They push on it lightly, they let you release. It takes time to release that soft tissue. It takes time to get the body to feel loved and accepted. It takes time to get the fascia to understand that it's not going to die if it releases. Incredibly long time. Because it's muscle memory you're fighting. You're fighting the parasympathetic, the autonomic nervous system. You're fighting that. So what we do is we put in the relaxed signal. We put in that signal that helps stimulate just enough to where it feels accepted, but not too much to where it becomes depressant or responds in a negative fashion. So overstimulation causes fatigue, right? So, and by doing this, we provide the opportunity for the body to release and relax, and for the body to unisolate itself from essentially this negative isolative protective position, because the body's in compensation for a lot of these things. A lot of these times the body's compensating for these traumas, these scars, these issues. So it's like all over the place, right? The goal is not to compensate. The goal is to actively be proactive in your health, right? It's slowly improve. So it's definitely a key thing that you can consider and think about. Okay, so that being said, what's the difference between relax assess and blue relax, right? Well, relax assess is that love frequency. Blue relax is, and by the way, not to say that that frequency is going in, but it is oscillating back and forth with the amperature of the hertz, right? So that it's resonating and then it locks in, right, as you'd say. So we get around the love and then it locks into the love, okay? The blue relax has a higher upward bound on the frequency it can lock in, because the dermal, epidermal, and subdermal layers have a higher resonant frequency that the nerves interact with. So blue relax is used for surface skin issues and dermal layer, epidermal skin layers, because it can resonate those layers better. That's the big difference between blue relax and relax assess. And I all the time people are like, oh, I just use blue relax. It's like, no. Relax assess has a fundamental different function than blue relax. Fundamentally different. Different signal, different goal, right? Scar and pain. But they both are sub-100 microcurrent amp locked in zones. They're both going to help with pain. They're both going to release those neuropeptides. One is going to be better at getting the fascial release, though. Right? So that's what we talk about. Any questions? Cool. All right. So RSI has that relax. It has acute, and then the namesake RSI induced. So acute is, like I said, above 100 hertz, very stimming. But what acute is acute is a on and off, on, off, teaches. It teaches. Now, it's not just on and off, though. Here's the neat thing about it. It goes on, hyperstimulates, maximum stimulation that the body, the nerves in the area would perceive as a stimulation feature. And then the off is not off. It's off is a maximum relaxation signal. It's a training mechanism. Acute is a training protocol. Train the body what maximum stimulation is, what minimum stimulation is. Because whatever middle ground it's picked to choose to rely on passively is wrong, right? So you can use acute anytime you think that the body is just inherently passively wrong, right? And this gets into, tomorrow when you talk about lock, long, short, you're going to use acute all the time. You're like, oh, that arm, that pectoris major is off. Your shoulders are rounded. Your pectoris major is off. Your pectoris minor, your upper is off. Your lower is a little short. Your SCM might be lengthened. You might be holding your head in a certain way. Your, scalenes can be off. Your abdominals can be activated. Well, guess what? Those are all moments that you can triage and interact with using the acute setting, because you can retrain how the muscles should be laying on the body. You have a pathway, a toolkit, the right tool for the right job. You have a toolkit for interacting with the autonomic nervous system's passive overlay of the neuromuscular system. Question? Oh, okay. The acute is, as you'd say, a toolbox for retraining muscles. It also is a rapidly stimulating multi-phased system where, because it's dampened in a certain way, it's abrupt enough to where it disrupts the current activating subset. So if in the case where someone is under spasm, it disrupts the spasm. Now, I would not recommend for to say that you should treat someone who's having a seizure, right? I wouldn't say that, hey, that's your own prerogative. There are cases where acute has helped people who are having active seizures, and it was used as a tuning mechanism for the person to come back from active spasming. The reason being, and this also has to do with a new subset of studies that we're doing with Parkinson's, where that is active upper motor neuron triggering mechanisms. Acute actually helps significantly. Oh, I guess so. Someone was asking the question, I guess, could someone go over the difference between relax and blue relax? I'll get into that when we get into the Pro-Sport Ultra for certain, because I want to make sure that we cover all the RSI, and then we'll go on to the next stage. So acute can be used to retrain muscles, retrain the body, and teach the body to come back into a balance, right? RSI is it's a very sedative frequency subset. It's very low. It's almost it's sub 30s, right? So it's almost a brainwave frequency, and it's meant to connect to the afferent pathways on the way down to the cortisol level production. And so when the body is not good at healing itself, it usually is because either A, you don't want it to be healed, and you can stop yourself from healing. I absolutely think that you can cause yourself to stop healing. If you focus on being unhealthy as possible, you will be unhealthy, right? Actually, neurologically, the type of hormonal stress agents that you produce will create asymptomatic signal strain across the board. So if you think long and hard enough that a toe hurts, it'll start hurting. If you strain long and hard enough, you'll overstrain it, right? So one of the first goal of every practitioner is to say, hey, stop putting the foot on the gas pedal and hurting yourself, right? But some people don't understand how to focus on healing themselves anymore, focus on having positive interactions with their body. That's when you get diabetic neuropathy issues, where you have these loss of signals, these loss of ability to connect, and it really is on the body's neural pathway level that these nerves are dying. They're not activating properly. And so RSI, and it's because we ignore them. We ignore the strain signals. So for example, carpal tunnel, right? What is carpal tunnel? Carpal tunnel is the overstraining, consistent repetitive overstraining of the tendons in the arm, right? In the hand-arm connection, right? Well, what do we do when we strain that? We ignore the signal. The afferent pathway out, we say, shut up. I don't want to hear you anymore. We ignore it for so long, we get good at ignoring it. And when we get good at ignoring it, it no longer works. And so you get these really weird asymptomatic or weird pains. You're like, where is this radial pain coming from? Why it doesn't make any sense. And it's because we've developed a psychological need to ignore the signal out and to not connect to our body while we're straining, because we need to work, we need to do stuff, we need to write, we need to type, we need to be functional. We can't sit here and experience this pain. Oh no, this pain? No, I can't. I have to push through it. What does that build? It builds a habit of compensation, one. It builds a destroyed neurological framework, right, for that area, because you want to push through the pain, which is terrible. You listen to the body. It's the first case. If you don't, the body is smart and stupid. If you don't pay attention to the smart signals, the body starts to act stupid, right? Right. So if you don't pay, but the smart signal is, hey, I'm straining myself. Maybe I should stretch it out. Maybe I should relax. Maybe take a break for a second. The stupid signal is, hey, I'm not doing anything now. It's still hurting, right? Carpal tunnel. Great. Right. Because the body wants to make you stop. It doesn't know how to do that. So what RSI does is it reconnects that lower half of the self-healing process and provides a tremendous amount of energy for that subset of multi-phased energetic healing. Provides the most electrical discharge into the body, voltage-wise. Significantly more than what the body would need, but not to the degree, and this is why the biphasic and the sinusoidal waveforms and the dampening is so important. Because if another device did this, it'd be a taser level of strength. Literally, it's a taser's worth of energy going into the body. ATP increases by 500% during this process. The structure studies show ATP reduction increases 5 times. It is an exorbitant amount of cellular recovery that occurs. And we even cut that there's an old adage like cellular nerve health and recovery takes a month to recover a nerve. Well, because we skip the phase of nerve recovery, we just directly rewire the pathways, you get nerve activation in the acute area within days. So you can have, for example, we're closing wounds with the RSI setting. This is what they use to close the wound. We're closing them within a month. And it's like, how are we doing that? It's not closing from the standpoint that we're sealing it and there's no internal, it's closing it from the internal outside, which means we have to have nerve recovery all across the board, constant nerve recovery, because it's layered expansion out, right? So how are we doing this? Well, we're doing this because the body, when it's given the proper energy and it's given the right signal, the nerves want to recover. They don't like being in the stress environment. In fact, the gene expression is synonymous with cancerous adaptations, right? They go up, apoptosis occurs all the time. Then you have subtle gene mutations that occur that create significant degradations in the gene expression, which is why I talk about the environmental stressors for a lot of these things. It's like carpal tunnels doesn't sound fun. It doesn't sound like it would lead to anything, but it definitely creates inflammation. It creates joint problems and it creates compensations that underlie. And then if circulation gets impeded enough, range of motion gets restricted, you get frozen shoulder, you get cardiac problems. Because you can't de-stress, you can't release. You can't release, you get chains of cascading failures. Which, again, RSI, very important thing. Nerve damage is the key, and it's self-healing nerve damage is the issue there. So it's really helpful for that. Deep stim is significantly different from all the other stims in that I like to, the reason why deep stim's on the RSI, and it's a good quadtet, I think, or the quartet as they'd say to the 4, is in cases where the body has very blocked nerve channels. And by blocked, I mean inefficient. And by inefficient, I mean like almost ignorant. And that's the right word. It's not, the body doesn't care that they're not efficient enough, right? So what do? Well, we put almost like a power, like a pulsating drill. We put this, when you have a drill, I don't know if anyone, the analogy I would like to use here is when you have a drill and you're drilling into a wall, and that's all drywall, right? If it's just a normal drill, you'll start drilling and then you'll get stuck in a pocket of just granule sand, right? As you say, there's nothing to take the sand away, so you just keep spinning in the same area because the movable changed tissue that would have changed is all changed. And now you're stuck with that changed tissue. There's nothing that go deeper into the penetration side of it, right? So a lot of times when you're getting some change in tissue, you'll find that you'll get your diminishing returns on your change because the pathways that are established that were the optimal at the time were not the true optimal pathways. You're getting into as you say, a local maximum, right? And these local maximums are good enough if you're running RSI because it stimulates, it gets it done. Well, how do we improve, for example, diabetic neuropathy? If there's open wounds developing because of inefficiencies, how do we improve it? We use deep stim as a pulsating drill. When you have a pulsating drill, it hits the wall, turns, takes the dust away that have formed, hits it again in pattern, right? Okay, so what does that mean for electrical physics-wise medicine, right? Well, the circuit activates, it reinforces on that activates. Hyperstim reinforces, pulses, listens for how the body reacts, shuts off. comes right back. Shuts off, comes right back. There's no establishment of a local maxima. It continues to alter those pathways, incredibly exploratory pathways during that period of time, which is why deep stim lights up the feet, right? All of a sudden, it all tingles all throughout the pathway because it's exploring. Your body's exploring the mapping of how it can actually remap it. And the neuropathy protocol is like 15 minutes on the feet, then and deep stim, then 15 minutes in RSI. You deep stim first because you want to find the best, optimal, maximum neural pathways to reinforce, and then RSI reinforces those pathways. Right. Okay. That's the RSI device. Use it. You can use it for 99% of pain. In fact, there's only one case where it is not something that I would use for pain. And that is in cases where the nervous system can't be trusted anymore. Right. So that's when we talk about cystic fibrosis, fibromyalgia, we talk about immunosuppressant anti-immune system or anti-nerve mechanisms that have been taken. You need something more. So I'll get into that with the complementary therapies. But like I said, the RSI is very good for pain mitigation if done right. When we get into the ProSport Ultra and ProSport 3, the reason why you pay more and you have more is you want to do it faster, you want to do it better, you want to be more precise with it, more technical, which is what the practitioner's goal. We don't have 8 hours, we have 30 minutes. How do we do it? Okay, well, this is how you use it. So, and we have all these extra modes for that reason. So each of these modes do specific things, they target out. So the ProSport Ultra adds in Blue Relax, Modulate, Stimulate, Blue Stim, Vaso, Acute Trauma, Harmonics, PG2500, HGH, and AVA. Okay, that's a lot. That's a steep price difference. I mean, it's about like $1,500 in price difference, but it adds in a bunch. Why does it add those in? Blue Relax allows you to do scar tissue, right? Effectively, fast. You can do scar tissue with the RSI. You can do the Relax, and you could do Deep Stim, and it's going to help, or do Relax and RSI is what I would probably do for scar tissue with the RSI. But with the ProSport Ultra, you're going to use Blue Relax and Blue Stim for scars. Why? Like I said before, up on top, this is to cover that question. Relax Assess goes to 59.6 hertz. It's a loving frequency, right? That signals into the body, makes it so that the body is receptive and relaxing. But it doesn't stay on that frequency. It's a subset variant, right? So that means the bounds of which it starts with is lower than, say, what Blue Relax goes to, higher degree of bandwidth, because the skin layer, the dermal layer, has a higher resonant frequency. So it can resonate to the frequencies that would match those scar features, the pockets and the C fibers there, better than, say, Relax would. But Relax's goal is different. Relax's goal is to work with the fascia, work with the body, give the all clear isolation is not okay sign, right? Blue Relax, the goal is, can we get resonance all throughout the region, from scar to internal? If you get resonance all throughout the region, guess what? Like I said before, hey, if I can call for help and I know there's a scar tissue here, I can now call for macrophages to come in and get the scar, right? Because macrophages love to eat scar tissue. The fibroblastic tissue is just really nourishing to them, oddly enough. It's kind of funny, but the body loves to eat it. It's very resource positive. So Blue Relax versus Relax. Blue Relax has a higher resonant frequency. It is great for scar tissue. It also helps with pain because most of the nerve endings are not deep in the tissue, right? If you have a 3rd-degree burn, right, you don't have sensation anymore in the region. 2nd degree, you have a lot of, I mean, it hurts a lot. It hurts a ton, right? So the logic of being that is, you know, for short-term, local regional, Blue Relax might be about 5 to 10% better at pain mitigation and speed. You can maybe get the pain out faster. But that doesn't mean that doesn't mean that you found the right problem. And I'm a thorough believer of whenever someone has pain in a specific region, unless they were stabbed there, there's usually compensations that are driving that pain into that position. Right. And that just happens to be the end cap of wherever that pain is. But not going further into that, blue relax can be substantial to say it's better for pain than relax is, but relax's goal is to, again, give the all clear signal and decrease compensations. Okay, modulate is relax on steroids. So what modulate does is it takes the opposite direction of saying, hey, you are the question was, can macrophages decrease bone spurs / buildup via blue relax? So bone spurs are a development of calcification created from a compensation to support the body. They're not a foreign entity. A lot of people think that they're just, they're a negative object that's formed in the body. No, they're a response to your structure and posture. In fact, tomorrow, what Lynn will claim is that your structured posture compensations specifically create bone spurs. If you have external rotation in your feet, as you walk, you're going to develop bone spurs in your ankle and the bottom of your heel, specific to the design that your structured support needs to be supported. Your feet need to support the excess force being driven down. So first step is the macrophages are not designed to eat bone marrow. They're designed to eat cellular debris and decay, different biotics, different agents. Do bone spurs decrease over time when they're not used is the right question. When you fix the underlying structure that's created the bone spurs, the first process is going to be intense pain, because now that the reinforcement's no longer needed, it'll swell. That swelling will decrease the density of the bone spur. Over time, it'll shrink. It takes time though, because the body, it took time to develop it, takes time to take it away, because it's calcification buildup. And calcification builds up are constantly fed, right? So if they're no longer needed by sport and structure, then they no longer get fed. The density decreases over time. They slowly break away and they slowly get dissolved back into the body and reused and readjusted, right? It's not necessarily that they get dissolved. They just lose their structure over time, and then the body absorbs it back into whatever's necessary, usually into resupporting what was originally the proper proper, as it'd say, axis of force or axis of dynamic structure. But again, that's getting into Lynn's class. Good question, but and there is a degree to which you would use probably deep stim and RSI and modulate in a very specific protocol for that. But they'll get into that tomorrow. Okay, so modulate takes the opposite approach of relax. Instead of saying, hey, we love you, modulate shouts at the nerve endings and acts as if that modulate used to be called massage is the other caveat here. The FDA made them take it off because it's not necessarily correct. But what does massage do? Massage adds chaos to the body. Ordered chaos, but still chaos. It disrupts the current positioning and structure of the fascia, the nervous system, the circulation in the region, right? And that disruption is the key feature of massage. Deep tissue massage disrupts deeply into the tissue, right? It can be painful at times, right? Because you're disrupting so much things. The body is trying to defensively warn you against it. So modulate puts enough chaos signal-wise into the nervous system where the body has to stop, reorient itself, and figure out what the heck just happened, right? So, and this is one of the best things you could do while we're talking about these modes. You could put pads on your abdominals, your stomach, so as is very durable when signal strength and stuff, and you can be experiencing each of these frequencies while I'm talking about them, because it'll actually give you a resonant idea of what this experience is, right? So maybe put a set of pads on the stomach and just be cycling through this while we do this, because each of these modes have a different, it's not all the same, different sensation completely, extremely different sensation actually. Really alters from point to point, because they actually target, depending on the frequency, depending on the sinusoidal wave adaptation and adoption by the device and the body. It's experienced different. Some are sharp, some are low, some are dampened. So you get this experience. Modulate is more on the like ear scratching. Like if you're taking a chalkboard and you're taking it against the chalkboard, the body pays a lot of attention to it. And then likewise, the musculoskeletal system adjusts rapidly. So if you have a locked short tissue, right, it'll release. And you can, instead of needing to do a lot of physical therapy back and forth to release something, you can just use that modulate. And 30 seconds to a minute is very easy. Stimulate is you want to create circulation in the region. It's moves back and forth. So it's essentially it's oscillating back and forth between these ranges. The general thought is because each of these ranges of frequencies triggers different gene expressions and different hormone production cycles. And the theoretical thought process for this is, hey, you're probably missing some key set of hormone activation to regulate the circulation processes. Like if you're not producing the right cytokines or having the right vasodilation in the area, it's probably because you're missing a hormone and that production of hormone because of gene expression. Why don't we oscillate back and forth until we get that correct expression? It causes, now that oscillation will release neuropeptides that activate muscles, right? Which is why we get the activation of muscles, but it'll also stimulate and circulate as well. So that's good to know. Deep stim, like I covered, is like that pulsating drill. It's stimulate with a pulse. So whereas stimulate is just going to trigger that acute pathway and make sure there's circulation, deep stim pulses that acute path, make sure you find multiple different pathways, and then adds that stimulation on top of it. So it's pulsing as it goes. This is what you can think about it as. Great for pathway rediscovery. Blue stim, just like how stimulate is in a certain bandwidth of frequencies, blue stim has an extended range for higher resonance in the tissues, because the dermal and epidermal layers have a higher resonant range, which means that now we're not just focused on getting circulation into the tissue, right? We're getting circulation into the skin, the dermal layers, right? We're getting that vasodilation into the actual tissue that needs it for scar tissue recovery, which is why it was designed. Blue relax, blue stim, right? Blue relax, you relax the fascia, you smooth it out, you get neuroconnectivity and de-isolation of the local region with all the way up to the dermal layer where the scar is impeded. And then blue stim, you come in, you get circulation and stimulation all the way up to the dermal layer, all the way to the edges of the scar, right? Reconnect and rediscover, right? So great modes. Acute, we covered. RSI, we covered. RSI you're going to use for most nerve damage. It's going to be your general go-to. Whenever you think there's nerve damage or just a general lack of ability to utilize, RSI. RSI also has a reaction mode to it, just like how relax does, where we get that feedback back and forth. And we can dose with RSI to provide the body the right amount of stimulation to know when we're done. And that's the key feature of that the ProSport Ultra and 3 that you really see that feature on. Vaso is so they say it's a variety sophistication output. It really stands for vasodilation or a variable assisted vasodilation. It was designed so that if the body has AFib or has a weird circulatory process, it would regulate that circulatory process by tuning in and syncing to a circulatory wavelength. It oscillates back and forth tremendously, and it pulses in several different variables. It's about and to specify, it's a 15-minute cycle for that. It's not a minute-long cycle. So it's one of those modes that you want to keep it on the body. You're gonna have pad work. Keep it on the body for at least 15 minutes. It is a cycling mode. So it does more than just, it's not just like, oh, I feel this for a minute. It lasts for like, I think 14 minutes is the actual cycle for it. And it goes through. It's great. It was designed for diabetics. It was designed for people who don't have circulation and need a variable augmented system. So essentially changing variable augmented, ever changing response system to a actively healing circulatory system, right? Is what you should think about it that way, right? Diabetics have a terrible circulatory system in the extremities. Why? Because essentially it's like the ability to distribute resources has been impeded. So now that you're getting resources there, it's ever changing, right? A lot of changes happening all of a sudden, right? But if you're just going to distribute resources, it's going to be useless. It needs to be constantly changing distributed resources for variable situations, right? It's like you can dive deeply into that one, but it's a good mode. It's designed so that you don't have to, as a practitioner, you don't have to sit over your patient, especially for neuropathy and diabetic neuropathy and patients who have these long-term issues. Like you could just have them come in for an hour, 30-minute session on I would do deep stim 15 or deep stim 15, RSI 15, then do a 30-minute vaso session, and that's done. You could also do the full like protocol if you had an hour with someone and you had a device ultra set aside for them, and this is like ideal. You would do 15 minutes of harmonics, 15 minutes of deep stim, 15 minutes of RSI, 15 minutes of vaso, in that order. Why? I'll get into harmonics in a second. In fact, we'll skip acute trauma, we'll go to harmonics. Harmonics is it's a stepping mode. It's an algorithm, right? Goes A, B, C, D, E, right? Goes down this algorithm of modes, of frequencies. And these frequencies are your alpha, beta, theta, gamma, delta, brainwave frequencies. Okay. So why are we putting brainwave frequencies into like the foot or the area, the body? Because we're redeveloping how the brain can talk to the body. We're redeveloping the strength and the viability of the afferent pathways, the autonomic pathways, right? And so in doing harmonics before we do deep stim, harmonics gives the body the language to communicate in the assistive healing. Deep stim gives the body the pathway, finds the pathway. RSI reinforces the pathway. And then vaso supports the distribution of that reinforced pathway. Isn't that a nice way of thinking about it? So now you're not saying, hey, we have this weird mode where we say, hey, I'm giving your body the language. Harmonics gives the body the language to heal, right? Deep stim finds the correct pathway to heal. RSI reinforces said pathway, right? And then vaso supports the distribution of the successfully reinforced pathway. Well, if you have neuropathy, you need all of that. Because not only do you not have the right pathway, you have the wrong way to talk to your body. You have the wrong way to reinforce the body, you don't have any circulation. So you've got a disaster, right? Which is why the second that a diabetic neuropathy wound or open wound occurs, the life expectancy of that person is less than 1.5 to 2 years. It's like then they get amputations, right? People don't realize neuropathy leads to amputations. Like a lot of patients. I mean, as a practitioner, you see it, you know it, you understand it, it happens, right? That's the end result, right? But unless it gets addressed, it is a catastrophic issue, right? And we talk about, passive, being unproactive in your health, being passive in your health leads to catastrophic issues, right? If you're proactive in your health, you don't get these catastrophic issues, right? Because you can avoid them by being proactive. Well, diabetic neuropathy, diabetes in a subset is, the degradation of your diet, the degradation of your body, right? via sleep, via exercise, via diet in combination with those three. It could be gene expression, but gene expression is always influenced by the environment. And the environment you give it is influenced by the food, diet, inputs that you have, right? Food, diet, exercise. Those are the environmental situations, right? Those cover every environmental input you have in your body. You could have environmental inputs like, disease, biological abiotic vectors, as you'd say, pathology wise. But in most cases, it's not that causes diabetic neuropathy. It's very rare. I've never seen a diagnosis that that diabetes was caused by a virus or a bacterium, right? So, but candida is I would say candida could be a. Now you have me caveat on this. That's more advanced. The subject of that. I see people smiling, but candida can trigger certain circumstances where it's excess inflammation processing, which triggers then diabetic neuropathy, but it's a subsequent of that. So going back to acute trauma. Oh, by the way, is there any questions on that? Because that was kind of a long string of ranting. So any questions that we have on the field? Wait for 10 seconds, then we'll proceed. Okay. So acute trauma is a very powerful mode on the Avazzia devices. Like modulate, it's very random, very chaotic. Unlike modulate, it is painful. And it is painful. Acute trauma is, as an analogy, if your nerves were plants, they would feed off of the sun, right? So the sun is circulation, the sun is mechanisms of experience, right? Acute trauma blocks out the sun. Now, what would the plant do if the sun's blocked out? What do plants do during eclipses? If you see a long enough scenario at night, or if you watch for example, if you watch plants at night in like sped up videos, they spin around, they search for the sun. They're always searching for the sun, right? And so you get instances where the body is acutely trying to find the best way to experience the sun, which in this case is circulation, nerve response, positive feedback, right? Because for a cell to exist, it has to get resources, right? If you cut off the resources, the cell doesn't understand the negative side points. It just understands that it just got stopped eating. It's no longer resource dependent, no longer gets resources. What is it thinking, right? So it's going to release whatever it has to get those resources signaled back to the area, right? So acute trauma puts the nervous system in a searching modality. A searching modality that, unlike deep stim, which is focused on finding new pathways, acute trauma is focused on rerouting the autonomic nervous system on an intense level. What does that mean? Well, if you have, for example, a habit, let's say you like to round your shoulders. Acute trauma can actively, if you put acute trauma in the right spot and you do it at the right time, it'll hurt for a minute. But after that minute, those nerve endings will not act the same. The change is permanent. Change is completely different because they have spent their time moving around searching for the right mechanisms to posture on. And then they finally find the sun, which is essentially circulation, stimulation, and nerve identification in terms of the afferent pathways, right? The feedback loop from the body's central nervous system, that now they're optimally listening. What does that do? What does that lead to? Well, it leads to increased circulation. It leads to a de-intensification of habits and a reinforcement of recruitment. So your ability to recruit muscles is hyper improved on acute trauma. If people have problems with activation, um, uh, if people have problems with activation, acute trauma helps with recruitment and activation. It's great for physical therapists. In fact, every physical therapist should know and try acute trauma on any of their areas. Oh, see, Elizabeth, you missed the chart. Yeah, this link right here has all the forms that we'll be talking about today. Sitting in the thing. And the slides, I guess, as well. Though that link, now that I think about it, is going to have the old presentation. Old is relative. I mean, it's going to still have all the same stuff in it. There's some of the new charts, some of the new science and information I put in there was just more relevant, and I have more citations to it, but I disregard that. Anyway, so acute trauma is going to improve recruitment, retrain the body in a way that's more sustainable, but it's not pleasant. And that's the key difference between something like modulate and acute trauma. Incredibly unpleasant. Like if you really have acute trauma up on 250, you are feeling it. Things are activating and going. And I wouldn't recommend it. It's not something you should do, right? Because you can over fatigue the body, which is why when you talk about putting like ear clips on and putting on acute trauma, there's no reason to do that. There's no that's overstimulation, right? You don't need to overstimulate the body, right? Less is more. Acute trauma is very much more, but there are situations where it's called for, right? Okay. So, and you'll notice that it's 79 to 85 hertz is the frequency. So it's really condensed in the frequency bandwidth that it's actually hitting. It's not long up, but it's more stimulating than say RSI is. So it is giving a lot of energy still. And also it runs in Q-Trauma does this, by the way, by running it in a duophasic, not biphasic, so it's not on back and forth. It's running two different modes back and forth, right? So it's running like, say for example, it's like running RSI modulate every half second, right? Boom, 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 constantly, right? And that alternating feature of it makes the body have to like readdress the chaos, and it's like chaos but fed chaos. It's like it goes into shock essentially, but that shock is what you want, because under shock scenarios it starts to recruit resources where it needs it, right? Which is the name acute trauma comes from. It's like, hey, it's a trauma. It needs to be addressed right away. This is an acute issue, right? But in practice, you can use it for long-term issues more or less or not. Okay, so PG 2500 is on the Ultra, and that gets into what that gets into a tens unit scenario. And that's why I specifically say, hey, you got to make sure that the manufacturer of your device is actually expressing that that's tens unit. That's the milliamp setting. They all have milliamp settings. They just don't talk about it, right? To hit microamp, you're able to hit milliamp, right? So 2500 hertz at that continuous level, which by the way, you see why we lower the power setting to 50, right? 50. Remember I talked about the math of it before. It's like, oh, you're hitting like 0.4 watts, 0.004 watts of energy through at that bandwidth. Well, we limit it to 50, so it's a fifth of the strength of that. So we can only go to 100 in terms of overall volts, is what the way you can think about it, right? And the 100 of the overall volts of the intensity of that side captured at the other bandwidth. So we're only hitting ever 2.5 milliamps, right? In that point. The reason you'd use PG 2500 is you're in such intense pain that you'd rather have the nerve cut. That's the only reason you'd use it. Such intense pain that you'd rather just not. These are for your patients who have had cortisol injection shots, have had, these nerve busters, and nothing's working for them, right? It's like, yeah, we can do it. It's in the mode for professionals to use. We wouldn't put it on a home device for certain, but there might be a case for it. You might have atypical nerve development, right? Like a mole. This is a weird one. It actually happens. You can take the pencil electrode and use PG 2500, though the B mode is better for it, and put it on a mole. you can kill the nerves associated with the mole. Easier to take out the mole. Right. There are uses for it. You wouldn't use it as the main modality for nerve recovery and healing. This just doesn't make any sense, right? When you understand the physics of it, you're like, oh, that makes sense, right? Right. What do you do with a mole? Well, you freeze it or you burn it off, right? It's like, okay, well, maybe you could numb it before it hurts like that, but they use opioids for that. It's like, okay, well, sometimes you can have a side effect with the opioid. With this, you just actually just disrupt the nerve on the center point of that. So that's why you would use PG-2500. HGH, high gain harmony, is a function. Any questions? Are we good there? Okay. HGH is essentially it's like a 3-minute long protocol. It's a algorithm that cycles through 3 intense high frequency subsettings. It, as you'd say, when people talk about weight loss and activation, how do you get weight loss? You use that energy, right? So how do you use that energy? Well, you have to trigger some activation where it draws those resources away from those storages. There's a key lock principle effect of this. So key lock principle is the concept that you stimulate the body a lot, you then go down to a lower stimulation period, and then you have a mid stimulation period. So you go high, low, mid. What does that do? Well, the QRS, anyone who follows the PEMF technology does that for metabolic issues on a cellular level all across the body. HGH and the Avazzia does this as well. In fact, you could say it's nearly identical to how that approaches, right? But the distinguishing difference is this is in a circuit that goes across instead of the modality of distributed PMF, right? Pulse electromagnetic field, right? So this circuit that goes across, you're targeting specific patches of fat to essentially hyperstimulate the area. They hyperstimulates ATP, the process of creation for all the cellular structures initiates, process of delivery, activation, reenzyme, and neuropeptide release initiates. Then we low stimulate it, right? The process stops, and then we mid stimulate it. It gets enough energy, but not the same amount of energy to where it thinks, oh, I can continue this process, right? Instead, it starts to clean up the process. So it just throws out the resources it created. Well, you're trying to, it's specifically inefficient. It is actually specifically inefficient, which is great if you're trying to get rid of reserves, because that's what a fat deposit is, storage mechanisms, right? But it's not great if you're trying to be healthy. So it's not something you should do on an everyday basis. But if you have fat reserves, it does help. Any questions about that? Because that one, people are surprised that setting's on the Avazzia. But, again.
Sorry, repeat one more time. What does that one help with?
That helps with the diminishing fat deposits. They call it
I'm sorry, for weight loss?
Yeah, it's not.
What setting was that again?
HGH.
HGH?
Yes,
Okay.
yep.
And are we HGH? I'm sorry if I may have missed it. That refers to that hormone? The hormone?
It's high gain harmony. They call it, as an acronym, you can't use HGH as an acronym meaning something. The FDA would kill us if we said that it was human growth hormone, right?
Okay.
Yeah, but as a function, sorry, I got distracted by two questions at the same time. As a function, it is triggering the utilization and loss of resources, right? And so sometimes those resources get metastasized and metabolically activated to do some stuff. Most of the time, it's inefficient. but you don't care about the inefficiencies when you're in when you're in an existence of excess. Like, we're not starving by any means, right? We're not significantly lacking these micronutrients. And some people might, but most people are not. I mean, well, most people are not micronutrient satisfied, but I digress. That the concept is that, hey, you have these fat deposits for a reason. Let's increase your metabolic ability to mitigate these fat deposits, right? And at least get it out there. Someone was asking for PG 2500. It has to do with the rife setting. So yes and no. 2500 hertz is a rife setting, is a rife frequency. It just so happens to underline with nerve disruption, and that's why it's on there, right? It also disrupts biotics too. It disrupts viral agents as well. That frequency, when I say it kills things, it kills your nerves. You know, if you leave PG 2500 on a spot for a long time, like 8 hours, you're gonna be numb. That's just how it is. It's a TENS unit, right? But guess what? It also disrupts any viral agents as well. It's similar to triggering. It's a lot of energy. Well, those pathways have to be activated for a reason. It goes to those pathways. It chains everything, right? If we go back to the pictures, you know, before of like the shock damage, like that's just alternating current does over time, right? On the micro level. But if you control it and you use it in specific agents, it's not to say that there's no therapeutic benefit for it. And you're like I said, so you're right, but there's more to it, right? Okay. Let's see. So AVA mode is the it's augmented variable. Well, AVA, we can assign an acronym to it. AVA was supposed to, at first, was just Avazzia, like the Avazzia platform system. Tim, you know, when we really dove down into it, it's just any variable mode really that you could put in there. As a practitioner, if you know certain frequencies that you like to put, and you know how you want to pulse it, how you want to dampen it, how you want to edit these signals and these modes, you can create your own mode, and you can store it into the variable 1, 2, 3, or 4. That gives you the ability to actually be able to be more customized and professional in the ways. And I know a lot of people have like rife frequencies that they like to hit. I know a lot of people have subset chakra frequencies that they could hit as well, but that allows you to do that. What the ProSport 3 offers, and you'd say, okay, well, why can't I just take my Ultra and plug in all these other modes? Well, the ProSport 3 offers something a little bit different than AVA does. It makes all of those modes reaction modes for all of those subfrequencies, which is going to be very interesting to actually look at. So, okay. So what does the ProSport 3 have that the ProSport Ultra doesn't? Great. Now we're on to this conversation. So the ProSport 3 has all of the brainwave frequencies. And so it's so that FMA, FMT, FMD, FMB, FMG. FDA would not allow us to put FM alpha, frequency modulation alpha, right? So we put A because it's Greek. But the reason being is because, well, the idea is, so FM, frequency modulation, alpha, the range of the alpha brainwave, right? So when you look at the chart, you'll see that it lists, for alpha, it's listing 7 to 12. For beta, it's listing 12 to 31.25 with a dampening effect. Each of these have dampening effects added on to different layers of the brain and signaling mechanisms, right? So the brainwave frequencies are very important for some neuromodulation and hormonal creation. People have, for example, and this is an ever-changing list of things along with the neurological agents of this. This is where the ear clips really do shine. And that, like, if you have, for example, if you have sleeping problems or like what is it? Gosh. If you have the inability to sleep, God, I can't think of the word off the top of my head.
Insomnia.
Thank you, insomnia.
I was
Appreciate.
muted. I was trying to help you.
Yeah, no, I appreciate it. Yeah,
Of
so
course.
if you have the inability to sleep, insomnia, often or not, the brain has lost the ability to create a delta signal. It is not resonating in a delta frequency bandwidth. Delta frequency bandwidth creates the hormones and the GABA production receptors, as well as the specific subset of neuroactive hormones that produce a sleep state. They make you tired. If your brain gets too out of whack into a state where essentially it needs to drain itself out, which means it needs to exhaust all of its sources of serotonin, or essentially the goal creation. It's not serotonin. It's man, I am just not on my neurochemicals today. If it exhausts all of your goal creation hormone, right, then finally you can get to sleep, because the goal creation hormone incentivizes the awake state for the alpha generation, not the sleep state. When you exhaust it all, then your meager delta production takes over and then creates that sleep hormone process. Then you go to sleep. Well, you go to sleep at like 4 a.m. or 3 a.m., right? Because you have to drain yourself out. You have to exhaust your brain of every goal creation process it can do. And then finally you get into a null state. Well, with the Avazzia, you can incentivize delta production right away. And I know personally 6 different people who've had significant life-altering insomnia that address this with that mode, that single fix, where ear clips 15 minutes before bed on delta allow them to fix their sleep schedule completely without melatonin production dependency. Melatonin dependency is a massive issue that people think is just perfectly okay. Any ingested neurohormone that you take on a regular basis creates dependency issues, and those dependency issues create lack of production in your own system, in your own head, in your own brain, right? Your body gets dependent on things being produced. It doesn't produce itself. It's lazy. It's simple but smart, you know? It's not going to waste time producing a hormone that it has in abundance more than its activation is needed. So, this actually provides a solution that's non-allopathic, to insomnia. It also adds a solution to drowsiness in the morning, because alpha production is also something. So FM alpha is a good morning wake up process. There's different, each of these different wavelengths produce different things, right? Alpha is I'm awake and it's okay, right? Beta is I'm alert and I'm conscious. Gamma is I'm attempting to regain control. So usually when you get up into the gammas, that's like beta 2, usually, as they call that, beta 2 for brainwave EKGs. But gamma is like, hey, I'm stressed out. I need to figure out what the heck is going on. Sorry. Where is delta on the chart? FMD, FM 0.5 to 4.0 D. Delta is the lowest stage of brainwave in terms of the hertz, right? Lowest, it's deep sleep, right? And when you're in REM cycle, when you're at the deepest state of REM cycle, you have a massive 90% delta production is what you're supposed to be in. So it's very sub thought. Theta is so theta is essentially that consistent production in the REM. That's what the meditation side of it is, right? And theta usually, by the way, theta, and this is a clarification point, because I did technically misspeak here. It's not 90% production. It's during the sleep stage when you're in REM, you're producing mostly delta. There's peaks where theta goes really high, and that's like those dream states where you get into those lucid dreaming processes. if you're naturally producing significant amounts of theta production when you're awake, you're very eligible for manipulation. You're it's very easy to put you into a trance, right? So the one thing I always get terrified about is great for meditation, but the time when most people go into trances is when they're driving, because it's a repetitive meditation period where you put yourself in a system where you have to maintain focus, but it's null focus. It's consistent passive meditation. So a lot of people don't realize that they're meditating in their car when they drive home, right? And this is more psychological, but that when you go from a lot of people have if you go from drives that are like low traffic, long drives, 30 minutes, that's a meditative state you go into. And if you cut that out of your lifestyle, all of a sudden you have an massive increase in anxiety, right? So people change from work-life standards, and all of a sudden they're working at home. They have more anxiety for no reason at all. Well, it turns out that they had a meditation that they didn't even assign as a meditation on their way home. They were driving, they're listening to music, they're just calming down. You can't recall any of the cars that are around you. You weren't awake for that. You weren't conscious of it. Now you step out of that theta process because while you're driving, you also have a significant amount of gamma going on. So you have theta and gamma running concurrently. And it is a cascading wave, right? It's not the full brain activating, which is nice because the Avazzia doesn't override and force the brain into these states. And that's the key point. We're providing the signal. We're providing the language for the body to talk to and interact with so that we can express these hormonal states if we want to, right? Which I get into with solfeggio because it's actually a really interesting, cool thing that I don't see solfeggio on here, but it should be. Because solfeggio, why was not expressed on here? Oh, I guess it cut off. Yes. Okay. So solfeggio on the Pro Sport 3 is and this gets into when I'm priming, when I talk about the brainwave frequencies, I also can talk about the solfeggio tones. Solfeggio references the musical tones and melodies. So like do, re, mi, fa, sol, la, ti. I'm saying it very dry and monotone, but if I resonate those tones, like I should, like sing them, like do, re, mi, fa. So each of those tones trigger a neurological emotion. And the pattern sequence of those tones trigger stories and complex emotions. Well, if we're always angry, is it because that's the only signal we know how to produce? Or is it because we can't transition from an angry pattern to a happier pattern? We don't know the song. And I like to say it as that we don't know the song because people love to listen to music all the time and it makes them feel emotions. Why is that? It resonates and it speaks to us as a neurological level. And it does have something to do, and this is when you dive into the solfeggio science behind it, it does have something to do with inhibitors and stimulants and pattern inhibition and recall. So like, you get certain amount of stimulation, certain production patterns are going to be more depressant than stimulant. And so these frequencies, which are productive stimuli features in the body, are going to tell a story. So what do they tell? Well, look, we know certain patterns directly correlate to emotion. If I want to listen to an Adele song and feel really good, you're gonna see different. Oh, sorry. Go ahead. Ask your question. Someone has had their hand up. I think you're muted. And unmute.
I'm sorry, I was getting a phone call at the same time and my battery is dying on my Pro Sport.
Oh, okay.
I wasn't trying to interrupt. I was just wanted to say when you were finished about something regarding solfeggio with a personal experience.
Oh, okay. Yeah. No, absolutely. So solfeggio. So solfeggio is a very powerful mode that influences emotions. It's not that it influences as much as it brings it out because it teaches you to express those. So sometimes people don't know how to express anger, and they're stuck in they could be stuck in passive negative interactions, right? And they need to express it. Anger is important. I mean, if injustice is the personification of a lack of anger, right? Because injustice leads to anger, which leads to justice, right? So there's a story there, right? Just like there's a story for liberation, for fear, for change, for all of these different expressions. What solfeggio does is it steps through each of these musical tones in the body, in the neurological sense, and transitions. And it does this over the course of every 7 seconds. So 7 seconds transitions to a new signal. So, it starts at do, and then it goes to mi, and then it oscillates through, right? And the cool thing to see this on, Olivia, do we have a red light system here? Do we have an open one? Yeah. Yeah, go get me one. Just open one up. But it's cool to see it on the red light, especially through the camera, to the therasage mechanism, because you actually see the different frequency tones in a visual aspect, which a lot of the times people don't recognize, right? There's an actual cued aspect to it. If you wanna tell your experience, you can now while she's going to get the red light.
Okay, so I've done a lot of work for the last over a decade with professional musicians, and I would do maybe the face lifting and that type of thing prior to stage, and then I just always did harmonics and then solfeggio. Well, when I would do solfeggio, then they would say, man, I just felt like I played so well and I sang so well, and it just really was so exactly what my body needed, and I had like the best performance. And I'm like, oh, that's so interesting, because that frequency is based on like I used to say, like a monk chant. It was like the do re mi, but it's also like that same chant that the monks would do.
Mm-hmm. Yeah, it's the Gregorian this system of singing developed in conjunction with these frequencies, because I knew that they activated certain neuroactivators. And interesting enough, for musicians, there is a significant problem with being able, because the best musicians are people who express the emotions that they feel, right? Well, what happens if day after day you can't express you can't express the proper emotion? So someone who's not in tune with their own emotions, it's very difficult or incredibly difficult to express them to others, right? So solfeggio is great for musicians. It's great because often the tortured artist is the best artist, as you'd say, because they have the most emotions and expressions. It's not ideal, but they discover the depth of emotion, and that brings it to it, right? So yeah, so solfeggio is very powerful. I would warn, though, that's one of those cases where if someone has a significant amount of emotional trauma unprocessed, it might come out. You might, and that's not to say that it's going to be a negative experience for you as a practitioner, right? But to say that, hey, I've had several people cry randomly, like just I put them on as a protocol and say, hey, you're gonna it's gonna be a nice pleasant song. Can you get me the plug? There should be a plug here. It should be a nice pleasant experience, and all of a sudden they're crying, and I'm like, why are you crying? Well, so I just feel angry all of a sudden. It's like, what do you mean you feel angry all of a sudden? Like that's not an emotion that you should be feeling right now. And it's like, well, it's I haven't felt angry in a long time, or I haven't felt sad in a long time, right? And it's like, well, once your body recognizes the signal properly, it uses it. And that's the thing about the Avazzia. We're not forcing these neurological agents onto the body. We're not putting an antidepressant. We're not doing any of the inhibitory side. We're just giving it the language to talk. And that's like the most powerful thing I could say, right, about this concept, is that when you do have situations where the inability to communicate and understand that communication in the body underlays a predisposition for an action, the body just loses the ability to connect and utilize it, right? So the important concept is the concept that you can get and you can draw the body into a position to actually use those frequencies and use those signals of emotion. And I know I said that we would here, this is my I hope everyone's enjoying the process of sprinting through the the frequencies, because I want to get to the actual practical side of this. Let's see. There. Oh. Right. Oh, there it goes there. Sorry. Hooking up the red light system. So we did a partnership with Therasage, because we knew we're good friends with the inventor of the red light systems over there. And he's a fan of us, and he made a system so that we could connect to the red light and connect it to our Avazzia, because he was talking about, like, oh, you know, you should be able to treat the Avazzia. So we get this system. So this is, for example, relax, and we can change it up. You can see, and it's cooler because with this camera, you can actually see it's almost solid to me, but you'll actually see the wavelengths, because guess what the camera's at? The camera's a reflective meeting at a dividend, right? A frequency, right? So the camera is displaying, think of it like a quotient of what the actual frequency is that we see, right? So as we go to different modes, you'll see different frame rates. And so when we go to solfeggio, for example, let's go there. What you'll see is you'll see it say sol. If you arrow down to the solfeggio mode and you go and you see sol, after 7 seconds or 10 seconds, I think what is it, 7 seconds? Maybe 15. Let's see. Oh no, it's 30. I've been duped. Yep. And then now you can actually see it's going to change frequency. And now you just saw it. I wonder if that actually displays properly in there. Now, there are certain frequency subsets that you can really see. So that's, for example, that's the acute trauma, right? Where you see that modulation, right? You actually see that modulation come through, right? And that you see how this side is a little bit brighter than this side. Well, that's the wavelength coming through. It's cascading through the red light, right?
Right.
So you see what's going through the body. You know, when we talk about 783 harmonics, right? We talk about teaching the brain the signal wavelength. That's 783. That's cycling through alpha, beta, theta, gamma. Now, imagine that each of these diodes that are here are your nerves. Well, we're cycling through and activating them in phases, and that's what your body's experiencing. Now, isn't that cool? That pattern recognition. And those are the different phases. So that's every 7 seconds. So you can see different phases streamlining and increasing in different wave patterns. And it looks solid to me, but because of the differential between the camera and the red light, you can see the pattern waves, which really makes this an experience to see, like, oh, okay, well, and you can do it with your iPhone too. I mean, you can see, like, just holding up the camera app, you'll see the differential, and you'll see how it actually alters, because our eyes can't capture anything below like 100 hertz per second. There's no way. In fact, your monitor that you're probably viewing this on is only probably 60, right? Which is why the divisor might work better. Okay, so trying to stay on time here, because I know that we've been doing a lot of theory work. So that was the bulk of the theory work. So so harmonics and solfeggio are teaching the body the languages. Harmonics is teaching the body the language of the different transitionary brainwave frequencies. Solfeggio is teaching the body the different emotional languages to communicate. Okay, so that's a very key distinction. Alpha, beta, theta, gamma, those are used for intense or narrative-driven habits, interactions, and changes and things. FM 60, 90, 120 is a body sculpting. Now, this class is not about sculpting, so I'm not going to really cover an intense amount of this, but 60-90-20 is a complete body sculpting program. The plus is for faster results. Advanced is for essentially if you're non-reactive, so you haven't been exercising in a long time. FM Advanced is for patients who have atrophy issues. Atrophy issues, they're relevant for people who have been bedridden for a while, but you can use them. Pads in the bottom of the feet, FM Advanced is what you use. FM Intense is if they're paralyzed. If you have paralysis issues, not just activation issues, but complete recruitment, lack of recruitment processes. RSTIM is again that's a TENS unit level. That's a physical therapy muscle stim recruitment. You're looking for as much jerk reaction recruitment as possible, right? Different from acute trauma. Acute trauma stays in that microcurrent range. RSTIM goes into the TENS unit milliamp range. Okay. Fast T, slow T. Fast T reaction is fast T is to trigger fast twitch muscles specifically. So if you're trying to rehabilitate someone who's a table tennis player, you want to trigger fast T muscles when you're doing training and sculpting. You don't want to use slow T muscle reaction modes. But that's if you're sports chiropractic or sports specific practitioner. There is more underlie to that, and we have some practitioners like Lynn is great. Lynn has his own practice. He works on professional athletes, like high tier professional athletes. I wouldn't say it while we're on recording, but he might tell you tomorrow he has, he treats entire sports teams, right? And they come in and he works with them. He'll talk about this. Okay. Chakra step goes through all the chakra modes. So I'm not a functional believer in the chakra network system. But a lot of, like I say, good data following bad theory is my main assumption. But I come at it from a very technical level. These frequencies that you're seeing, where we're talking about, the root, the sacral, the solar plex, the heart, throat, third eye, crown, and the eighth point. Those are all correlated to frequencies and optimized on certain subset frequencies. So you can clear the chakras out with this device. And that's why you would get the ProSport 3 is if you really believe in this, well, guess what? We can actually balance those out pretty well and balance it specifically out to actually get that output in. Now, I think the chakra system's functional. There's a lot of effect to the actual outcome of that. I think the meridian system as a planar immediate channel theory understanding outcome gets faster results, tremendously faster results. So this is the case where I only have 5 minutes. I'm pulling out meridians to solve a problem. I could do that, right? Now, that's not to say this class is going to be about meridians. It's not. But the reason why you get the ProSport 3 is so that if someone is, say, having a problem with an organ or having a problem with a specific point of pain, and you have a meridian chart and you say, gosh, that's, that at that point, that's stomach 34 or stomach 23 or kidney 23, right? Back of the knee, right? It's like, oh, okay. That's where their pain is. All right, well, I can treat kidney 1 up down the body, and I can keep kidney 63 or 64 up the body, and I can cause an interaction that helps the knee out. Why does it work? Good data, and non-dependable theory. If you want the complex answer, yeah, it makes sense. You want the easy answer, it's good data. 3,000 years of medical tradition did not account for nothing, right? It's very functional because it actually, like I said before, if you look at all the fascial planes, they line up to create these lines, these channels, right? That create these dependable areas that are triggered. Now, the reason why, again, ProSport 3 versus ProSport Ultra you get these meridian frequencies in the reaction mode, right? So you get these in a reaction mode that allows you to see the ongoing reaction and dose based on that frequency. So if you know a little bit about, say, bladder 1, the bladder channel is literally the entire spine. We're going to be treating the coral body. It's a majority of it's the bladder channel. So I personally, if someone has balance issues, I go right here. That's bladder 1, right? I go right on the forehead, right? And I'll DZ it, and their balance is going to improve in seconds. It's not even a question if it improves or not. It also improves the entire structural line down. And then I'll go to bladder 60, 63, 64 in the feet, right? And it'll help with their lower back pain. It's like, why is that? Well, the channel runs through that area between the feet and the head. There's all these sorts of compensations that they're ingrained. And the ProSport 3 having those abilities is very powerful. And that's why you take the advanced classes. This is not for today, but it's good to know, good to have, great to have. In fact, I have people who do the meridian frequencies and just paint the meridians with the subset frequency, and they get amazing results. Takes a little bit longer, 30 minutes, but the person walks out feeling like a new person every time, and they love it. It's very relaxing. Okay. Additionally, ProSport 3 has face stim, face smooth, eye stim, eye smooth. Those are modes from the Easy Lift. You can do esthetician grade work with those modes. There's a presentation and protocol for that. Just email me and I'll send it to you. Or you can ask for like a one-on-one session with Olivia. She's an esthetician we have on staff. She'll, I think it's $45 for a one-on-one, but she might be doing her own class soon. We'll see. She likes the one-on-ones instead, she says. Yeah, she's right here next to me in the room. So the face smooth face stim is a stim with some modulation that's dampened. Face smooth is a blue relax, no modulation but dampened. Eye stim is a very low I think it's beta stimulation, but it's dampened. And then basically you can think about it like face stim feels like acute, but lower. And face smooth, or the smooth settings, feel like relax, but lower and more sensitive. The range at which they hit is more sensitive. So that way it doesn't overstimulate the face. More comfortable too, it doesn't hurt. The B mode is it's RSI, no modulation, full gung ho. So it's different from PG 2500, where your goal is to hit that specific subset of frequency to kill nerves. This is, hey, emergency, give everything you got. So the best case scenario on this one, never use it on the face, is the B mode. But you can use it on the body, and it's meant for bug bites. If you get a sting, if you have an acute poison in your body, or would it be poison or toxin, or poison injectable? Well, it's whenever you have gunk in the body that is foreign and is going to cause an immune problem and is killing you, necrotic tissue, right? So you use B mode, it helps out. There's actually a really good picture that was going around of, it might be in this presentation, I don't know if it's later on here, but it's of a recluse spider bite being treated with the Avazzia. And you see, I think it's in the clinical protocols presentation, but you see, 1 week, 2 weeks, 3 weeks after the B mode, and the 3 weeks after, a recluse spider bite causes a huge hole in the hand. Like, it'll cause a huge hole and a welt in the body, and it was gone, and there was no problems. So it's pretty amazing stuff when you actually get down to it. So then Ava mode, I'm not going to really go into Ava mode and teach you how to use that necessarily. There's a guide for it in your manual. It's something you want to play around with. And if I really want you to be as confident as possible in saying a lot of these modes are things that are best played around with, right? there's besides for the cautions I've given you, which are from experience and with you know its own caution, you know, most of the technology is effectively zero side effect, zero risk, right? The relax setting you could use anywhere on the body. You can use the relax setting in the mouth. Now, Avazzia tells me that's not what they tell you to do. They don't. That's off label, off scope. But you can use the Avazzia in the roof of the mouth, and it helps with scarring across the board for dental work as well. And I do have dentists who use the technology internally, right? And so anywhere in the body. This is very sensitive. You can have it on 0 on 1, and then you go to the right and you stamp in. It's still sensitive, right? But I digress. So that covers all the modes. If there's any question about the modes, we can double back. Yeah. So that gets into basically what the reaction mode does and how do we actually get to these cases. This is a great suggestion slide. So if it's a short-term issue, relax assess will usually handle it. If it involves a scar, which means that there's higher ending connection, blue relax is what we address it with. If it's chronic or a difficult case, you go to RSI. If it's on a channel, if the scar or injury is on a channel, a key channel point, use the meridian that's actually associated with it. It heals faster. Trust me, it does. Don't just trust me. The reason why it heals faster, technically, I should just report why. The reason why it heals faster is because that planar modulus reacts to the frequency better. So if I have, for example, like stomach 1 right here, right? And I do use relax, and I'm DZing stomach 1 right here. What's meridian abbreviation on the ProSport 3? The meridian abbreviations are that's the LU, PC, HT, SI, TE, LI, SP, LR, KI, BL, GB, ST. There's a lot of them, right? It's the entire meridian system, but not the entire. Actually, I think Sanjiao is missing from that list. I know that when I actually worked with Marna on this, we talked about how some of them are missing, but it's not relevant to actually being able to do it because relax will handle Sanjiao. But does B mode neutralize venom? Your body neutralizes venom naturally. The immune system will jump on it like kamikaze agents. So your immune system jumps into the venom, absorbs it, neutralizes it with its own essentially like endoplasmic reticulum agent. So it's like the cell itself absorbs it and then dies, right? The more white blood cells you can get to a region to counter-react to venom, the better you can exhaust the venom. That's why a lot of people talk about like antivenom. Like, what is antivenom? Antivenom is a reagent that counteracts the venom, right? It's like it's a biotic that absorbs the venom and without essentially dying itself. Okay, it's fair enough, right? What is oh wait, what is okay? I understand now. It's the abbreviation of the lines for the meridians. Yeah, so yeah, like LU means lung, right? If you have the chart up, it will tell you like this is the lung, this is the pericardium, this is the heart, this is the small intestine, right? Those are basically the channel and then the frequency that resonates with on your test. So if we take the aggregated test of those channels, that frequency really resonates with that specifically. The body actually produces that frequency as a check-in for that node, which is cool. Which is cool, really cool to think about because that means that you're resonating that channel with the all clear for that specific channel, right? Which is why you should use that because it's faster. If I'm, like I said, if I'm clearing here, if I'm clearing the 6-point area, right, it will take me 5 minutes to clear the spot. in relaxed mode. It'll take me a minute in stomach mode. That's why you use it. You save 5 minutes, 10 minutes, because it's faster to actually dose and address it. It resonates better with it. Because sometimes what we need is love, sure, and that will love will help anything with enough time, sure. But the actual functional frequency it modulates at, that's the ideal, right? That's what actually gets the job done. So the love resonates it so it clears itself, and then it reverts back to that frequency in the end, right? Is the understanding. Okay, so yeah, operator's choice. Yeah, the Ava mode, that's kind of just like when we threw that, when Tim threw that in there, it was designed to say, a practitioner was like, well, I know better than you do on what I can put on the device and use for. And he said, okay, this is your choice. And we've taken about 100 practitioners' inputs on these modes to develop these modes in the first place, right? That doesn't mean they're perfect. If you have better modes, submit them, and we will try to get them in the unit. That's how these we created the ProSport 3 in conjunction with practitioners, right? These modes are on here for a reason. They're not just randomly generated from an engineer standpoint. Practitioners asked for these modes to be there because they worked. And then we had them made. So, all right. Cool. Questions? Do I place it on the specific area or just use the both. You can place it on the specific area. You want to hit the origin. Channel theory teaches this much better than I will cover it. Marna is much better at teaching this specifically, though it is overwhelming for some people. Me for specific, I had to take it a couple times to realize what the heck she was talking about. Yeah, so for if it falls on a channel, if the paint falls on a channel, right, then you go to that frequency and you can paint around that area. If it's on a point in that channel, you park it and you keep it there, and then you arrow over to the left and you go to reactions mode, right? And we're gonna get into the actual usage of this because I really have been heavy on theory in this class. I need to we need to speed up. So okay, so this is when we get into the actual terminology that we need to cover. So the device can tell you where, so when you're painting, the device will actually stick to areas. And that stickiness is essentially the fascia's disruption. Fascia doesn't want things to go through that region. It's going to stick. You'll feel it. If you take your Y bar out right now, plug it in, put it on the body, it'll stick to stuff. Why does it stick to stuff? They used to think, oh, there's a reaction that occurs. It's stimulating. It's doing it. It's like, no, if you take the device and take it off and use the Y bar with just the Y bar itself, not the device plugged in, it still sticks. Why? Fascial disruption. The fascia disrupts force through that region in that direction. Okay, so if it disrupts force, it's passively disrupting everything you're doing. When you raise your hand, you have to fight that disruptive force. When you lower your hand, do it. So when you clear it out with the love signal, the relax signal, right? When the Y bar is plugged in, it'll smooth. It'll become really smooth all of a sudden. All of a sudden, it's easier to use your hand. It's lighter, right? So yeah, so the toes, yeah, there's a lot of the beds of the toes have a lot of acupuncture points. In fact, a tremendous amount of acupuncture points. I find my favorite spot to put it on is kidney 1 pads. It just so happens if you look, it's at the bottom of the foot, it's like right underneath the big toe. Put it on the kidney reaction, kidney mode. Put a pad on each foot and let that run. It's the same thing we tell that to nearly every person who has stability issues and back pain. It really gets it done pretty much. And because we sit so often, really the problem with sitting is that you're not putting the necessary force through the body in the right way. And so kidney 1 retrains our body to say, hey, there should be force here, right? But I digress. That's my favorite spot. And I hope I answered that, where to place the meridian, the pads. It's usually, if it's on the line, you treat the line. If it's a specific point that matters, then you treat the point. Okay, so active zone is either an area that's in pain or sticky, All right, that's what you should think about. The point of pain usually has some indication, right? It's rare for someone to be in pain and it not be red. If it's red, it usually means that there's circulation and that the body's attempting to do it, attempting to address it. If it's not red, or if it's pale, it's also a sign of its active zone. Because guess what? It means the body's not circulating in the area. So we want to address the circulation. So we want to use more stim or RSI in a pale area. And we want to use more relax in a red area, is the theory. But using relax and then using RSI is going to be the bread and butter no matter what. Because we're biphasic in nature, we're never giving the body more than what it needs. So it'll stop sending a signal. That's the amazing thing about the Avazzia. It's like, that's why I say it's like you can be almost negligent in your understanding of the actual technology and still get very good success, right? But as long as you follow a couple of the cautions, I would say that. But essentially, it's like your goal is to relax and then circulate. So the device is made to have a buzzing or humming. It's even that like people say, okay, why I hear this hum? I mean, that's the discharge of the current across the skin. The humming is natural and it's good. I mean, that means that there's a conductor through the region, right? And that the higher it is, the louder it goes. So there is also there's a weird interaction because chaotic fascia does not properly conduct. It's louder when you go over the area. It's a weird. That's one of those things where I go, okay, well, because it's not absorbing things that if it absorbs, sound doesn't occur, right? But if it doesn't absorb, it means it gets loud all of a sudden. That means it's not conducting. So you have an indicator that it's an active site that needs to be worked on. Patients that feel sensitivity and certain, so when you turn on the device and put it on the body, different areas are more sensitive than others. That's a big indicator that there's blockages up the line. Usually, if you have sensitivity in the hands, right? And if you have sensitivity in the arms, don't have sensitivity in the hands, where do you think the blockage is? Somewhere in the renal, right? Somewhere that nerve is not connecting. Somewhere this body is not working like it should, right? So it acts as an indicator. Primary signs have to do with, is it itchy? Is it red? Is it dry? That's a feature. It also has to do with, is it sticky? Is it impeded? So these are all terminology that we use commonly on an everyday basis. We want to, as a practitioner, it's actually a good idea to I like to have a as you'd say a body chart, like an empty. I have this outline of a body that I have chart on a piece of paper, and as I find sticky areas, I actually note it down. I circle it. I teach my practitioners to do the same, because I use that. I say that's sticky. I use that to say, oh, there's a problem here. Well, if there's a problem here, there has to be a problem here. And that's an indication for finding the core reason if there's a problem. And usually they're linked. So it's like there's a scar somewhere, and then we find the scar, and they're like, hey, you didn't tell. I can't tell you enough how many times it's, hey, you didn't tell me you had a scar here, right? And then someone says, oh, I have a scar, and then yeah, it's like we treat that and the pain goes away. It's like, why? Why didn't you just tell me you have a scar? It's like, okay, well, I get it that you're protective, or you didn't realize or recognize that has a trauma to you, but it does, right? So step one, simple therapy. Everyone take out your devices. This is the practical. I'm going to give about 3 minutes for this, but when you turn on your device, I'm going to turn on my device. In this picture, they're using it on the hand. I don't recommend using the onboard electrode. One, it's less comfortable. Two, again, this is sealed, yes, but it's not atomically sealed, which means there's a microfractum of dust, of skin cells that get in here. And if you're an LMT and you use, for example, something like you use oils, it can hurt your device. Don't do it, right? Now, oils are fine to use with the Y bar, but not with this. Y bar is like it's ball metal. You're not gonna harm the Y bar. Onboard electrode? No, 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 no. Protect this device. It's a baby. It's durable. It's military grade durable, right? You could drop this pretty hard, and it'll survive. There's no moving parts inside. It's all bolted down. Problem is, it's bolted down. If you get enough dust in there, eventually it'll gunk it up. And so we don't want to do that. So what do? We take a Y-bar wire, we plug in the Y-bar wire, and sorry, let me get my Y-bar. Y-bar wire, Y-bar. Okay. Put it on an area. Turn on the device. Device is on. So a lot of people who are experienced, this might be really boring to you, but I'm going to try and explain tips and tricks. I like to circle, and you'll actually see in the circle, you'll see a fascial roll. I call it a fascial roll. This is a tip for experts. The fascial roll indicates omnidirectional fascial restriction. If you do a roll and there's a range of direction that it's restricted from, you know that there's a flow impedance in one direction. So as I go here, you can see there's a downward flow problem that I have. If I go the opposite direction, it's harder for me. So that it's harder for me to go this way than it is to go this way. Okay, that's what I do. I do the circles. You can do north, south, east, west. That was designed to make it simple, right? North. If I go down, how hard is it? It's okay. If I go up, really sticky. That's exactly the point I was pointing out just now. Very hard for me to go down, or down my arm, as you'd say. I'm going up, but just to show you guys I'm going down. But very hard for me to go south, right? That's actually really sticky. Why? Well, guess who was typing up the PowerPoint last night? Right? Everything has a reason. There's no, people like to think that they get away with life. They don't. You're always going to be punished for the actions you take, and your body remembers. So that's one of those things I would always state is, people wonder why they're in pain. They know why they're in pain. Most of the time, people know why they're in pain. It's very rare that someone's like, I'm in pain, I don't understand why. And they didn't really recognize why they're in pain. It's like, well, you didn't really take notes, as they'd say. Okay, so you paint north, south, east, west. Paint and park. I hope if you're logging into this and you didn't recognize what paint and park is. Paint is I'm painting like a brush. I'm putting a finger's worth of weight on it. Not enough to drag. I'm not dragging across the skin. I'm not making the skin suffer, as you would say. I'm not creating redness by just the dragging feature. I'm painting. I want it just enough to where it's on there, but not enough to where it's uncomfortable, right? Most beginners with this technology put too much pressure. It's better to be lighter, way better. The actual fascial disruption comes from the signal, not the painting. Okay, so park, very simple. You find a spot you like, you sit there, and you don't move. It's in park. So once we find an area that is a trigger point, oh, look, this is a trigger point. I can't push up on this spot. I literally can't. I know this is a problem for me. Well, guess what? I'm going to park it, and I'm going to make sure that I'm up high enough to where I feel a tingle, and I'm going to lower it 10%. So I got to 15. Wow, I got really low in sensitivity here. I got to 15, so I'm going to lower it by 3 or 4 points, right? Because I know my body's going to continue to working with the device. I'm going to hold it here until I get a D or a DZ, right? And that's the therapy. That's your simple therapy. You paint until it's not sticky. On areas that are points of pain or trigger points, you park and you DZ. That is, you can use that anywhere, everywhere, and be successful. Any questions on that? The device, this was the bread and butter of why the device was created. The Texas two-step, turn it on, put it on. If I hurt and I put it on, am I going to get better? Yes. Yes, you are. That's why we tell people in the VA, military vets who get this work on themselves. You say, are you sticky in an area? They say, yes. Can I treat it? Can I paint it? Yes. You should be working on yourself every day. As a practitioner, as an owner of the technology, you have no reason not to. And
it's almost laughable because I find that because I know I can do it, I often ignore it. Be more proactive. Being proactive is healthier. Painting, and if you can't paint your back, because we'll get into clearing the spine, you can paint your anterior. Anterior reflection is a thing, right? The interior will reflect and it'll support the interior, the back in terms of the coral body. But so you do, if you're with a patient, you're gonna want to always ask them the pain level before and after. You want to recognize a trend forward. And often what you'll find is that a pain will shift. We call it chasing the pain. Because it wasn't when you actually work with functional technology that opens up the channels, you realize that people only feel that point of pain because it was the latest point to be functional. Pain is a functional signal. Your body has to work to have a pain. When you relieve that pain, the area before gets activated, right? It's like, oh, you addressed this? Great. Well, this was caused by this. So, all right, well, then you go down the chain and you will get into situations where you were working in the arms, right? You were working right here, and all of a sudden, the problem is in here, right? Why? Because you're rounding your shoulder while you're typing or something, or you're driving and locking your shoulder in a place and you're straining it. It happens all the time. Compensations form. Things get proactively worse or progressively worse. That's the key term, progressively. But yeah, it's a thing. All right. Okay. So you should be painting. I can't really see everyone and see if they're painting, but it's kind of simple. Yeah, you thank you, Carmen. You're the one with me on here. Yeah, you should be painting everywhere on your body every day. You'll find sticky points more often than not. It's so nice. It's not bad. Dry skin does not conduct well. If you have someone with significantly dry skin, you can drink water. Drink more water. Does not hurt to drink more water. Helps to drink more water. Dry skin doesn't conduct well. You can take a paper towel, dab it in some water, put it on that point, let it dry for like a minute, and then wipe it off. And then go back into treating. It needs to absorb. It's better, more effective. Sweaty areas will conduct really high. Armpits, very sensitive. Cool. Why? So Patrick, why do I get a Z? Z means, so you know how we can track the ongoing reaction and we can track the input output. We know the output. We know how the body adjusts. If the body adjusts in a way that is uncontrollable and we do not recognize we control that situation, you get a Z, right? The device tells you if it doesn't recognize, if it can't determine with proof, with a signal output proof, that the signal in is controlling the signal out. What does that usually mean? It usually means that you lifted up. Like, it means that you lost a spot, A. The channel it's using is inappropriate, so it's a local minima. Or C, the area is not properly circulating or connected to the nervous system, and you need to lift up, place it back down so it can find a better route to connect to the efferent pathways. Does that answer your question, Patrick? You want it. If you see a Z,
sounds good.
Yeah, if you see a Z, you lift up. Go for a D. I was using face smooth mode. No, face smooth doesn't have reactions mode. Face smooth is face smooth is, as you would say, a normal mode without reaction. If you want a DZ, if you want to do it with the face, you just go to relax mode. Go it on the lower setting. You can even go in a gentle setting. So if you arrow, when you're on relax, you can arrow to the right and you'll see it say normal. Arrow down, click it, it'll say smooth, right? Or gentle. Guess what that is? That's your face smooth, face gentle. It's just not spelled out for you, right? So, well, also, I mean, also face smooth is at a different frequency. I digress. Face smooth is at a different frequency than relax is. Again, you know how I said that blue relax has a higher modulus for the skin? Well, face smooth is stuck at that higher modulus. It doesn't emulate back like blue relax is. It's just there at that 77. right? At that frequency that is specific towards the skin. That's why face moves there, right? But relax, your goal is actually treating the nerve homunculi, that is the body's representation of the facial structure of the nerves, right? So your goal is to actually get that in there and treat that if you're doing that. So is it okay to use lotion? Yeah, perfectly fine. It's going to be more sensitive. Anything that helps the body conduct. So sweaty areas will conduct more. Armpits are very conductive. Guess what that means? Lower it down. Lower it down before you connect to areas that you know are going to be sensitive. For your patient's sanity, all right? And I preference this. I say if the device is ever stingy, uncomfortable, or too high, let me know. It should be relaxing because it is relaxing. When your afferent pathways are opened up and your autonomic nervous system is crunching out protective resource or productive resources and benefits, it's very relaxing. Your body feels like it's safe because it's healing, right? If it's stinging or if it's like annoying or uncomfortable, it's because the body's rejecting it, right? So that should be something you should notice right away. Now, there are some cases where people love this pain is they say pain is weakness leaving the body. God, that's such a terrible term. Sometimes you need to desincentivize nerve pathways because they're over in excess, right? TMJ people have this problem. Sometimes you need to disincentivize the utilization of an area. So you increase the amount of the sensation so that you feel like you get this counter response where you need to relax it naturally. And then when you lift up, it's relaxing naturally, right? So that's the concept is you make a force, the body fights against it. You take away the force, your body continues to fight against it in a natural way. That's productive, right? So vagus nerve protocol gets into that degree where you're tensing up, but the whole time you're thinking, please relax, stop tensing up, relax. And then when you take the device off, all of a sudden you stay relaxed. It's like, why? Well, that nerve force that you're developing to relax that area is still there. It's still firing. You have a mechanism that you've downregulated yourself to release, which is important. Okay. So, yeah, sometimes skin not awake at first may sound like, sometimes skin and areas will not conduct. And then all of a sudden, like a light bulb, it turns on. That's fine. That means there was a neural pathway that was impeded and we found the right pathway. Sores and wounds will cause pain. This was that one case where I say with fibromyalgia and other, do you treat scar tissue from stretch? Yes. Scar tissue, stretch marks, surgeries, burns are all the same methodology. They're all just fibroblastic tissue impeding the breakdown or connection from the nerve tissue in the area. So all of it can be mitigated and handled. So so open sores and wounds, when they are reconnected properly, will be painful for a second or two. It's not long. It shouldn't take a while. It should be. It's a sharp pain. It's like boom, it reconnected, because that nerve in the area has never signaled that it's dying, and it needs to signal it's dying. It needs to tell you that, hey, I got an open wound here, right? Fibromyalgia, when the nerves come back online, what do they tell you? They basically say, holy shit, you're attacking me. Stop attacking me. They tell the immune response system that, right? And so everything hurts. Now, there is a stage when you're using the RSI for fibromyalgia where you have to fight through it, and it is a slugfest. You need to have it on all the time for verification processes. I will say that's definitely a slugfest. Okay, so open sores, never hold. Yeah. So that's a tip. That's a funny tip too. So if you have it right here, right? If you're holding the device, if you hold it up here, okay, you're on the onboard electrode. What happens if the Y bar disconnects? Well, you're going to shock yourself because it goes to the onboard electrode once this is unplugged, because it's a circuit, and this is the primary circuit. This is a primary circuit. This is a secondary overlapping feedback circuit, backup circuit, right? So it slots to the backup circuit. Your finger's there. You're going to shock yourself. So hold it from the bottom. Lesson number one for that. Hold it from the bottom. Don't hold it from up here. A lot of people, they're from up here and then they drop this and they get shocked once and then they never do it again, right? Because, well, and why is it shocking? Well, because if you have it high enough on the body where people feel a tingle, everyone's different. The finger is a very sensitive, if you're a small area, surface area, the larger the surface area, the less current, the more current you need to stimulate it. The lower the surface area, the less current you need to stimulate it. When we get into pad work placement, that in the advanced classes, where you put a pad on me and I put a pad on you, my hand is the conductive agent. I can put my hand on you and it's going to conduct. I feel the conduction through my hand. If I make it so I only have one finger on you, it's really conductive versus that one finger. It's a great experience to show the expression of that. Slide electron, yeah. So on elderly patients, you do not want to drag heavily on the body. It will create dust. It'll literally shed into the air. I have a funny story about a knife wound that was 60 years old, and I'm sitting there painting the scar because I said, well, this is you have a huge circular scar on your abdominal wall. I was like, okay, well, I'll paint this. And all of a sudden it puffed. The cavity opened up and all this dust from 60 years, because it was an internal scar, shot out. It was dust everywhere. It was almost it was a crazy experience to think about, to have. But the patient said, I've been there. That's 60 years old. 60 the scar from the cavity has been like that for 60 years. So that means the internal gunk had sealed internally and then created essentially so much dead tissue that could never get access to it, could never seal properly. And then when the upper layer diminished off, it puffed out. Kind of like how, dust gets caught in your belly button if you have an internal incision, It's kind of interesting to think about, but I digress. Change modes and hear the different frequencies. Yeah, so you really want to try out all the frequencies. I really recommend going through and spending. That's a good homework, is just trying out all the frequencies in your body in an area and just rubbing the painting with it, because you'll hear it. Now on the red light you can see it, but on the Vibar you can feel it, right? Oh, did I just go all the way to the end? That's not good. Beep. Sorry. Technical difficulties are fun. Point of pain. There we go. I didn't realize pressing down would take me all the way to the end. Okay. All right. So, so we got out. We're Y-bar is out. We're treating with it. What this is we can put the Y-bar on. We all understand what the initial reaction is, right? So if we turn on the device, arrow to the left, and then put the device on an area, we're gonna get that middle number. That middle number is your initial reaction, right? My face is 29. Great. Okay. If I go up a little bit, I'm gonna get a different number, 31. If I go over a little bit, I'm gonna get a different number, 33. Guess what? And by the way, I'm on intensity 1. It works all the way down. Now I can turn it up to where I feel a tingle, right? And go again. It's still going to treat. That's why the Avazzia works regardless of intensity. That's why they say that. But it works better if you have if you're paying attention to it. So you can map anywhere. On this example, it's showing on the shoulder. We can do it on the arm if we really wanted to. But essentially the goal here is, see, by the way, this is where my sticky spot is. 57. Look, I was in the 20s, 25s, 68. Jesus. You can see the problem. And I'm right here. This is exactly what I was saying. I can't even move. Oh, is that correlated to inflammation? Yes, it is. It is absolutely correlated to inflammation. It's correlated to not only inflammation, but a loss of functionality, because as you disrupt an area and strain an area, it loses functionality. You create stricture, right? So what do we do with this? Well, I found my problem. This is a problem, right? It's not moving. I can't even drag it across. It's staying there. So then I hold it there until I get a D. And then I hold it there until I get a DZ0. Why is that? Well, again, if we go back to that wave formation, right, where if we go back all the way up to this, right? The D10 is right at the beginning. I don't know. Can you guys see my my mouse when it's like this? You can. So this is D10. This is D8. This is D6. This is D1, right? D0. That's measure of change, rate of change, trend of change, right? So, so as we go, it could be D5, okay, D4, D3, D2, D1, and now we're locked in. D0 is complete resonance with the nerve. Complete, no trend of change has been established. A Z, right, is the tissue is non-responsive, or the tissue rate, that back and forth as we go back and forth, cannot be established correctly. Now, here's the funny thing, if we hold it there and it's on a Z for long enough and we feel the tingle, guess what? It'll keep bouncing back and forth. Eventually it will discover a D, and it'll tell you the rate of change on the bottom right. It might say like DZ something. So as we see it, okay. All right, let's go back here. Okay, so point of pain therapy, you can use the reaction mode to discover your real true problem spots. As treating yourself, when you work on yourself, it is, to say, easier than if you work on a patient, because you feel where the pain is. You can identify it. When you work on a patient, I cannot tell you how useful initial reactions are, because you'll be mapping out, right? You'll be going through and you can paint a little bit, but you'll map out and be like, well, yeah, you have, and you can show the patient this. You're like, you have a 78 here, right? I have a 60 here. Well, by the way, it's funny because you can see from the left hand, which has a 77, to the right hand, which has a 65, you can see the difference of strain, because I was typing with my left primarily when I was typing mostly, and I was using the mouse with my right as I was going through, right? And that's a strain syndrome. So you can see the patterns of compensation that I was triggering there, where I overstrained my left side, right? When you work out, if you test afterwards, so let's say you test beforehand. This is something to diagnostically, not what Avazzia is designed for, but an interesting thing to think about. If you work out and you test, write down your numbers in your arms, right? 30s, 35, 40s, 30s, 35, 40s. Go work out and track it again. If one side is significantly higher than the other, your workout's defunct. It's asymmetrical. The way you're positioning, the way you're using your body in one way, shape, or form or another is stressing one side versus the other inappropriately, right? Because you're causing more inflammation for one side than the other. They're things to think about that you're able to do with this technology, right? Okay, so so application point of you could turn on the device, park it, power up, and within 2 minutes it should relieve the pain. That's by study. You just need 2 minutes for pain relief, because that's the amount of time for you to produce an effective dosage of neuropeptides, and the first neuropeptides that you had created in the first few seconds of therapy have been converted to the long-term neuropeptides or neuroendorphin hormones that provide long-term pain relief. That's how long it takes, about 2 minutes to convert from short to long-term, right? Because the nerves don't have an ending for 2 minutes. I mean, it just transitions from A and C fiber problem to a B fiber problem, right? So that makes sense. I hope that not rushing through this. So yeah, so again, north, south, east, west, all the cardinal directions, you're identifying where the fascial restriction is, right? This has to do more with initial reactions, so we're taking the reactions, we can take, and we'll find where they have higher readings, treat the higher readings, DZ0 it, and you'll get better improvements. Point of pain, practice on self. Yeah, so Everyone should be finding a point of pain. If you have pain, great. If you don't, well, we'll figure it out. But you should find a point of pain that you have, paint around it. If you find anywhere that's sticky, park it on that spot and DZ0 it. Okay. So I'll give it a minute for everyone to catch up on treating themselves, and then we'll go into scar tissue, because scar tissue is really cool. Scarring, there's a couple theories on why scars form. The first theory is foundationally on the idea that the body was never designed to recover from catastrophic issues. The body is designed to hide catastrophic issues. So what I mean by that is if is there an appropriate time to recalibrate? If you have readings that come up as 25, like 10 times in a row, you should recalibrate. The reason being 25 is the inherent neutral load. Okay. So that means that whatever is conducting between it is not affecting the circuit at all. Right? It's atypically affecting. By the way, young people come up as 25 because their body's working. There's no interaction. It's perfect. You have a baby, 25, 20, 22, 25 every time. It actually gives energy technically in the line, but the line doesn't take it. So, but it's interesting to think about. You can use this technology on babies. They respond very well to this. In fact, it's quite absurd the healing factor that kids have when you're using the technology on them. It's different timelines for recovery. That's why when I was young and I had scoliosis, we talk about it like, oh, it took like, how long did it take? I was like, what? It's like I think in under 10 weeks it was completely, my spine was completely straight. It's like, yeah, I was 12. It's like it's pretty phenomenal. Now, if I had someone come in with full blown scoliosis in their 50s, I'd say, okay, 3 months, 3 to 4 months is usually what I'd say. Come in once a week, and we clear the spine. We put pad work for 30 minutes, and then we let it ride. And that's in the clinical protocol class, but it's good to know. Like if you think about it, scoliosis is just like lock short, right? So if you have a bend, this is lock short, this is lock long, right? This is in spasm, this is in contraction. So what do you do with that? You just relax or modulate the thing that's in contraction and acute the thing that's in spasm. Retrain the thing that's in spasm, relax the thing that's in tension. And boom, you've just done spinal recorrection surgery. It's absurd, right? Because the surgery, the next best thing, spinal fusion, spinal correction, it's like $20,000, $30,000. It's like, as a practitioner, sell a $1,500 package of spinal corrections for scoliosis. I come in once a week for an hour. I'll put pads on you, 30 minutes in and out for, what is that? That's for 4 months. That's 20 sessions. It's like, and they'll see the results. They'll see the difference right away because their back's going to feel more functional. It's one of those things where it's very easy to. It's not as a practitioner, the ability for you to generate income on the Avazzia is solely based on the idea of, are you incentivized to help a problem out? And it really does depend on that. I can't say there's a lot of opportunities to help. Now, when we even get into scar tissue, I know people that sell $1,000 bundles for the scar tissue. They sell a package of 5 for $200 a piece, right? It's $1,000 total, right? You come in and you can get rid of the scar within five sessions, and they spread it out a week apart each time, so it's like 5 weeks. But the big thing is that 5 weeks is about the necessary amount of time for you to photo blend and tan. Once you get rid of the fibroblastic tissue, there's no whiteness in that anymore. There's no scar, right? So it photo blends, and then it gets better and better over time very quickly. So getting back to, I was off topic for a second. Getting back to scarring, there are several theories about how scars form. The first theory is that the body creates a mini band-aid that it doesn't know how to take off. Okay. The second theory is that the body adapts and creates a strong band-aid that helps support it for future instances. Right. So if you're constantly straining something, it'll create this scarring that seals it, that makes it a little bit stronger. The third theory is that the body isolates pockets of things it doesn't know how to handle. All three are correct. Different, what we classify as scar tissue is a entire categorized range of issues, right? So the Band-Aids we can take off very easily. You fix the underlying problem of why you needed that Band-Aid in the first place, and then you address the issue. So if the Band-Aid is fascial tearing, right? You had a wound, or you were cut, you had an abrasion, you had an issue, that issue's gone. Relax it with Blue Relax, and then Blue Stim it. You can take out the Band-Aid. The body will literally clear it out itself. Okay. The second issue, stabilization and calluses. So in instances where, for example, stretch marks are stabilizations, not related to being hurt, right? You form stretch marks. A lot of people get them in the butt, in the back, and different areas, especially during growth spurs, because the body's trying to support the growth, right? And it doesn't know how to take them off again, right? It doesn't actually need to revisit them. How do you revisit it? Well, you spend a lot of time relaxing the area. So you release it with relax, but you're relaxing it in the regions where the growth has direction. So you're always going against the line, perpendicular to the line, as you'd say. Never across. And you don't stim it because it's not a circulation issue. It's a support issue. You just leave it at relax. The third one is like keloid scars. Okay. People get them. Keloid scars happen because you get multiple surgeries that compound. Maybe you have a surgery and they go in back and re-enter the surgery. So you have the first scar and then the second scar forms underneath it. It creates a pocket of gunk that essentially is like cellular decay and debris that fills up. You release from the external out. You don't go over it. External, outside to inside. Blue Relax. Then you go Blue Stim, outside to inside. It'll drain. All three of those theories on how scars are formed are correct. It also increases the idea of how you can therapeutically treat them, right? So you can see in this picture, we have a significant surgery scar, right? And this is 2 treatments, right? So it's one of the things that you think about. It's like, okay, what's the difference? It's like, well, it got lighter, right? In the course of a week, it photoblended pretty well. But it also, the fascia is more communicative. If you notice, there's a whole bunch of redness around and divots across the scar on the left one. The right one, there's not as many divots. The right one, the redness is lower hue, less there. The stitching is clearing up properly, and it's working from the outside in. So this is a healing scar, right? I wouldn't be surprised if the scar's gone by now. And that's the thing about it, is that just needs to be properly photoblended. You can actually see the tissue starting to reseal. Now that's a deep tissue scar too. I mean, that's a hip replacement, right? There's deep scarring in that one, so it's pretty good. This was it's like a spinal fusion, right? So when you talk about a list of things that you can work with people on, it's like a lot of people have spinal fusions, range of motion's done, but they have scarring associated with it. It impedes their twist motion. This twist motion, they can't do it anymore because that fascia just doesn't communicate to actually signal it. So it's indicative. So you can see that you can release the fascia. Once the fascia is doing its job, the body reconnects and starts to get rid of the fascia. Get rid of the fascia. The fascia starts to reconnect and get rid of the fibroblastic tissue. Sorry. Well, it's getting close to the end here. All right. keloid scar. This is what I was talking about, that third case where you have the drainage feature of it, where it needs to be drained. You work outside in, and that bulb, that crust, that formation of a pus center decreases and drains out, which is cool. So, and we have tons of these. This was one of those recent where I thought it was such a cool one, where not only did you can see that this was a spinal correction from scoliosis. This is the alternative I was talking about, the $20,000 alternative, where they wire in a metallic substructure into the body, and look at the divots it creates. Okay, well, this is post-surgical. We relaxed it. This is years later, right? The scarring is still there, and within one therapy session, all the divots popped out. That's one session. That's 20 minutes of therapy, and all the divots popped out, and her body, she's young. The girl is what, 28, 29, and sorry, I looked over at Olivia because she said she's the work. Is it you that did the work? It was Brenda? Okay. That's one therapy session for 20 minutes, and that big of a result. The top one's almost instantly gone, and you can tell that those divitations had been there quite a while. You can even see that how on the one that's out after the 20 minutes, you can see how it tanned differently in the body and how she would go outside. So it's like amazing to think about. Now that's actually cleared up more and more. That's one of those, an instant when people are young enough and they're healthy enough, man, people heal so fast with this technology. And it's wonderful to watch. Okay. Oh, this is a good one. Yeah, oh God, did I just do it again? I swear, I need to not press that button. So this is one, this is a good story. They say this guy was in the booth and the scar had interrupted his sensitivity, inability to feel. And he regained the ability to feel his hand and during the therapy session by treating the scar. It's like you can get complete nerve recovery rapidly by reorienting the pathways. This is one of those instances where we were able to return sensation to his fingers. I haven't felt anything for 10 years. It's like absurd. It's like and you talk about, okay, well, why is the device so expensive? It's like, well, that's why, because we could do that. And if you can't do that, what are you doing? As a therapist, it's like, that's life-changing. And that's 1 hour of work. So, and that wasn't even, the funny thing about that is Gail talks about this as a story. The person, she handed the device to him and told him to paint blue relax, blue stem. And he got that result. And he wouldn't leave the booth afterwards. He was just amazed. And I'm sure everyone has a story like that. Most people who work with us end up having a story that's like life-changing. It's good. That's all I like to hear. Okay, there is a preamble to scar tissue. Usually you want to wait a couple weeks for it to seal before you work on it. You want to have an assessment period where you document the improving, because you want to make sure that you show that it's improved, right? This is kind of like the protocol for it. Blue relax, power on until they feel comfortable. You can do a reactions. You can do a reactions for the first set. So if you wanted to be really clinical, you would first do one reaction on the scar, get it to DZ0, and then you'd paint north, south, east, west, and get the stickiness out of it. After you get the stickiness out of it, then you would go to blue stem and make it red. That's how I do scars. I DZ, make it smooth, make it red. That's my 3, right? Every time. Works every time. Don't have to think about it. If it's still sticky, I need to keep it in blue relax more. If it's not red, I need to paint more with blue stem. It's a really good way of thinking about it, right? Because what's the goal? What's the feedback? Blue relax. It's smooth. Job done. Fascia's connected. There's no blockage in the fascia. If the fascia is connected and there's no blockage, the body's not protecting the internal tissue anymore. The fibroblastic tissue is accessible by the capillary response system, which allows us to stim it and get the circulation that's necessary. If you stim it first, then blue relax it, you're gonna make it red, but it's not gonna be smooth. You're gonna see circulation. You'll actually see, it's a fun experiment to do. You'll see that the circulation is cut off in certain regions across the fascial bend. One side of it will be flushed red, one side will not. And it's like, oh, that's why you smooth it. That's why you relax it first, get it all opened up and all clear it out so it can go that way. Then you stim it to where you get the circulation in. Okay. All right, let's take our 10-minute break here because we're gonna dive into the whole core whole body system. And I'm pretty sure we skipped a break when we were ironing through it, I'm guessing, right? But I hope I've kind of sprinted through the last 20 slides to make sure, but how are we feeling? We feeling 10-minute break here? Bathroom break, good. Carmen's good. Good. Okay. I feel like maybe a coffee break or something. And then I'll have Olivia, I'll have our model step up here and I'll work on her. And breaks are good. Yeah. Then I'll have I'll be working on Olivia to show you the different therapies that we can do and have a live model for it. I hope, is the camera fine at picking up me so you can see it? Because I'll be putting, I'll try to see if I can, I guess it'll be, I'll spotlight this camera so I actually get that way. Okay, so we'll pause recording for a second. Alrighty, so does everyone see, thumbs up, Jody, if you see the core whole body technique right now, right? Is that what you're seeing? Yep, good. Okay. So core whole body technique is a old Russian protocol that has been revamped several times and changed and altered. The goal of the core whole body is to treat the central nervous system, this spinal length right here. As we go down, all the way from the neck down, there's tons of neurological nerves that go throughout the region. Whenever one of these gets sticky, right, that's a compensation that triggers the entire neurological agent to impede. You can feel, if your patient gives you permission, Olivia, do I have permission to touch you? Okay. You can go down the spine, and as you go down the spine, you will feel stickiness even with your hand. I feel stickiness right here, right? You don't need the Y bar to know when there's stickiness. Do it by hand, right? You can go on the left side. That's sticky. She has a compensation right in here. We go down. Sticky right here. Compensation. Sticky right here. So now I've already identified a cross pattern. Sticky here, top left. Sticky here mid. Sticky here bottom left. All right. What does that say? Well, it probably means that she's using this arm too much. The left arm too much. And that's that cross pattern right there. And then she's supporting herself with that left leg, right? So that's the technical foundation for what we're doing. We clear the spine, we clear out these compensations, the body works better. Additionally, we track the inflammation across the board. We know that it stacks better as well. So that's the core whole body. We treat the central nervous system, and the central nervous system is fully functional. We get down the line benefits all across the body. There's a short version, and then there's a fast version. Or wait, there's a fast version, and then there's a long version. The fast version gets you 80% of the benefit, but benefits, this is a great diagram for what we're actually working on. You can actually see the entire nervous system, the central nervous system's pathways right here. It's all throughout the spine, very integrated, right? So when we're working the body, we're very connected to this point. The fast version is as follows, and I'm going to stop the share and then highlight us. Spotlight for everyone. Cool. All right. So I'm going to go to my relax setting. I'm going to power up on her. Tell me when you feel tingle. I'm going to look for verification that she feels a tingle. I'm going to turn it down 10%. I went to 76. I'm going to go to 70. Right. Cool. Then I'm going to go right to C7. That's where that essentially the shoulders align. That's the bump right here. I'm going to turn it to the side and I'm going to go down 3 times in paint. 1, 2, 3. Then I'm going to go to the left and paint 3 times. 1, 2, 3. Then I'm going to go to the right. 1, very sticky there. 2, 3. Now, what have I just done? I've just identified all of the sticky areas in my head. By those 3 swipes down, I was saying, oh, this is sticky. This is sticky, right? This is sticky right here. This is sticky right here. And you can see it structurally, by the way. It's kind of interesting. You can actually, if you really look closely, you can see that her scap is extended out here. And her scap here is extended out that way, right? This is higher than this is. You can actually kind of see that this is loaded that way, right? Okay, so we know that she's using the arm too much. She's straining somehow. I bet you this is what she holds her phone with, is her left hand. Right. So what do I do now? Well, I just painted 3 times down both sides. Now I go ahead and I treat the stickiness, right? So I turn it to the, I usually turn it to the side, but I start with the center. I just go back and forth, light swipes down the center until that's not sticky anymore. And I don't have to do the full area. I just go light swipes down the center. Not sticky. Okay. So now when I go down, all right, we're good. It was that quick. I went from sticky, not sticky. She's young, so it's very easy to go down and swipe, right? Elderly patients, you might have more time, might be a minute or 2. That was very quick, right? It was actually kind of, the reason why I specify is I was quite surprised how quick that was. It was a couple seconds. It was already clear. So now when we check the center of the spine, it's clear. Okay.
I felt the difference.
Yeah, you already. It's funny. It's stupid how I think it's silly how quickly the Avazzia works, but other people might disagree and not realize, but it works that fast. So now I go to the left. I already traced 3 times to the left. I know that there's stickiness in this area, so I'm going to light swipe paint. So right in here and right in here. And the real stickiness is in this upward motion. So her body really, you can feel, look, when I pull up here, you see how much her body grabs to reflect that, to deflect that force. It does not want that force going up that way, right? So I'm going to go one direction first, north to south, and then I'll go the next direction. Okay. And then down here, she has a little stickiness right here. Now, whenever we get into this lower back area, it's not part of this, but I think you should always do this, is go into the obliques as well. So you turn it to the side and then go out this way, because you got to give this room to decompress out. So I always think this is the better move here. Because if you're just going down and up, that's fine. Where is this going to decompress into? Where is it gonna? It's gonna reflect anteriorly, right? So it needs to decompress into the anterior range, right? So this needs to be loose to actually get that reaction. Okay, so, and that actually, by the way, as soon as so this was a little sticky. As soon as I went to the side and got that to unstick, it released right away. So that's also, it shortens the treatment time, right? So going back here, cool. And now we're gonna do the right. Very sticky upper neck area. So we'll come back to that when we get to the next side. And this mid back area is just nonsensically sticky. So we're gonna go down and then paint up. And just light swipes, doesn't have to be hard. You can actually see circulation coming too. I feel like I almost want to turn off the light so you can see a little bit better, but you can see circulation coming too. You want to sit here, scoot a little bit to the
Yeah, that's better. Yep. Yeah. Okay. So that's sticky right in here. And nothing down there. So it's all right in here. Now, if it's really sticky and it doesn't want to obey, like doesn't want to release, which is this is the problem, that's when I'll park it for the moment right there, and I'll DZ it. This is the one moment where you can definitely do that. When we do the core whole body, I bet you this is going to be her problem spot. This and top left neck, but well, this, I mean, the full core whole body. This one, sorry. And by the way, in correspondence with the readings, this is if I wanted to tap, so I want to tap here, 30s, 34s, 44, 39, 41. So as soon as I get in right here, 60, 62. So I know this is a problem spot. So we know how this device works. Information testing generates, we can tell the stickiness. It's there. Right. Cool. DZ. And now, oh look, I DZ'd, and then it's much easier to smooth down. Like, it's actually comically funny how quickly that releases. The DZ, that's why you say, well, you don't just paint for hours. Don't just paint for minutes. Just DZ it real quick. That's the luxury of the pro sport. You want to DZ as quick as possible. Just get it done, right? You have you got the top of line unit for a reason. Use it, right? Okay, so after we do the neck, I'm gonna go back to the presentation. After you do the neck, after you do the back, so you paint. After you do the back, so 3 times in the center, 3 times to the left, 3 times to the right, you do the neck. And same thing, 3 times down the center, starting at C1, all the way at the atlas, coming down, 3 stripes down, then go to the left, then go to the right. If there's any significant active spots, you revisit them, and you just work it out. So she has an active spot on the left side up here, like I said. So this is where technique comes in handy. I'll paint in the neck area. I paint a little bit. I mostly plant, park, and then do light rolls in counter and clockwise motions back and forth. Feels good. I had a massage therapist say show me this, and so far it's been I think it's the best way to do this in the neck area, right? This doesn't because it doesn't hurt. I mean, the painting can get a little irritating in the neck. I like the light rolls. Okay, and then we like there. So interesting. She has downward restriction this way, upward restriction that way. Oh, okay. So we know which way her body does not want force to go. It's that left arm. so it's interesting how the body tells a story, regardless of what we try to triage and do for it. So we go up that way and then down that way, and we get that's release. Okay. That's the short version. You've cleared the spine, cleared the neck, they're good to go. And then you treat the sticky spots. So this is where if you were in here in person, or if we did this live, you'd have someone with you who can do this. I recommend grabbing a partner at home and doing this to your partner or your family member or your friend. This is a wonderful therapy technique to do. It feels very relaxing. There is a variant of this in a protocol that I wrote up before where you do it on your anterior. So instead of, because everything reflects interiorly, instead of painting your back, paint your front all the way down. Start at the clavicle, center, go down 3 stripes, then go to the left. Actually, it'd be, yeah, go to the left, then go 3 stripes down. Sorry, I don't know if you can see me in the camera. 3 stripes down the left, then 3 stripes down the right, and then paint the stickies. Right? Well, guess what that does?
that releases the anterior restriction that correlates back to the back. So you can get the same type of interchange as you do when doing the core whole body. It's not as effective because all it's doing is releasing the compensations from the anterior front, but it is something that you can do on yourself. It's not everyone has range of motion. I mean, you can get down there with the Y bar. Like if you were, I mean, I could, but I don't know if everyone can, and that's why I don't like. Olivia, could you? Yeah, so that's another thing too, and this is, if you can't clear your own spine, there's a pad trick for it. Put a pad on the top C7 right here, then the bottom right here at the lumbar, and relax for 10 minutes. Do it on the left side, then the right side. While you're running relax, light forward, back and forth rolls. It'll actually compensate better. It's actually a pretty good therapy for 30 minutes of time. If you have 5 minutes, I mean, you could try to do it yourself like this, but that trick actually works really well to release the spine when you have back pain, because you're treating the bladder side, right? And you could put it on bladder if you have the ProSport 3. You could put it on bladder and the meridian and just run the bladder meridian down here because all the paraspinals back in this area. Okay. Okay. 6 points. All right. So 6 point is you're good. Yep. Yeah. I'll call you back for the core whole body. All right. So 6 points is an extension of the same protocol where we are treating these 6 points right here. 1, 2, 3, right underneath right in here. 4, 5, 6. All right. Why are they called the 6 points? Because they're 6 points. And they correlate to a significant majority of the meridians in the face, as well as a significant majority of key spots around the body. Why? Let me get a little bit towards there. We go. Okay. Why do we treat them, and what do we do? Well, first we go to the reactions mode on relax, and then we go, and there's a cheat sheet that's on the forums document that's there. Wait a second. Am I not seeing questions? Hope no one just asked questions. Okay, good. All right, we're good for questions. Okay, so with the 6 points, you go to the left side first. Oof, that was high. Always turn off the device and turn it back on, especially when you touch other people with it, because that was a little high on your back. So I went to touch my face. I shocked myself. Even veterans do it. I swear. It's not, it gets you. So you put the device on spot number 1, which is on the left side of the face, underneath the chin, or no, underneath the mouth. And then you're going to go to reactions. You're going to turn it up till you feel a tingle. And you're going to get a initial reaction. That's your top middle number. That initial reaction is 45 for me. I got a Z the first time. I'm going to lift up, put it back. And I'm going to hold it here. Wait, it's 35, and then we go to, and you're good. Now you can lift up, go to the other. So you just record that number is what you want to do. So there's a cheat sheet to record. I record the number 35. Then I go to my right side. 40. Then I stop, and that 35, which number is higher, 35 or 40? The 40. So I treat the 40, and I hold it on that 40 spot, and I hold it there until I get a D. And I hope that this doesn't take 10 minutes. But this might take 10 minutes, and it is worth it if you take the full 10 minutes to get this done. I got the D, 62. All right, so now I write, next to my 40, I write a 62 for the ongoing reaction, which is on the bottom left. I lift up and write that number. That number, 62, tells me the ongoing reaction amount of time it took for me to D, which means that's the reference point for what inflammation point triggers that mark. Great. Now we go up to the 3 and 4. We go back to the left side. I place down. I got a 31. Then I go to the right side. I place down. I got 29. Which one's higher? This left side. So I revisit that left side and I hold. And I wait. That ongoing reaction number on the bottom left is going to climb. That climbing is essentially an indication. Oh, 61, D. As soon as I get the D, I write it down. I lift up, write it down. Okay. Now I go to the top. 23. 29. Okay, this side has a lot higher. I always write it down. And of course, I get a Z as soon as I go to write. Sometimes that's the thing about this. The device is brutally honest when you lift up or you're moving or shaking. Everyone's not perfect. That's how you know it works, is when you get those Z's, you're like, oh yeah, I definitely moved. I get you. Cool. 41. D. All right. Now I have my 3 D's, right? On each of the layer, I have a D. There's the highest D, right? My highest D was my bottom right. Okay? Which kind of makes sense because I have wisdom teeth I need to get out. So it has been activated in the trigeminal nerve. So I understand that. Right? So what do? I DZ0 the highest point. For me, it was my bottom right. For you, it could be anywhere. So you lift up and you place it to DZ0. Why do we do this? It is the highest number or position. Let me rephrase this. It is the position that took the highest inflammatory number to get feedback, which means it's the slowest position to recover and dose. And we're defined by our slowest features, not our fastest. So if we know that this is the slowest spot, then we know where we need to treat. Right? Now, the 6 points is notorious, mean, terrifyingly frustrating in time management, because 6 points does not care. These points do not care if you only have a 15-minute window for therapy. So tricks to make sure it speeds up. Don't cheat and lift up or move, because it will DZ and it'll feel wrong. You're looking for a DZ0, and I won't do that. You want the person thinking happy thoughts. You want to tell them happy thoughts. Literally, tell them happy thoughts, and ask them to say something happy. It will help them DZ, because they stop thinking about the negative things that they're feeling in that spot. They start trying to think about happy things. Your body releases endorphins naturally when it's happy. There's less inhibition, so you get a better feedback from the device to the technology. Sometimes I try to make the patient laugh. It's one thing to get them to smile. Not to say you have to be like a clown, but if you've been there for 10 minutes, you got to get something going. Because some people, like for example, I'm at 2 minutes, and there's a timer that lets you painfully know how long it's taken you, right? I'm at D1. I'm so close, but this process is the process, Some people report if it's the bottom, this helps with TMJ, and it comes into the TMJ protocol when we talk about it. If it's the middle area, it helps with sinuses. If it's the upper, it helps with stress, right? So that's where you can really think about as a tangible output of what you're doing right now. That's what your value is going to get right away. So what I'm going to intentionally do is I am going to smile and think happy thoughts. And hopefully this DZ is faster because I'm at 3 minutes now. Some people, it might take 10 minutes. I don't have time for that. So we're going to try to make me think happy thoughts. Let's think. Puppies.
You are doing such a great job. I so appreciate your learning your style, and I just think you're awesome. You should just really be able to tell Brenda that you are ready to hit the road.
Oh, thank you.
Awesome.
That makes me feel very good.
Yeah. Yeah. Oh, did that help with the DZ0?
Not yet.
Okay, everybody has to send him happy thoughts.
No. Well, is everyone DZing? Is everyone doing this process at the same time? I hope you guys are all getting DZs, or you guys are all stuck in the same spot I am at right now. Yeah. So this one, the bottom jaw area, takes about 2-3 minutes, maybe 4 minutes. The middle area right here, exhaustively long. I mean, 10 minutes could take up to. So don't feel like, don't, this is a majority of the benefit is in the DZ0, right? That's the last 20%. That's the golden nugget of benefits from having a functionally improved nervous system. There's my DZ. Okay, right? And I didn't get a D. I got a DZ1 and not a DZ0. So don't lift up until you get a DZ0. That's and the thought process behind that is you want it to be so attuned in that area that the body understands that it's safe. There it is, DZ0. And now here's the clearest thing. I had it up to where I could barely feel a tingle, right? But now, when I open my jaw and my mouth, the entire region feels lighter. Not just that spot. It treats the entire region. You'll feel it throughout the body. So this is what I talk about why the 6 points are so important. Because it's more correlated to a lot of other areas than you recognize. And it caps off a lot of things. So that's the 6-point protocol. There's a cheat sheet on your forms on that T1, on that First Alternative Therapies T1 that has this written out for you very nicely, as well as just a quick guide on how to get it done over and over again. I recommend doing this on your friends 2 or 3 times before you try it on patients and yourself, just because you get used to it. So to recap, it's test. So test, initial reaction, D, higher number, write down. Test, initial reaction, D, higher number, write down. Test, initial reaction, D, higher number, write down. Highest D, DZ0, right? Okay, that's the 2-sentence, 3-sentence protocol. Very good though, very helpful across the board. Okay. And if people are still DZing, I'm gonna move on. So the trigeminal nerve route comes through that entire region, right? So when we're looking at those bottom 2 areas, you actually trigger right up in that area, that sensory root and motor root that comes through there. So it's very indicative if you're having TMJ problems. That's that trigeminal nerve line, right? That's the infringement you're getting there. So there's that written out. Take IRs at position 1, 2, dose highest IR, do SAM for 3, 4, 5, 6, take highest dose on phase to 0 or DZ0. There's a caveat. If you have equal dose numbers, then, so for example, let's say your initial reaction for 1 and 2 are the same. They both come back as 35. You gotta D them both and write them down. It's part of your future calculation then for when you DZ0. If you have D numbers that are the same. That's even more miserable. I say that because it'll extend your treatment time by quite a bit. You got a DZ0 both numbers, because that means that both of these main points are equally inflamed, right? So that's one of those things to think about. This is the cheat sheet. It's I think there's an updated one, but this is a very good one. You can see it. This one, actually, those spots, this one is not correct. Those spots are too low. That's interesting. Those spots are way too low. The spots should be right in here, not up here. That's right in there. It actually straddles the trigeminal nerve line straddles this upper, right below that cheekbone, right in here. You could push up and you'll feel a divot right in there. That's where you're trying to get to. Okay. So this is the long version of the coral whole body. You see how it has a grid? This is how we do the grid. I love how the version. So we go. I'm gonna need to bring my model back here now. Just give me 1 second. Let me get her. Because the goal of this is to do the same thing we did here with the 6 points and how we D both sides, and then we got the initial reaction for everything. We D'd each of the rows, and then we went back and DZ'd the highest one. Well, what do you think the spine's going to be? We initial reaction the entire spine as we go down. And then, so we initial reaction each row as we go, starting from the top going down. And each of those initial reactions, we D the highest initial reaction, write down the ongoing number. You keep going across the board all the way down. You're going to have a bunch of D's, right? Then you go into the neck area and you initial reaction from the top of C1 to C7, right? So you first go C7, then down, then you go C1 to C7. The reason being, it's kind of convoluted. The reason why you don't start at C1 is because C7 acts as a pivot point. So technically, the origin of the stressor starts at C7, and then you go and isolate back up. But so as soon as my model comes back, I'll show you an example of me doing a core whole body that way. And essentially what we're going to be doing, I wonder if we go into the mapping, is we mark the spine out using an alcohol swab. And you can also use your onboard electrode, but I wouldn't recommend doing that. Just use an alcohol swabby. It's like at 1 inch. That's all you can do. You can use Y bars too. You can use the Y bar to mark with a little black marker. That's fine. But you're essentially going to test an inch at a time. You're going to mark out the inch and write down. I usually write a letter next to it. So I like row 1, row 2, row 3, row 4. And then on my sheet of paper, I record as I go. And that allows me to, if I miss a spot or miss a number, I know where I'm at. You are using relax mode for this. Yeah, you're using relax mode. There are caveats of when you use RSI mode for this. It would be fibromyalgia, cystic fibrosis, full body issues where it doesn't matter if you are recovering or not. It's not gonna purr unless you give it a lot of energy. Give me 1 second. I'm gonna go make sure that she's not just hanging out in the back. I'll be right back. Any questions while we're waiting?
For the core whole body workout technique, can you please just briefly explain, simplify it for like clients, as in, offering it as a part of the session, like how we kind of condense it or break it down for the core whole body? And
Add-
also, does it have to include the face as well to complete it, or can it be either or?
it includes the face to complete it. You want to include the face. There's a very specific reason why you want to include the face, by the way. But starting from the first preposition, how do you explain it to customers? Very easily. I say, first of all, we at the center, our price point is we charge $200 for an hour of therapy. Is our price point we charge at for the whole body, and then we have them after they do the core whole body, we have them do a PEMF session and then a red light session, right? So it might be 2 hours of actual work that's done, but as a practitioner's time, it's only an hour. So that's what we charge at that rate. The way we explain to the patient or client what we're doing is we say, hey, wouldn't it be nice if I could find the worst spot in your central nervous system and then make sure that that spot is effectively working again? And they say, well, how would you get that done? Well, I'm going to measure each of your nerve sites, each of your vertebrae, all the way down your back, and we're going to measure how inflamed or what the impedance is, and then we'll go ahead and we'll work and treat and release the highest in each of those columns, and then we'll release the highest in each of those rows, and then we'll release the highest in the column, right? And that will provide for you a full body benefit. Every part of your spine will have essentially been realigned by this process without doing any chiropractic work, without doing any physical therapy. You'll see a shift in the actual spine. This is the cool part about marking it out, is we take a picture before and the line is straight. And afterwards, the line is crooked. Well, what happened? The spine adjust. So I'm gonna mark it down, and I'll show you how we mark it down. Let's get that. So let's bring you back over here. So I have a back. Okay, I go to C7. I sit. Head down. C7. I mark across. Oh, that's not going to work. We use eyeliner in the center is what we use. Like the little black eyeliner is cheap to take away. But you can use. No, I'm just using marker. For educational purposes, we sacrifice. Or she sacrifices. Okay, so I start at C7. I do a line, and then I do a 1. I do underneath, and I go all the way down. Sit up straight. I swear. This is why usually this process is done while they're laying down. To be honest with you, because you don't do a mistake like I just did, which is she's not sitting up straight, and no, I just got off the spine. There it is.
you go all the way to the crack, the coccyx. Oh. So we're not gonna write down there, but we're gonna mark. Yeah, that's not gonna be in camera. All right, so, and then I number it. Why do I number it? Besides the fact that it looks nice. I number it because I need to know where I'm at. And sometimes I get lost and I'm not as smart as I like to feel like I am. And and then I write down on my chart, on my, there should be a chart that is on that link list. I'll print one out right now for my sake so I can follow along what you got at home. This is what the chart looks like. It is coral body technique. I'll print this out. Go back to presentation. So what we do is we record the numbers as we go on this sheet right here. And on this sheet that you have, there's a client name. I'm going to put Olivia's name and put the date because scores change over time. So it's one of those cool things about tracking them when they work out or to do things. And then you'll notice that the top line is the neck. We're going to avoid the top line for now. We're going to do the, oh, where's the Y bar? Did I lose the Y bar here? There it is. Okay, we're going to do, so I'm going to start it off again, just like I did the short coral body. I'm going to power it off the spine. Tell me when you feel the tingle. Tingle. All right, lower it by 10%, switch to reactions mode. And then I usually set it down on my lap, the device, so I can read it easier. And while I have the chart, so it looks like that. And then I go down. I'm lefty, so I have to write with my left hand. I record with my right. So then I go right here. I go center, 28, left, 31, right, 30. Okay, the left one is the highest. 31 is the highest right there. And then I D it. Now it might take 10 to 20 seconds to D it. But because we're dosing the spine and the vertebrae as we go out, we're actually releasing the most inflamed spot in that row, right? So we're slowly working the entire spine out. Now we already cleared the spine, right? So now I got a 46. Okay, so then I write that in the second dot. So we see that we get something like this, right? Where we have the middle number, the second number, and the third number, and then the highest number, we D it, and we write it in that second box there. Is everyone following? Okay. So now we go down to row 2, right? We got 29, 33, 32. 29, 33, 32. And then we go back to the D. Now, the interesting thing about this is the core whole body process shows exactly what the short version we felt. If you're experienced enough, you don't always have to do the in-depth long version, but the benefit of it is there's zero chance you miss something with the long version, right? What was the rate and time?
and keep Z in. This is a problem spot for you. So. The what we charge is 200 for a technically a 2-hour session. The first hour is with a practitioner. Second hour is just laying down with passive therapies. So that's the bundle. Because I think once you release the spine, you do the core body, you get a lot of room for other complementary therapies to improve. So I get a D, that's a 52. Then we go down 36, 39, 36.
Just randomly asking, what would be like the names of these types of services? Because it's like when I try to present something as core whole body workout, you know, is there like a shorter form? That's
Yeah,
all.
so it's not the core whole body workout. Core whole body technique is what they call it as an educational standpoint.
Okay.
What we say is we call it a full body reset.
Full body reset. Okay, perfect. Thank you.
Yeah, and that's the D. That's what works marketing wise. Is that we're either recoding your body 34, 45, 42. And this is why I number, because I almost went to the wrong spot immediately, and now that I numbered them, I know I'm still on 4, so I don't miss it. Yeah, core whole body is long. It was a term developed back when, you know, the goal was to essentially, it's like the goal in Russian medicine and Chinese medicine was to sound wise and sage-like, but you know, technically what we're doing is we're just mapping out the spine and DZ and the big numbers, right? So it's not hard to do intuitively. 43, 57, 52. It's actually really not that hard to do intuitively.
How many sessions would they be consecutively? Would it be back to back, or is it okay to spread it out a month, every 2 weeks?
For what? For this process?
Every week?
So a core whole
For that, yes.
The full body reset can be done every month. We offered it at first. We offered it bi-monthly, so twice a month, or I think is it? Did you say bi-weekly or bi-monthly?
Depending on what they.
Yeah. And 23, so now I'm 6. And it's not, you have a diminishing means of therapy. There's that spot too, right there. I said it was. Yeah, look, it went instantly to 100. So the full body reset done once a month catches all the passive pervasive things that might be harming the spine and the body, I think. You can do it more. It's not going to hurt. You can clear the spine every day, right? You don't need to do a core whole body every day. You just do the quick version of clearing the spine every day. In fact, I recommend it. If you're, as a habit, such a fantastic habit. You won't have back pain at all. You won't have strain at all, right? D113.
And then the similar feeling of relief, especially when it's done on the back.
The training, the Avazzia. I mean,
Would
I'm
you
gonna
say
get
it's like a, I'm sorry,
Wow,
would you say it's like a light, airy feeling?
nice.
Here, let me.
Tell me if you were making a steroid, bring it to that thing on there.
Sorry, I don't know if I muted the right person, but the feeling. Wait, let me just make sure I don't lose track of where I'm at. The 45. So I like to say the numbers out loud, by the way, when I'm taking scores. Less likely to write down the wrong number. So what do they feel? What's going on? Light tingle, very relaxed, and validation, very validating. It's very funny that most of the time when a patient comes in, they're like, "Yeah, I knew that spot sucked, and thank you for telling me that I wasn't crazy. I thought that spot sucked because it was just a hidden like secret spot." It's like, no, that sucked for a reason, and you can show them. When we're done here, you'll see the pathing of why she has scores where she has, right? And like, what do you find? You find that example when when you do the process, right? So that it is, and do they fall asleep with you now? A lot of people.
Especially.
Oh, when you do the face part, yeah. So it's very relaxing. It's usually, man, you do not want a DZ there or D there. Seven, 52, 57. Oh, that's the reason why.
And you could share with the rabbi too how he was coming in a lot. Well, he was coming once a week with a poor whole body, and then he's able to walk.
Yeah. So there's also there's a good standpoint too that the more the essentially it's like the worse you are, the more important it probably is that you do it every day. So um, we had a client of ours who was he was like 80, he's 70s, early 70s, and but he had a open wound, and he had actually an 8-inch open wound on his foot, and uh, he had so much pain that he could not sleep, and it was hard to move him. And when we finally got a chance to work on him, it was excruciatingly painful for him to even get on the table. So we had him sit up in his wheelchair. He couldn't walk, and we did this process with him. For the first part of 2 weeks, we did it nearly every day. And his pain levels went from him crying himself to sleep to normal human being again, no pain. And then we went down from every day to twice a week. What clearly? Oh, technically it's red. Should be at the C7. See, this is why I can't tell stories while I do this. 46, 59, 65. On the 8. This is why I recommend you can chat with the patient while you do this, but make sure you look at the numbers. This is so important, the number on the side. That was one of my big benefits of telling like every practitioner I instructed, do this, do that, put the number down. Trust me, you won't lose track of it as much. But so we went from doing it every day to twice a week to once a week, and within a matter of 3 months, he was walking again. The wound on his leg had closed, and he was able to attend his daughter's wedding and walk her down the aisle. And this is someone who is on the brink of death. And just when you hear stories like that, and you just it's almost absurd, you know. Because I'd like
you know, I like to be a man of science, and I like to be 58, 62, 63. I like to be a man of science who can explain everything functionally and foundationally. And in that case, I was, you know, you could call it a miracle because it's close to it. But he had he had a really good caretaker. His wife was very attentive and focused on getting the job done. And she did a great job. She did a fantastic job working with him. And it reflects. He had, I mean, yeah,
What do you,
yeah, that was a case where he had an at-home device as well that he worked on himself all the time with too. But you know, you teach someone to fish, they can feed themselves, right? And that's the benefit of this technology is you teach them how to use it themselves, they're going to get results with it. 64, 53, 69. So the funny thing about Olivia here is she has not had a single D in the center column yet. So none of the center of the spine has been, because all of it is dimensional. It's all asystematic. She's not, the pain of her is not leaning forward or imbalance or pinching. All of it is stacking wrong, one side to the other. Okay, and then we go all the way to the crack. 56, 67, 61, all the way down here. You switched. Oh, right. Okay. All right. And then now that I've done the spine here, now we're gonna do the neck. So I'm gonna lift this up. And there's the upper and the lower is what we call this. We just get the top and the bottom. Between the two, we split it. So we go center 24, 36, 37, 36, 37. So right here, that side. Tell me when you feel the power. Now this might seem like a long process. We usually give about an hour for this protocol. Though, I mean, this can get done in 30 minutes. If they're healthy, the other thing is I have our patients drink water before. Like I hand them a bottle of water and say drink it before we do this therapy. She's dehydrated. I can already tell. What is going on with this thing? Tell me you feel tingle. You're very dehydrated, by the way. I don't know if you realize that. Yeah. Like a ton. See, that's, you know, she looks healthy, right? But now when we actually get into the meat and potatoes of actually treating, we're starting to realize, okay, you know, not a lot of circulation's happening in the neck. Maybe she's leaning forward or back or one-sided a little bit too much and straining the SCM because you can actually see the SCM popping out of the neck in response to this. Happy thoughts. There we go. See, as soon as you say happy thoughts, sometimes happy thoughts actually triggers the fun. It's like the funniest thing. I say happy thoughts, and then all of a sudden it triggers an interaction. Then we go on the lower neck, 32, 46, 41. So this is exactly what I said. Notice how the spots I said with the short version are the exact spots we're popping up with the long version. even though I cleared it with the short version, there's still an indicative problem with the long version, right? So this is why the long version is probably better than the short version. But is it 80% better, or is it 10% better? Is it 20%? What we find is the short version will get someone from a pain point of 6 to a 3 or a 2. The long version will get them from a 6 to a 0. They'll be out of pain by the end of the therapy. And that's the difference, is whether you're trying to reduce or you're just trying to fully uh, treat the area. GZ, so 72. Okay. Okay, so now that I have the you'll notice on your cheat sheet here, on your sheet, this is what this is what it looks like, right? So I have a bunch of rows of numbers that correspond to her back. On the side, there is the instructions for what to do next. So we're gonna follow it. So we marked the spine with the electrode, took the initial readings, IRs, did the dosage, did the neck, treat the highest IRs to a D. Yeah, include the neck and bath paradoses. Okay, treat the highest D and bring it to a DZ0. So in this row, right, I'm gonna look at, she doesn't have any D's in column 1. There's no problem in column 1 at all. It's all left and right, right? So where are her highest numbers? Her highest number here is right here at 5, right? And then her other highest number is right here at 6. So she has that force structure across here is her problem. Something is going on right here. She probably could use an adjustment, feeling from it, but most likely it's because her scaps and her arm usage are impeding in and making an indent there, right? You can see that indent as it's coming through, right? She's not supporting herself in the interior abdominals, which we can work with more, but ideally we treat the DZ there. So what we're going to do is we're going to DZ 0, 0.5 on the left here, and 6 right here. And that might take a minute, so we're just going to, so that's that. And so what we're doing is we, again, to reiterate and make sure we're on the same page, C7 to down, we mark, we take the initial reaction of the center, left, and right, we D the highest of the initial reaction, we write those numbers down, we go to the next row, and we continue doing that down. We do the neck, same process. Once we have all the rows of the ongoing reactions, the D's, we, in the column, whether it's the center, left, or right, we find the highest of each column. And we DZ0 the highest of each column. We are mathematically, we're going through the grid, we're finding the worst spots, both vertically and horizontally. Hence the grid that you see there. And we are treating that spot. Okay. So I got a 102. Then we write down the ongoing reaction once we get the DZ0. And this is going to matter later when we go back and we treat the highest DZ0 for 2 minutes with deep stim. Because, like I said before, what deep stim does is it just remaps the pathway and makes it better, right? We're finding a different pathway. Because whatever is going on there is just not working out long term. It's D. Any questions while we're waiting for her spine to clear? And by the way, interesting fact, you can actually kind of see on the video her spine is already shifted during this process. You see this tilt? There's a light tilt here. and a light tilt here, down here. Guess where all her numbers were? All of her numbers are stress right here, and stressing down here on the right side. And look where the numbers tilted against. They released that way, and they released this way. They released off the compensations that were higher. Which is cool, right? We can see the spine shift. This is how we address the scoliosis. This is, bar and none, one of the best therapies to do for scoliosis. This is how we did that. Takes a second, but it works. DC0. And lift up as soon as you get it. That was 116. Okay. So now it says on step 9, we can stimulate for 2 minutes the highest DZ0, right? Which in this case, it would be that area. If the last spot wasn't the last spot we DZ'd, let's say it was the left side or the mid side, then we would go back and do it. But if it's the last spot, you don't have to DZ0. You don't have to stim it because it's already reoriented and that's the primary area. You could, for good measure, deep stim it for a minute or 30 seconds. Depends on how extra you want to be. Is it the right thing to do? Yes. So I'm going to go back in and just deep stim it for a minute. Right. Are we facing a rule of diminishing returns for actual effect here? Yeah. I mean, if we're going to cut stuff to still save time as a practitioner, you don't need to go back over and do a 2-minute deep stim session on the spot. If you have spare time because they DZ'd really fast, yeah, do it. Because essentially it's like if you have the time, get it. But if you don't, you don't have to overdo it. Okay. Now, and then she's done. Now, you'll see that the 6 points are in the front. You can include the 6 points in it, just like you were asking before. On the 6 points, you do the 6-point protocol just like it says. If the 6-point DZ0 is higher than the back, and you end with the 6 points, you're good. If the back is higher, you got to go back to that spot, and that's when you deep stim it. Okay, that's just the process. And we're gonna keep going because I want to make sure that we get 5, and we're ending at 5:30, so we get 22 minutes to do the vagus nerve, which I think everyone should do here. All right, vagus nerve protocol is a great protocol. The reason why vagus nerve protocol is a great protocol is it's not a vagus nerve protocol. It is a SCM release protocol. The vagus nerve is a very large nerve. It is very pervasive throughout the body. It goes. I wonder if we have a picture of how far it goes, but it goes pretty damn far throughout the body. The vagus nerve actually here. That's a great image right there. The vagus nerve starts at up in the brain, goes all the way down, attaches to the lungs, the heart, the liver, blood vessels across the gut, the stomach, the pancreas, the interior intestine. It attaches to almost all of your organs. You could say it's part of your parasympathetic interaction or autonomic nervous system. It doesn't attach to, I think the things it doesn't attach to is hormone generating agents because it is itself a hormone generating agent or a governing agent for it. And if it gets stressed, the myofascial sheath around it tightens into protection. It causes cortisol production in tremendous amounts and creates inflammation across the body. How do we get that to relax? How do we get ourselves to relax? Well, by doing the little wings protocol. So you can actually see this is kind of like the written thing. Well, kind of went ahead of what it is, but you know, the vagus nerve interacts with your heart rate, interacts with your sweating, your temperature regulation. It works with the thyroid in many cases to do a whole bunch of different interactions. So you can see that, you know, they have therapies that they literally input into the body. I would not recommend that at all. Now, this technology makes that obsolete. You know, and we talk about why we're treating the neck in this area. The vagus nerve is right underneath the SCM in that area. It's actually right here in that column, right underneath the thyroid, right? And we're not going to treat right here. We're going to treat over here. Why? Well, because this muscle, when it contracts and releases, also contracts off of and gives the more room to the vagus nerve. And you get a correlative interaction with that vagus nerve that's positive. You're creating space for the nerve to function, and you're also giving passive stimuli, the love sensation to it as well. You're also retraining the stressor for it. So I think you can see this is Dr. Rick actually using the vagus nerve protocol here. I want to have Olivia come back here because I think that the best thing would be for me to show it on someone. I could do it on myself. I'll show you guys how to do it on yourself. So I think it's a good idea anyways. For now, let me make sure this camera connects back in. Good. All right, so take your device. How do you do the vagus nerve protocol? And what should you look out for while you're doing the protocol? Well, the first thing you should look out for is whiplash injuries. If someone has whiplash injuries, their neck is going to be hyper responsive to any stimuli, which is you're going to want to go very low and you're not going to want to jerk it up. You're going to be relaxed. So I'm going to take off my shirt for a second so it's easier for me to get to my neck. I have a little collared shirt here. Okay, so I usually start with the left side. It doesn't matter which side you start with, but a purist always goes left to right. The reasoning behind that, by the way, is the heart's on the left. And technically, exit out that way. Inter goes to the right, so you deal with the triage external, and then you come back to the internal on the right side. So, but you see how if I lean back, I want to go to relax. I turn up I put the device on my neck, turn it up till I feel a tingle, and then I'm gonna relax my neck. And I'm just painting. Just like we did when we cleared the spine. And while I'm painting, right, I'm feeling for any sticky areas. And making sure to release those sticky areas, because if I don't release these areas, it'll stop the vagus release, the SCM release, right? Additionally, if someone is tight in the armpits right here, and you notice that their shoulders are rolled like this, or if they're hyper-extended back, treat that real quick. Literally, it just takes a couple seconds. You just paint right here. You paint the interior. Go into the armpits real quick. Oh my gosh, that's very tight. I thought that'd be a little tight. So you paint a little bit right in here. Also, armpits are going to be more sensitive in general, so always be sensitive about that and turn it down if you're going to go in the armpits. Okay, that's the full pre-session for the protocol. Now I'm going to go on the left side, painted everything. I'm going to go on my left side, and I'm going to find the point while I'm on relax. I'm going to find the point where, against my will, I feel a tingle into my ear and I feel a jerking sensation in my neck. There it is. Oh, okay. So my spot, everyone's spot's different. My spot's right here. Right? Oh, camera. Right. And I want to relax. Right? Oh. Now, while I'm on relax, I switch to acute. And then I let acute run. And I'm feeling it in the tip of my ear. And acute's going to go on, and then it's going to go off. And I'm going to do 6 pulses on each side. Oh. And the whole time, I'm thinking about relaxing. So I don't want it to be too tight. So I have to consciously think, relax, relax, relax. You know what that does? It encourages the body to relax itself without outside interaction. Because as soon as the device stops stimulating, you think, gosh, it's so nice. And finally, and after the 6th pulse, you see my shoulder is going up and down. Now it's done. And now my shoulder, super relaxed, super light feeling. My right side feels so tight comparatively. That was actually really nice. I needed that. And that's the nice thing about this therapy. It's like, oh, okay, I definitely needed that. Absolutely. Can you guys hear me? All right. I hope I didn't hope there wasn't a difficulty with hearing. But so now I'm gonna do the right side. Okay, and we're gonna go to the right. We're gonna go back to relax. I use relax as a way to find the spot because relax is sensitive. If you're using acute to find it, it can sometimes it's really jerky. So I use relax first. I'm looking for a tingle to shoot up into my ear while also, and this is the key spot, while also triggering the neck to move. If I'm too low, this shoulder raises, but I don't get the tingle into my ear. If I'm too high, I get the tingle in my ear, but no interaction with the shoulder. The perfect spot is where you get the interaction with the shoulder and the tingle with the ear. That's the perfect spot. That's how you know you found the right spot. So there it is. Oh, okay. Sorry about the sound effects. Eep. Now, if it's too intense, turn it down. If a patient says, oh, that's a little intense, say, okay. And you can tell I'm enjoying it because I'm starting to drift off. And then last one. Now you see how my neck just turned instead of, that's something that's very key. My neck turned instead of my shoulder. That's a whiplash indicator. So I definitely had something happen on my right side where my neck wants to turn to protect. That's the same concept as if I was about to go through a door, I'd rather use my head instead of my shoulder. So that's the whiplash causation problem. All right, Olivia, you want to do the vagus nerve? I want to show you. I want to show them someone else doing it real quick. Side. Yeah, I'm gonna. No, I'm gonna do it on you. Spotlight. Yeah, so right here. All right, so face that way. So with someone right here, so what I do, I power, I turn it off all the way down to the low, I put it on her, I say, tell me when you feel a tingle. Okay. I'm going to turn it down a little bit. Now, for the neck area, for this vagus nerve protocol, you might want it a little high. You don't have to turn it down to 10%. Because what you want to see is you want to see when that happens right there. You see that pop? We're getting an immediate pop. We're going to lift up. I like doing this right here to make sure I find the right spot every time. Put it back, lift down. And so we know we can trigger the right spot there. So I'm going to, again, I don't want to cheat here. I cleared her neck already, but technically the protocol is clear both sides of the neck. So we're clearing both sides of the neck. Okay, and then we go in and then trigger the spot. Now we got the spot. We go to acute. And it's going to tighten and then release. Tighten. Oh my gosh, I can't. Release. Sorry, I'm trying to make sure that they can see it. Tighten. Too much? Okay, that's another thing. If a patient tells you, hey, it's a little high, turn it down. Come closer. Come right here. I want to get that right angle. So we're going right in here. I actually cut it by half the strength already. And then 2. And then 3. Okay. 4. And then 5. Cool. And you know how I know that's the right spot and how it's a powerful spot? I went from 70 strength with her to 7. So I kept on lowering it down. So it actually, the Avazzia improves the ability for sensation. All right, go ahead and other side. Yep. Wonder if I could lift up this. So again, I go here. Hold this for me. I'm trying to hold the camera while I do this. I go. Whoop. Let's see if I can get a nice bird's eye view. Go ahead and turn up the device until you feel a tingle. Okay. We go down until we're straddling the SCM right in front of the SCM. There's a spot. I'm going to lift up. I'm going to relax. I'm going to lift up on it and then put it right back to it. I'm getting the patient calm, accepting of that tingle. So I go right back to it again and boom. Now we know the spot immediately every time we get that same link. Now we're going to go to acute while I trigger it the last time. You're on it. And then you can lower it down a little bit if it's too high for you. And this is on acute. We're on 4, 5. And you're not doing this. It's the device doing this, right? Yeah. I have to. Well, people who are watching from home, it might look like she's just shrugging her shoulder, like she's like, "Why are you doing that?" And then you're done. And that's the vagus nerve protocol. It feels like your shoulder is basically new now, right? Not that your shoulder is actually new. It's just you're not fighting the same stressors that you would be otherwise. Thank you for your modeling. Okay. So I'm gonna reshare. Okay, so what does that do? Well, it one helps calm the anxiety. Less anxiety is always nice. 2, it helps with PTSD, helps with stressors, right? And this is the protocol written out for you, and you have that on your slides that you have to download if you ever want to write it down. It's also in a cheat sheet, and that cheat sheet we sent you. So this is not incredibly complicated. So okay, this goes with the troubleshooting of the devices. Are there any questions before we get into the troubleshooting stage? Any questions? Okay. So, device is on. How do you recalibrate? Okay. You recalibrate it by holding the plus and the minus. Do we have any questions? I'm sorry, someone just muted. Nope. Okay. Good. Just making sure. All right. We recalibrate it by holding the plus and the minus, and then turning the device on. And then you'll see the screen will say recalibrating. So if you did it right, plus minus, turn on, and then you release, and it'll say recalibrated. Okay. It's pretty nice. If you press the center button and turn on the device, it'll say your serial number. Serial number is also on the back here. So those are how you recalibrate the device if it is the case that you're having problems with either readings are coming back weird or wonky, you don't trust them. There's always a way to, we'll flash on screen a few times and go back to relax assess during a treatment. Make sure the batteries are changed out. That's when you recalibrate the device for certain. If your screen's ever flashing, that either means that it's losing connection, the batteries are too weak, or you've lifted up. Usually the flashing is that the batteries are too weak. The second note of there is don't use reusable batteries for that exact reason. The output's too variable. You have new batteries. It is that. Send it in. Yeah. The easiest way. So again, these are $4,000 and $5,000 devices. If they're under warranty for 3 years from purchase, right? So and we do a very good job of that warranty. We honor that very seriously. You can send it in. I always if you're on the edge of that 3 year, I would say send it in anyways and just come up with a reason. Make sure that it's working, but send it in so that way they do check it before it goes outside the 3-year warranty. If it's outside the 3-year warranty, if it's a fixable problem where it's just like the motherboard or or it just requires some resoldering, the maximum they charge you is $295. If there's water damage in it, then it's not recoverable. For some reason, the way that the board rusts, it damages the board permanently. Is the caveat there is that the rusting effect of it and the transistor gates for it as well. But continuing, so you additionally can do multiple things when I'm turning it off. Yeah, so you're gonna get the so if you go ahead, so while it's on, now this might be a caveat. If you have a ProSport 3, I believe you can just hold down the plus and minus and it'll say calibrated. Yeah, it'll say calibrated too. So go ahead. If you can cast, go ahead and hold down the plus and minus while it's on. And if it says uncalibrated, it means that there is actually a physical wire that's not connected properly in there as well, which it might say. I'll tell you right away. Okay, so there's a whole bunch of different things. It says calibrated. Okay, so it should work fine. Then you should send it in. Yeah, that's something. Okay, so if it's off and you press the minus sign and you turn off on the device, there's a 30-minute timer built in to the device. Oh wait. Okay, this is an old back route. All right. Minus and off is the sound off, so it doesn't beep during therapy. Plus and off off and on is the timeout. So it doesn't run out. It doesn't auto turn off after 30 minutes. If you, right. So that's what I was saying. Hold down while it's on. So turn on your device, hold down the plus minus, and it'll say calibrated. It'll calibrate, recalibrate. Okay. I got that wrong. It's if you turn on the device, if you have the plus, minus and plus button and you turn on the device, it'll go sound off, time off. Okay. That's the thing. Yeah, so this is also, yeah, this goes over the warranty covers a lot of things. Water is not one of them. Water is the worst. Yeah, so if we're talking about things that you can do that you can get a lot of benefit out of this class for, and we're coming right up to the end, so we'll go into the complementary therapies and the talking about the benefits section, but you can place pads on your abdominals and go to each mode and experience what each mode does. Your abdominals are very absorptive. Your psoas is very your psoas is not going to be influenced by most of the modes. So it's good to experience and get a sense for what they feel like, and practice the initial readings and things. Make sure you paint your body. That was the goal. That was one of the goals. Let's see. So these are all the different devices too. So we talk about the blue, the RSI, the MedSport, and examples of accessories that help. Right. Okay. And Treasures at home protocols for, yeah. Okay. So, when we talk about complementary therapies, anything that hydrates you, would be better. So we have the Avazzia machines that we just got in that are going to hydrate you. Anything that improves the overall metabolic rate for the body is important. So that would be your PEMFs. Red light therapy helps with nitric oxide production. That helps as a system as well. Anything that improves the Trinity. If you can get better sleep, Avazzia sessions are going to be better. If you exercise and improve the body, the Avazzia is going to work better with you. If you eat better, the Avazzia is going to be better with you, right? Eat, sleep, exercise will change your life. We know this. If you can't eat, sleep, or exercise because it hurts, the Avazzia gets rid of the pain so you can restore your normal daily health. That is the catch-all, right? You cannot have a good, healthy life without doing the Trinity. So the Avazzia will never replace that. But if you couldn't do the Trinity, the eat, sleep, exercise, because of pain, because of problems, because of traumas, and now you have the Avazzia in your life, guess what? You have the keys to the kingdom. You get a chance to reenact the Trinity. So, and if there's any message to you is be friendly with the painting on your own body, be proactive with the process, and and work with other complementary techniques and technology to improve your overall health, because being proactive is going to be very powerful. But I hope that through this presentation, you gain confidence with the technology, you gain an understanding of the science behind how it works functionally and physically, and you feel confident in talking to other people about the technology. I hope that you learned a couple protocols that you can utilize. I know we spent a lot of time on the theory and mode, but I hope you understand what modes there are, what you can do as far as the toolbox and the technology. And I hope that you feel comfortable using the technology in a way that makes you have more faith in a alternative to the allopathic medical route of the prescription of drugs. I think that the Avazzia has a wonderful place within the healthcare system of helping patients, helping clients, helping practitioners manage their pain and mitigate all sorts of different issues in terms of problems across. And then I'll open this up for Q&As if at the end here. If there's any wild questions you want to target before the end, I'm more than willing to answer the next 10 minutes, 20 minutes. But that's the class. That's a wrap. Thank you all for being here. I really appreciate you guys joining me for this experience. If you are a rep and you have a unit, have a Pro Sport, have a Pro Sport Ultra, and haven't filled out your 2024 rep agreement, you should email in to get a new agreement so that way you can distribute this technology and you can work with this technology again. If you are new and didn't know you can be a rep because you own a Pro Sport 3, you should email in just to have it as an option because you can distribute this technology to your patients and make a good amount of money. It's a bonus income. Additionally, there are a lot of new technologies we have on there. We're not just Avazzia. We have, hydrogen therapy for injection and inhalation and for breathing. We have the QRS and other PEMF attachments. We have the red light now. We have all of Therasage's products as well as a rep. So you really get access to a whole bunch of different positive, non-adverse reaction based medical therapies through First Alternatives, which is the goal, right? We want to find the best solutions that we can find for whatever we're doing in the practice of it. Okay, so the questions, I think we'll pause the recording here and then we'll go into the questions from there. So I appreciate everyone from being here and I hope you have a wonderful day.